We are live.
Yeah, I think we are live. Hi everyone and we are back. अभी थोड़ी देर पहले आपने सुना मुझे और सिराज सर को. We had just come back from the center. वहाँ से हमने लिया the first impression from all of the students and now we have with us Dr. Sudha ma'am, the OG Sudha ma'am. Ma'am आपका क्या feedback था? What kind of a feedback are you receiving from the students और अब तक क्या समझ में आया है about the exam?
समझ में तो इतना ही आ रहा है that paper was like moderate. There was a decent number of PYTs. PYQs नहीं थे. They were not exactly the same questions. लेकिन जो previous years topics थे उसी में से काफी doable questions आए थे. But there is also a feedback from some students कि कुछ questions तो बिल्कुल ही नए थे. And they have not been asked or read or taught anywhere. तो वो होता ही है हमेशा. Like there is a set of questions which are untouchable. बट लार्जली जो बच्चा सिंसियरली पढ़ के गया है PYQs PYTs जिसने किए हैं ही सीम्ड दोज किड्स सीम्ड हैप्पी. उनको एटलीस्ट वही तो अभी मैसेजेस जितने आए हैं बच्चों से ऑफ्थाल में लाइक PYTs थे, इमेज बेस्ड क्वेश्चंस थे, कुछ क्वेश्चंस दे आर सेइंग डायरेक्ट थे. बट स्पेशली PSM का फीडबैक थोड़ा सा मिक्स्ड आया है. दैट PSM में कुछ क्वेश्चंस बिल्कुल ही नए थे एंड दे हैड क्लू अबाउट व्हाट इट वाज. दे वो रिकॉल भी नहीं कर पा रहे हैं. शायद वो टॉपिक कभी मतलब इसके पहले कभी पूछा ही नहीं गया है ऐसे.
Yes, yes.
शॉर्ट सब्जेक्ट्स में द फीडबैक इज शॉर्ट सब्जेक्ट से शायद थोड़े कम क्वेश्चंस थे. द मेजर स्ट्रेस वाज ऑन मेडिसिन, सर्जरी, OBG was good according to most kids. So I think overall it was okay.
Someone is writing PSM
स्टूडेंट्स
था
के
ही नहीं.
अकॉर्डिंग आपका जो ऑफ्थेल के जो क्वेश्चंस थे उसके बारे में क्या एनालिसिस है आपका? ऑफ्थेल का कैसा सिचुएशन रहा?
ऑफ्थाल तो ठीक था मुझे लग रहा है. सारे क्वेश्चंस तो मिले नहीं है लेकिन जो डेंड्राइटिक अल्सर का क्वेश्चन है, जो केरेटोकोनस वाला क्वेश्चन है, वो सब तो रेगुलर वाले ही हैं. जो हमेशा VKC वाला क्वेश्चन, यूवीआइटिस
तो ये तो टॉपिक ऐसे हैं जो बार बार पूछे जाते हैं ना. जो
पूछे जाते
डेंड्राइटिक
हैं.
अल्सर वाला जो ग्रीन वाली
हाँ,
इमेज है ना,
कुछ
वर्नल
बच्चे बोलते हैं.
केराटोकंजंक्टिवाइटिस वाला क्वेश्चन था. प्लस एक
करेक्ट.
क्लिनिकल क्वेश्चन जो बच्चे बता रहे थे कि पेशेंट फ्रॉम राजस्थान ऑक्यूलर कंडीशन के साथ आया. तो राजस्थान अगेन हॉट क्लाइमेट, ठीक है, डस्टी क्लाइमेट, और उसका आई थिंक टेरिजियम की हिस्ट्री थी और बोला इसके मैनेजमेंट के लिए आप क्या करोगे. तो आई थिंक अगेन दिस वाज आल्सो वन ऑफ द
हाँ
सर्जिकल क्वेश्चन दैट वाज
बस
देयर.
एग्जैक्टली वो जनरली कैसे व्हाट इज द बेस्ट ट्रीटमेंट फॉर टेरिजियम ऐसे करके वन लाइनर पूछ देते हैं. इस बार उसी को थोड़ा सा घुमा के मतलब अल्टीमेटली द क्वेश्चन वाज द सेम ओनली. ऑफ्थाल सारे क्वेश्चन आए नहीं है. कुछ 4-5 जो मैंने सुने हैं दे आर लाइक PYTs ओनली, मे बी नॉट PYQs बट दैट्स द फीडबैक. सो आई हैव अ फीलिंग दैट द पेपर वाज great. We cannot call it easy for a student जिसने प्रिपेयर किया है उसके लिए. I think it would have been doable. Now let us see. अब
मैम एक थोड़ा जो फीडबैक मुझे मिला अबाउट ऑप्थाल दैट वाज लाइक मोर इमेजेस देन एक्सपेक्टेड. आर यू आल्सो गेटिंग द सेम फीडबैक?
हाँ वो there was an image apparently from keratoconus, there was an image from HSV keratitis, एक शायद रेटिना वाला इमेज था. तो 4-5 क्वेश्चन में 3-4 तो इमेज ही हैं. तो आई हैव नॉट गॉट ऑल द क्वेश्चंस बट दे आर नॉट वेरी अनकॉमन इमेजेस. ऐसा नहीं है कि पता नहीं कहाँ से आ गया टाइप का इमेज नहीं था. दे आर लाइक स्टैंडर्ड इमेजेस ओनली. Generally the trend of the question has been towards more clinical. वो तो पिछले 1-2 साल से.
इनफैक्ट जो नॉर्मल बेसिक फिजियोलॉजी वाले क्वेश्चन थे उसको भी क्लिनिकल करके ही पूछा गया था सारे स्टूडेंट्स के लिए. जैसे चेन स्टॉक ब्रीथिंग वाले जो क्वेश्चन थे, या अगर किसी क्वेश्चन में उनको ENT पूछना था तो ENT वाले क्वेश्चन भी थोड़े क्लिनिकल करके पार्ट 1 में पूछा गया था. वैसे अगर देखा जाए अनुषा में माइक्रो क्या पोजीशन था आपके अकॉर्डिंग?
माइक्रो तो
क्या
सर
है
माइक्रो का फीडबैक तो यही है कि बहुत डायरेक्ट क्वेश्चंस थे. तो अगर कोई क्लिनिकल स्टेम दिया भी था तो उसमें ऐसा बज़वर्ड था कि दे वर एबल टू क्रैक. तो माइक्रो का बहुत अच्छा रिस्पॉन्स ही आ रहा है. कोई परेशान नहीं था विद माइक्रो. ऑन द अदर हैंड पैथ में हिमेटोलॉजी क्वेश्चंस थे तो जो पढ़ के गए थे बच्चे दे वर क्वाइट हैप्पी अबाउट इट. बट जिन्होंने छोड़ दिया दे वर क्वाइट सैड अबाउट द इमेज पार्ट ऑफ पैथोलॉजी एंड स्पेशली फॉर medicine. Somebody said कि the examiner got obsessed with ABG questions. So I think Santosh sir will be able to throw more
फार्मा
light
का
on
लेकिन
that.
कैसा था सर? How was it about pharma? I think
Pharma.
pharma, I think
मैम
we don't have.
फार्मा के जो भी क्वेश्चन हम लोग ने डिस्कस किए थे अपने यूजुअल आरआर में और यूट्यूब वाले सेशन में, मोस्ट क्वेश्चंस वर फ्रॉम देयर। जैसे यूजुअल मलेरिया वाला जो क्वेश्चन था, तो जैसा कि अभी थोड़ी देर पहले एनालिसिस वाले सेशन में मैं बोल रहा था कि मलेरिया पहले पूछते हैं लोग आसाम से कहाँ है, फिर पूछा कि राजस्थान से आ रहा है आप क्या करेंगे, अब इस बार पूछा मणिपुर से आ रहा है क्या करेंगे। कहने का मतलब ये नॉर्थ ईस्ट से पूछ रहा है क्या करेंगे, मिक्स मलेरिया वाला क्वेश्चन। कुछ डायरेक्ट मैकेनिज्म ऑफ क्वेश्चन वाले क्वेश्चन थे, जैसे मान लीजिए फिनास्टेराइड का हो गया, या जो यूजुअल क्वेश्चन टॉपिक हम लोग ने डिस्कस किया, फॉर एग्जांपल हाइपरकैलेमिया एंड एस इनहिबिटर एआरबी वाले टॉपिक जो थे, कॉल्चिसिन के मैकेनिज्म ऑफ एक्शन। तो ये ऐसे ऐसे टॉपिक थे कि यूजुअली हम लोग बच्चों को डिस्कस करते रहते हैं, बोलते रहते हैं भाई ये पढ़ो इससे आएगा, है ना। डाययूरेटिक वाले जो क्वेश्चन थे, जैसे कि आपका लूप डाययूरेटिक्स हाईली ऑटोटॉक्सिक है, आउटर हेयर सेल को डैमेज करता है। तो फार्मा तो दोनों पार्ट में था। पार्ट वन में 6 7 8 क्वेश्चन यूजुअल बच्चों का कहना था, और पार्ट टू में यूजुअली काफ़ी क्वेश्चन थे जो इंटीग्रेटेड थे मेडिसिन के साथ, और इनफैक्ट ओबीजी और ऑफ्थेल के साथ भी काफ़ी फार्मा क्वेश्चन इंटीग्रेटेड था। तो जैसे किसी बच्चे ने बोला भी है कि फार्मा तगड़ी थी मैम, तो डेफिनेटली फार्मा वाज हैविंग अ गुड वेटेज। और अब तक जो मुझे मिल पाया है, आई थिंक 22 23, तो मतलब मैं क्वेश्चन देख रहा था कि 22 23 क्वेश्चन है। और कुछ बच्चे बोल रहे हैं कि सिम्बलोफेरॉन वाज देयर इन इमेज, तो आई थिंक आपका वो इमेज था। कुछ बच्चे बोल रहे हैं कि क्वेश्चन डिस्कस करना है क्या, नहीं नहीं बिल्कुल क्वेश्चन बिल्कुल आपको डिस्कस नहीं करना है। हम लोग यहाँ बस टॉपिक बात कर रहे हैं कि क्या टॉपिक से
हाँ,
क्वेश्चन आ रहे हैं, क्या
हाँ।
एग्जाम का पैटर्न है, ट्रेंड डिस्कस कर रहे हैं, एंड क्वेश्चन डिस्कस बिल्कुल नहीं कर रहे हैं। क्वेश्चन
कुछ
आप बिल्कुल
बच्चे
भी।
सर, कुछ
हाँ
बच्चे सैड थे कि वैक्सीन्स नहीं पूछा, देवर एंटिसिपेटिंग वैक्सीन स्पेशली इन पीएसएम,
हाँ हाँ।
बट उन्होंने यही बोला कि वैक्सीन नहीं पूछा एंड दे वर क्वाइट सैड अबाउट इट। तो इसलिए भी इनको
ठीक
लगा
है
कि
मैम, जो
पीएसएम
बच्चे
में क्या
गायनी में
पूछा।
खुश रहते हैं उनको गायनी वाले एरिया में ही खुश रखते हैं। गायनी से खुश तो बच्चे, वैक्सीन नहीं आया तो अब उसके लिए रोना क्यों, ठीक है नहीं आया नहीं आया, पढ़ के तो गए थे ना, अभी नहीं
हाँ,
काम आया
हाँ।
और नीट पीजी में काम आ जाएगा।
डीपीजी में काम आ
करेक्ट,
जाएगा,
हाँ,
एग्जैक्टली।
जो बच्चों ने पढ़ा है वो कभी वेस्ट नहीं जाता
वेस्ट
है
नहीं
ना।
होता है, कभी भी
हाँ,
नहीं।
यू आर
बट
नॉट एक्चुअली preparing for examination. The life is not only about the examination. You have to crack the patient's diagnosis. So you
करेक्ट।
studied for that. Examination just a part of it. तो जो नहीं अभी काम आया वो आगे डेफिनेटली काम आएगा।
so I think, sir, we can now start with the recall because
Right. So
we
we are
have a
here
long
just to
session.
announce that we are starting the recall, and the
And,
order of the recall will be first. We'll be starting from Ranjit sir. I'm sure Ranjit sir is ready,
I'm
and he'll be
sure he
coming
must
up
be
with
ready.
his pathology question. And we just want to give a quick disclaimer कि हम topic discuss कर रहे हैं. At any point of time, if you come up with another version of the topic that is being discussed here, feel free to give your opinion in the comment section, and we'll be more than happy to incorporate it.
हाँ, and the
Right?
final जो consolidated recall है that we will
हाँ.
be releasing soon. ये तो देखो सर, आज बच्चे इतने टायर्ड होके आए हैं, उसके बाद उनसे जो
अभी तो
हमने
बच्चों को थोड़ा
सुना
रिलैक्स करने
उसके
देते हैं,
हिसाब
एब्सोल्युटली।
से हम रिकॉल बना रहे हैं. दिस इज जस्ट टू गिव अ फील ऑफ द एग्जाम
ये
और
फर्स्ट लुक है, फर्स्ट लुक है,
yes,
ये दिस इज
that's
द
all.
फर्स्ट
But
लुक ऑफ
of
द
course, all
एग्जामिनेशन।
options will not be possible. Second, there is of course a disclaimer कि exactly वैसा question नहीं भी हो सकता है जैसा हम बोल रहे हैं. We'll try to assimilate the proper question and come back with a proper recall. But this is just to give a feel so that that's the first look
किसी
of the
स्टूडेंट का क्वेश्चन आया क्लिनिकल वेटेज कितना था, तो मोर देन 60% क्लिनिकल
या
क्वेश्चन थे। मतलब इवन द सिंपलेस्ट ऑफ द क्वेश्चन दे वर एक्चुअली आस्किंग अबाउट द पेशेंट। सो फॉर एवरी क्वेश्चन देयर वाज अ डिस्कशन अबाउट अ पेशेंट।
let.
करेक्ट।
So I
राइट
think now we can hand it over to Dr. Ranjit.
राइट राइट।
Take it over from here
Yes,
and then.
Ranjit sir, the mic is over to you. Please continue with pathology, followed by the other subject. We will continue.
Thank you, sir. Thank you, ma'am.
Thank you.
Thanks a lot, sir and ma'am. Hello, guys. How are you? Hope you're doing good. So let's start with pathology. After that, Jazi sir is ready with dermatology, which sir is ready with gynecology, and one by one will follow, right? So I'm just going to rapidly go through like some questions which had come in pathology. I'll not give you the. I have framed a question as well as 4 options. Might not be the same, but the buzzword and the right answer we'll definitely discuss, right? Ready? So let's start. This was a repeat question. I'm sure most of you must have given it right. I'm not sure whether it was a history there, but I'm sure everyone knows that Marfan syndrome mein, you will have a mutation in fibrillin gene or FBN. So anything is fine. Whatever was there in the option, FBM1 or fibrillin1, both of them are okay. Both of them is the same one, right? Just give me a second. Okay, fine, perfect. If there's any discrepancy, please put in the comment section. We'll bring up with the PDF so that you will not have any discrepancy once the PDF comes, right? The next question. Okay. So some students said that there was a history of a testicular mass with an image, right? So this testicular mass and image of seminoma was definitely an older repeat question. The same thing came with clear cytoplasm, with lymphocytes and septa. The answer is going to be seminoma. If it was in the ovary, it is going to be dysgeminoma, right? Any doubts in this? Did this question come? Yes, no, maybe? Put in the comment section, right? Hope I'm audible, right, to you guys? I hope I'm audible. I should be. Okay. Let's go to the next one. Okay. There was a question. Many students said there are lots and lots of slides in the hematology. One was IDA, thalassemia, like, and also AML, acute myeloid leukemia, blast bhi hai, right? Perfect. It was AFP negative, HCG positive. Manu, if it's HCG positive, like 10 to 15% of seminomas will be HCG positive. Not all of them, right? But the microscopic finding will tell the thing, right? HCG positive tumor, testicular tumor can be choriocarcinoma, again, very rare. Seminoma also can be HCG positive, right? A simple case of an iron deficiency anemia, a slide, microcytic hypochromic is a simple one of IDA. There was also a question on target cells. Target cells, if it's there, if thalassemia was there in the option, let's go with thalassemia. Thalassemia will be the option, fine. Okay, AFP negative tumor is by default seminoma. AFP positive means it could be yolk sac tumor. That also has was a question, right? We'll recollect that as well, fine. It's fine, Abhishek. It's fine. It should be right. Okay, there's a question. Please tell me, was this an image-based question with target cells or just a question like target cells in seed in which of the following, right? If it's an image or be it just a theory question, answer is to be thalassemia. Whenever you see target cells, the first thought has to be thalassemia. Yes, it can also be seen in iron deficiency anemia. It can also be seen in sickle cell anemia, but the answer has to be thalassemia. Fine. Perfect. Let's go to the next one. I'm quickly running through just to make sure this and this came, right? Might not be the right question. The frame might be wrong, but you know the answer. That's the whole purpose of this recall. Burkitt's lymphoma and the translocation was asked. Few students said CMYC was asked. Few students said translocation was asked. If it's translocation, it's 8, 14 or anything related to 8, right? It's always Burke 8. 8th chromosome, 14, 2 or 22, whatever it is. If it's a gene asked, it is CMYC or MYC proto-oncogene. Fine. Okay, next one. Okay. A student said that there was a question on CML and the treatment was asked. So either Santosh sir can talk about it or Siraj sir can talk about it. If it's a diagnostic history of CML and if the targeted therapy was asked, it has to be imatinib or any other tyrosine kinase inhibitor. Dasatinib, ponatinib, any of the tyrosine kinase inhibitor should be the right answer. Fine. Anything related to that should be the right answer. Done? Okay. Perfect. Marker of neuroendocrine tumor. There are two markers asked this time. Neuroendocrine tumor was simple. Chromogranin A or synoptophysin, whatever was the option, that's the right answer. One more was a slightly twisted question, but that was also an older PYQ, but just slightly twisted. We'll look at that soon. Fine. Enchantress, what is the pathology of translocation? Which means it's an increased tyrosine kinase if you're talking about it, or if it's Burkitt's lymphoma, MYC proto-oncogene overexpression. Fine. Which question was not there, Abhishek? Okay, the CML was not there. Let's ignore that. Fine. Done. I think chromogranin was there. Was chromogranin there? Yes, no, maybe. Let me know. Students said a history of Men syndrome or a familial history of thyroid cancer, something of that. If it's targeting men, it has to be men 1. If it's targeting men 2, it has to be red. So you have to tell me if it's men 1 or men 2. If it's pancreatic parathyroid, I'll go predominantly to men 1, which is menin gene. If it's going to be your medullary carcinoma thyroid, then men 2, it has to be a red proto-oncogene. If it's men 2, men 1, it should be your menin gene. Please remember, men 1 is menin and men 2 is red. Fine. Got it. Got it. If it's men 1, it's menin gene. Men 2 is red. Please don't confuse that. Fine. Okay. There was a history. Some say that 3-week history, duration of fever, fatigue, and also there's a clue saying that peripheral smear had 60% blast. If 60% blast was there in peripheral smear, it has to be an acute leukemia, myeloid or lymphoid. There's one image with OR rods. If there's an OR rod, by default, it has to be a myeloid leukemia. And 60% blast by default makes it an acute myeloid leukemia, right? It's an acute myeloid leukemia. That should be the right answer. Fine. Which one, Vishnu? Mismatch type? The men syndrome was mismatched. Okay, it was an match the following type. Then men 1 is menin, men 2 is your red proto-oncogene. If you tell the other two, let me know. I need a little bit more information on this. Was this the only question? And was this the only information given? because factor 8 of 50% is normal. This is not hemophilia. Please understand. Up to 40% is normal factor 8 levels. Only below 40%, I'll think of an hemophilia. Less than 1% severe, up to 6% mild, moderate, and up to 40% is mild, right? Anything above 40% is considered to be normal factor 8. So if factor 8 level is 50%, it is not hemophilia. If you have considered hemophilia, that's not the right answer. If it's only a bleeding tendency and an inherited bleeding tendency, the best answer will be von Willebrand because it's the most common one. Okay, if it's Ristoston, it's straight away I am going to go for von Willebrand disease, not a factor VIII deficiency. Hemophilia will never have 50% factor levels. It will be very, very, very less. Fine, it's von Willebrand. Great, Nitish. Thank you, guys. If it's Ristoston, we have to go with von Willebrand disorder only. Fine. Okay. Was this a question? See, this is what I said, a slightly twisted question. If I ask the question as, what was the marker for schwannoma? Most of you have answered S100 because we have discussed that. Schwannoma is a nerve sheath tumor. Be it a peripheral nerve sheath tumor, malignant, benign, it has to be same S100. That will be the answer. It is S100, schwannoma. S100 is a marker for anything which comes from neural crest. Melanoma, Schwann cells, schwannoma, everything S100 is a marker. Fine. Okay. Next one. This also some students said it's a match the following. Some said it's a classical history of Hashimoto with an anti-thyroid peroxidase antibody. If it's an history of Hashimoto, I'm going to go to anti-thyroid peroxidase antibody. If it's matched the following, TSH receptor will be for Graves' disease. This is going to be for anti-Hashimoto thyroiditis. Okay. Fine. This should be the most probable right answer. Okay. Great, Vishnu. If Anthony A is mentioned, it's straight away. The answer is going to be S100. Neuroendocrine tumor, Vishwa, the answer is your chromogranin. Fine. Okay. Perfect. Next. This was also one more question. A testicular tumor with Schiller-Dole bodies, which was a tumor marker. The answer set is alpha-fetoprotein. If it's a yolk sac tumor, was a straight away yolk sac tumor question, one-liner, or a scenario-based question, you should be able to say yolk sac tumor, answer should be an alpha-fetoprotein. Okay, Abhishek, if it's match the following, we'll come up with a PDF with all the right matches, but your anti-thyroid peroxidase antibody Hashimoto and TSH antibody Graves is the straight ones. Fine. Okay, perfect. So this question had a lots of confusion. Perimenopausal person with an abdomen mass or an bleeding. Uterine wall mass and perimenopausal bleeding, and an image was given. See, this is purely based on an image. Quite a few students say it's an endometrial stromal tumor. One endometrial stromal tumor is not something which is very commonly asked for an undergraduate. There has not been many questions in endometrial stromal tumor per se, image based in the past. You have to tell me, was it a little bit spindle like this with lots of mitosis? If so, I will still prefer leiomyosarcoma, because leiomyosarcoma is something which can be asked for an undergraduate. If it's very, very, very small, if it's very, very, very bland, small, no mitosis, no pleomorphism, then I'll go for endometrial stromal tumor. Tell me which was it, if it's 1 or if it's 2. See, if it's 2, then I will prefer a leiomyosarcoma. If it's 1, if it's bland, if it has no mitosis, no pleomorphism, little bit rounded cells, not a elongated cells, I'll go for an endometrial stromal tumor, right? Okay. Fine. Done. And few more questions which are not complete. I'll leave to Jesse soon. You don't require options or question for this. Crumpled tissue paper tumor has been discussed multiple times. You must have written cautious. There are few more questions on storage disorders with Jambulkar sir will definitely come and talk about it. And there's a question on PNH. CD55, CD59 absent or deficient is going to be PNH, and the treatment has to be eculizumab. Fine. Upper wala hai. If it's the upper wala one, then the answer has to be an endometrial stromal tumor. If it has any pleomorphism, we go for leiomyosarcoma. Fine. Okay. So these are the few questions which was recollected from the students. Hope we'll have a better recall once you give all the inputs. We'll send a PDF to you guys very, very soon. Jesse sir, next over to you.
Thank you so much, Ranjit sir. Just a minute. Yeah, I hope my screen and the audio is all fine. That was a pretty quick recall in pathology. Thank you so much. And now let's continue with dermatology. I hope the questions in dermatology was not that difficult, right? Because in the first paper, I got to know that you got few questions, which usually doesn't happen, and in the second question as well, the second paper as well. So shall we begin with derma questions without wasting any more time? Yeah, thank you for confirming, Prem Kishore. There was one question which I guess came in the first half, where a truck driver was mentioned who presented to you with a painless ulcer, but this ulcer was in the oral cavity. Can anybody confirm it? It was something similar which was asked. Truck driver, painless ulcer in the oral cavity. Yes, thank you so much for confirming. So what is it? Is it a aphthous ulcer? I don't know the remaining options. I just formulated few of the options. But what could be the right one? With the clue of a truck driver, a painless ulcer in the oral cavity? Yes, it should most likely be primary syphilis, right? Primary syphilis. Because thank you, Prem Kishore, for confirming. Because you know that in primary syphilis, we had discussed that usually what happens, a patient may come to you with a genital ulcer, which is usually a painless ulcer. But also remember, in our notes, we have already clear-cut mentioned that the most common site of an extragenital chancre can be the lips or the oral cavity, right? So this is going to be the oral cavity. So done. Thank you so much for confirming. So that is all about this first question. Now moving to another question. Now this question I got different types of recalls, right? So there was some question which was mentioning about buboes in the bracket. So please correct me if I'm wrong. It probably should be a genital lesion with inguinal lymphadenopathy. Buboes, right? The moment you see this word buboes, so what can be the diseases where you can see an inguinal bubo? So it can be either chancroid or it can be LGV, right? It can be chancroid or LGV where buboes can be seen. And the second part of the question, was it asked like which chlamydia trachomatis serovar is responsible? So मैं सोच रहा था secondary होगा नहीं secondary नहीं primary syphilis ही है ना the first question. Yeah. Okay, so here not B, because please remember that in chlamydia trachomatis, so it would be causing this LGV, like lymphogranuloma venerum. So this would be the case scenario that we are talking about. So in LGV, it is going to be L1, L2, L3. But please confirm if they asked very specifically, because I remember that somebody was saying D to K was mentioned, because in D to K, this is usually seen in urethritis, isn't it? Or cervicitis, etc. in chlamydia. But whereas L1, L2, L3 serovas should be with lymphogranuloma venerum. Yes, sir, server पूछा था. Thank you so much for confirming. In that case, it should be L1, L2, L3. If very specifically they ask you, the answer should have been L2, because this is the most virulent, or it is the most common type as well. Okay, the most virulent or the most common should be L2. That should be the answer. Burkitt lymphoma, I guess you're mentioning about what Ranjit sir had discussed a few while ago, right? So now we will see another one. So this is what we have discussed. So this was also there in the notes, like a chlamydia, L1, L2, L3, it is caused by LGV, right? So now let's see one more question. It is an easy one. I'm sure that most of you must have got this one right, because patient is presenting with a 3-day fever followed by a centripetal vesicular rash. And some of you were mentioning that an image was also given. Can you please confirm if it was an image-based question? So if it was an image-based question or not? Yes. So in this case, vesicular rashes, है ना, after a few days of fever, so which means there is some prodromal symptoms followed by rash. And if in case in this image which was given was a pleomorphic rash, जैसे you can see a macule, papule, vesicle, like the rashes in all the stages. If that was seen, yes, So here the right answer should be chickenpox. Vesicles on trunk, scalp, and face was given. Thank you, Sabha, for confirming. And I guess all of you are agreeing. So this is one sure shot, which I guess most of you should have cracked it, right? Second paper, kaisa laga, my dear FMG friends? I guess second paper is the topic of discussion now, right? So let's see. So this is about varicella, pleomorphic eruptions, and that should be chickenpox. Now let's see another question which was asked. This was from leprosy. Can you please confirm if the question mentioned a borderline tuberculoid type of leprosy, which means a BT type of leprosy patient presenting with an inflammation of the existing lesions, and what was the appropriate management? But chickenpox was not in the option. Sabha, agar chickenpox nahi hai, the option should be varicella, na? Pleomorphic was mentioned. Okay, I'm just going back. If it is not chickenpox, if you can see varicella in the option, like many of you are saying varicella, if varicella was there in the option, that is the right one. Okay, thank you for confirming. Okay, so now let's see this one. What is this? What are we talking about? We are talking about lepra reaction in this question, right? So we had discussed about lepra reaction, type 1 lepra reaction, type 2 lepra reaction. And you can see that this is a table where we have discussed about type 1 and type 2 lepra reaction. So this question was asked even in the last FMG exam, right? So here you can see BT, borderline tuberculoid type of leprosy, will show a type 1 lepra reaction. And what is the treatment? The treatment should be prednisolone. So can you just confirm regarding the options as well? Same question. Thank you so much. So in that case, here the correct answer should be you always have to continue on the multi-drug therapy, never discontinue, right? And then start the patient on prednisolone as well. Acha, thalidomide nahi tha. So chalo, theek hai. This option was not there. Not yet. But anyways, you should, what is the most important is you should remember what is the correct answer, right? The correct answer should be to continue the multi-drug therapy and start prednisolone. Image was given in this question. Acha. So this was another image-based question. What was the image? Can you quickly at least describe? It will help us to make a clear question later. Definitely you will pass, Asra. Okay, thank you. Image was given. Let's see what was that. So chalo, let's see the next question now. A patient presented with a painful genital ulcer. Again, same topic, hai na? Lot of questions have come this time from the genital ulcer disease or the sexually transmitted infections. Now, was there a question on painful ulcer and a painful lymphadenopathy? What is a causative organism? So here, yeah, no image. Pass ho gaya. Done. What is it? So when you find both are painful, ulcer is also painful and inguinal lymphadenopathy is also painful. Can it be treponema pallidum? Matlab, can it be syphilis? No, right? Because in syphilis, it's a silent disease. There is no pain in the ulcer. There is no pain in the inguinal lymphadenopathy as well. So option B says Sinha. Very good. So Haemophilus ducrei should be the correct answer, which is the causative or which is the reason behind chancroid. So this was Haemophilus ducrei. I guess, yeah, most of you are answering it as option B. Thank you so much for confirming. So I guess that is another easy question if you have gone through the genital ulcer disease, isn't it? Painful ulcer, painful lymphadenopathy. Leprosy may, sir, exacerbation of previous lesion. Abhishek, because in leprosy, what happens is the existing skin lesions, they become inflamed. So maybe in the question they mentioned exacerbation of the previous lesions. Perfect. So it fits into the correct thing itself. Shall I continue? So now going further, another question was a patient with rheumatoid arthritis presents with a progressive ulcer, painful ulcer in the leg with a violaceous border. But a painless ulcer. Which question are you talking about, Manish? So can you just confirm if, because what I got to know is you got an image of a lower leg ulcer and there was some blackish hue towards the border of the lesion. So I don't know if it is a similar image or not, but was there a mention about rheumatoid arthritis or any disease or like irritable bowel disease or anything was mentioned? Yeah, all of Fatal Sam, Aru Purush, Prem Kishore, all are answering as C. So I believe that there was a question on pyoderma gangrenosum as well, right? ठीक है. नहीं मनीष, अगर शैंक्रोइड वाला क्वेश्चन है ना, तो the ulcer should be painful because most of them are confirming that it was a painful ulcer because chancroid is never going to be painless. Yeah, primary syphilis was another question. Primary syphilis was over the oral mucosa where you got an ulcer. So maybe Manish is telling about the painless ulcer in the oral mucosa. That was primary syphilis, which question we have already discussed. Yes, pyoderma. Chalo. Diabetic diya tha. Okay. Was there any mention about rheumatoid arthritis or something? Language यही था. ठीक है. So I'll just note down that diabetic patient was mentioned. Okay, I'll just note down that as well. ठीक है. So now let's see. After that, I have only collected these many questions, but just before entering this session, I heard that there was a question on Madura foot. So can you just confirm what was the question that was asked regarding Madura foot? Like, okay, black color image tha. Okay, no, diabetes was mentioned. Yes, rheumatoid arthritis was there. Okay, I'm getting multiple things. But okay, if it is a diabetic patient with rheumatoid arthritis, agar rheumatoid arthritis is mentioned, it can be a neutrophilic dermatitis. So answer should be pyoderma gangrenosum, right? Chalo. Yeah, Madhura foot, they asked you regarding the treatment. है ना? So if there was a mention about large swelling in the ankle region, sinus openings are present, discharging grains are present. In all those cases, if it is more likely to be fungal, then the treatment should be with antifungal, right? Even though antibiotics was also mentioned in the options, I believe. Acha, hyphae in the drain was mentioned. Very good. So if there is a mention about hyphae in the drain, matlab, what was discharged, if there is hyphae, then there is no doubt it is caused by fungus itself. So it should be eumycetoma we are talking about. Eumycetoma, not actinomycetoma. In that case, we'll have to go for a long-term antifungal therapy. Acha, surgical with long-term antifungal was given in the option. Okay, black KOH, Tamil Nadu was mentioned. Perfect. So in that case, even if there was surgical debridement, that also can be done together, right? So antifungal plus surgical debridement is what I'll lock. Okay? Thank you. And one more thing before we wind up, I got one message saying that there was some image in the hands where there was some kind of a butterfly kind of a lesion in both dorsum of the hands. And options were lichen planus, psoriasis, some granulomatous disease and all. So does anybody recall seeing such a question? Yeah, option was too close image. Yeah. Can anybody tell me before we go to the next faculty for the next topic? Lichen planus. Okay, so if there was an image in the dorsum of the hands, Hannah, then it can be because psoriasis usually all of you will recognize based on the erythematous plaque and silvery white scaling. But here it can be, from what I understand, Manish is saying, it can be lichen planus, annular lichen planus. Okay, so there can be a question on lichen planus as well. Yeah, dorsum of the hands. A vein-like structure in the exterior extensor surface. Was tinea corporis also mentioned in the options? Because Kusum says tinea corporis was also mentioned. Okay. So there was an image. Okay, this was another image-based question. Image-based question where a lesion was shown over the dorsum of the hands and it was looking like annular lesion or something. So most probably it should be a lichen planus is what I believe. Okay. And once we get all those details, we will definitely come with much more clear MCQs later. Okay. So I guess that is it. What we had in dermatology. I believe the questions in dermatology was not that difficult. Many questions came from sexually transmitted infections and of course from other topics as well. But I hope all of you have managed. So, okay, one question about sun exposure affecting the face, hand, etc. Okay, I'll just note it down. Probably we will cover it. Dermatomyositis, rash in the DIP, photoeruption, dash in the rosum, no joint involvement, LP 5 piece. So I cannot understand. Scabies was also there. Okay. So we'll see. We'll come with a complete recall and stem later. Okay. Because it was a very quick recall. And I guess I will pass on the dice to the next faculty. I guess it is Dr. Prasanvit sir for gynae and obs. I'm sure sir will have a lot of questions to discuss. I'll just see if sir is there. Yeah. Person had red inflammation of the skin due to scratching, especially at night, and family history. Acha. So if you had such a question, then yeah, scabies is a likely possibility. Scabies baby face is also being asked. Okay. So seems like there were pretty much questions this time from Dharma. Thank you. So that is all about dermatology. We'll definitely come back with a detailed discussion later. So over to the next faculty. Thank you. Like, ma'am, are you
Yes,
taking
sir.
up
Can you
next?
hear me, sir?
Yes, yes. You're
Yes.
audible.
Yeah.
Over to you, ma'am. Thank you.
Thank you, sir. Hello, guys. Can you all hear me? So, guys, how was your exam? Ortho was, I think, a bit easy. Most of questions are from the marathon. Hope you're all done really good. So let's discuss ortho, fatafat. So the first one, the axillary nerve. So what was the question about this? I heard the question was somewhere related to mechanism of the injury. So which injury will result in this particular axillary nerve damage, or what was the question? Yes, ortho was the best. Yes. Thank you, Siddesh. Thanks, Ayushi, for confirming that. So yes, you all know the answer. It is usually the shoulder dislocation or the proximal surgical neck of the humerus fracture, right? That is the axillary nerve injury. Is that right? That was the question. Yes. So if the answer was axillary nerves, and the two mechanism of injury, one would be your shoulder dislocation. Obviously, it should be a traumatic shoulder dislocation, right? Trauma. And the second one is your surgical neck of humerus, right? The surgical neck of humerus fracture, as I have shown this in the X-ray, the surgical neck of humerus fracture, right? So if they have asked the name of the nerve, it is axillary nerve, right? Trauma, shoulder dislocation, the most common nerve to be injured is axillary nerve. Yes, if this is the image which was asked in the exam, so the most common nerve which is involved is again the axillary nerve. Yeah, anesthesia is that also indicates your axillary nerve because it is the area over the deltoid insertion, right? This regimental badge area. Yes, so the answer here is surgical neck of humerus fracture was given. And then the answer is axillary nerve injury. Confirm. Yes, done. Yes. Yes, very good. Most of them have confirmed. Yes. Then the second one. The second one, it is somewhere related to the trauma again. So there was a football player, very, very common injury. A football player was playing and he had some twisting of the injury, right? So twisting of the knee injury, and the result was damage to which particular ligament? It is ACL, right? Anterior cruciate ligament. Yeah, surgical neck of the humerus. Yes. So the anterior cruciate ligament is the answer. Confirm this also. Yes. See, listen, axillary nerve, sensation on the lateral aspect of the shoulder, surgical neck of humerus, all this related to axillary nerve only. Okay. Okay. Yes, not football. It was kabaddi. Okay. Then it is the Indian version question. Okay. Kabaddi player. Right. Okay, fine. Kabaddi player while, okay, fine, while flexed got struck, and this is the injury. So even it was a football player or kabaddi player, any twisting injury, hyperextension injury will lead to damage of the cruciate ligaments, right? Specifically the anterior cruciate ligament, right? Okay, fine, the kabaddi player. So the answer is anterior cruciate ligament, fine. Yes, the second question. And what is this? The third question, what I came to know is about the dashboard injury. And I've told you very specifically, whenever it is a dashboard injury, it is a complex of injuries, right? So complex of the injuries, what is that complex? So mainly it is the posterior dislocation of the hip, right? And there would be patella fracture, right? And then there would be your PCL injury. So what was the question here? Flexion was mentioned where? In ACL or in this? Arjuman Sayed, flexion was flexion was given in what? In the knee question or the hip question? Yes, okay. If it was something related to dashboard injury, so the answer would be posterior dislocation of the hip, right? So here again, the knee will be in flexion, right? Both the hip and the knee will be in flexion. So there would be hip flexion and the knee flexion will result in the posterior dislocation of the hip. Yes. Yes, car injury, dashboard injury. So posterior dislocation of the hip is the answer here. Okay. Yes, sometimes the hip dislocations will also be associated with the acetabulum fracture. So what was the question? What was asked? Whether they was asking you about the acetabulum fracture or they were asking you about the posterior dislocation of the hip? Yes, flexion also will result. Flexion of the knee will cause the damage to the ACL. Yes, there would be flexion of the knee. Okay, so dashboard injury. Okay, whatever might be, it would result in fracture of pubic symphysis, acetabular fracture, along with posterior dislocation of the hip. Okay? Yes. Then what was this about the osteomyelitis? Oh, if the options were posterior dislocation of the hip, acetabulum fracture, and anterior dislocation of the hip, right? So if the answer, if the question itself was telling you about dashboard injury, then it is usually posterior dislocation of the hip. Okay? Okay, if the question was related to dashboard injury, mostly the answer would be posterior dislocation of the hip, because dashboard injuries specifically will result in dislocation of the hip. Was the dislocation clearly seen on the X-ray? Yeah, if the dislocation is there, it's posterior dislocation of the hip. Okay, that is the answer. Then what is the osteomyelitis? Next one. Osteomyelitis, so they would have given you some history of fever, something like that, raised ESR and raised CRPs of the kid, right? And usually, remember, in acute osteomyelitis, usually we don't see anything except for the periosteal reaction. So there would be a newborn formation, which I have been trying to show it in this particular X-ray on the screen. So that is what is given. That's it. So the patient will have fever. Yes, 2 months of history. If it is 2 months of history, then we have to think. Okay, 2 months history is again a chronic condition. Okay, if it is 2 months and if there is fever, raised ESR and CRP, then it would be chronic osteomyelitis. But to say chronic osteomyelitis, on the X-ray, you will specifically see some features. Like you will see the sequestrum, you will see the involucrum. So was that given? Okay, there was no ESR and CRP given. Okay, fine. Fever was given. Fine. There were two months with fever and pain, right? And what was the X-ray? What was the X-ray like? Yes, we are done with the posterior dislocation of the hip. That would be the answer. Okay, so now in the chronic osteomyelitis, you will see patient a fever with pain with 2 months of history. Yes, if the sequestrum was there, if you see something like sequestrum, the dead bone, then it is chronic osteomyelitis. Adamantinoma is again different one. Okay. Okay, fine. That is about osteomyelitis. And then what is about this? The synovial cord. Yes, I came to know that there is Codman's triangle. The answer is osteosarcoma. So whenever there is Codman's triangle, if image was given or it was asked as one-liner, the answer is osteosarcoma. So that is sorted, right? Yes, if sequestrum is given, then it is chronic osteomyelitis. Yes, okay. Then what is this about synovial chondromatosis? So multiple loose bodies you see in the knee joint. This is synovial chondromatosis. Yes. Was this the image given? So they will tell you again, there was a lot of loose bodies which are present in the knee joint, right? So what was the question about the synovial chondromatosis? For Quadman's triangle, there was no osteosarcoma in the option. Akshata Sinha was that for the Quadman's triangle? Yes, if this is the image which was given, so the answer here is synovial chondromatosis. So you will see multiple loose bodies like this. So there will be multiple. Okay, fine. So this is also done. And what about this question? So there was some elbow fracture which showed that there were loss of sensation in all the fingertips. So if this is a complex elbow fracture which would damage both the median and the ulnar nerve. Okay, it is a complex injury where there is an involvement of the median and the ulnar nerve will result in loss of sensation of all the fingertips. Yes, so this is the answer. So whenever there is loss of sensation, what about this? The elbow fracture. So if it was only medial nerve, it was only median nerve. Median nerve would be only the first three fingers, right? The index finger and the middle. These sensations of the index finger is mainly regulated by the median nerve, and the sensation of this little finger is by the ulnar nerve. So if it is yeah, if it was a lateral epicondyle fracture, you all know it is the tardy ulnar nerve palsy, right? If it was a lateral epicondyle fracture. Okay, if it was a lateral epicondyle fracture, then you all know it was a tardy ulnar nerve palsy. So they are telling it was being treated by the quack. So it is the tardy ulnar nerve palsy. If it was a medial nerve, If, okay, they asked you about medial condyle or lateral condyle. If it was a lateral condyle, then it is your tardial nanopalsy. But in that, only the little finger sensations would be lost. If it was the medial epicondyle and then treated by the quack. So this could result in compartment syndrome also, right? This could result in compartment syndrome. And then the effect would be on the median nerve, right? So that will get back whether it was a medial or the lateral condyle fracture. But remember, if the sensations of all the fingers, then it is like the claw hand. Complete claw hand is median plus ulnar, right? Done. Then osteosarcoma, we have discussed that the Codman's triangle. So Codman's triangle is seen in your osteosarcoma. Yes. So if it was medial condyle fracture and treated with quack, something like that. Or if it was a supracondylar fracture with cubitus varus deformity. Okay, whatever is, if it was the medial condyle or the supracondyle, then it is usually the median nerve. But if they have asked you specifically all the fingers, then mostly if you want to mark one best single answer, that would be the median nerve. Okay, if there is a combination of median and ulnar nerve, then you can mark median plus ulnar nerve. Okay. Okay, osteosarcoma, yes, we are done. Codman's triangle is osteosarcoma. Ewing's, there were question on Ewing's, right? What was the question on Ewing sarcoma? It was a one-liner. Image was looking more like a supracondylar injury. Yeah, then it could be median nerve. But if AIN is there, anterior introitious nerve is there. Okay, we will get back to that. I will just recollect. I will just ask few more students and I will get back with that. Don't worry about that. What was about Ewing's? So Ewing's, whenever you want to mark about Ewing's, then it is the diaphysis injury, right? It is the diaphysis which shows. So Ewing sarcoma is, again, you can see the onion peel appearance, right? It is the onion peel appearance. What was given about the Ewing's? Okay, it was image-based onion peel appearance. And it is similarly like the osteomyelitis. If the history was given, again, there will be raised ESR and raised CRP. Yes. Okay, if it was Ewing's, mostly in the diaphysis region, it would be, yes, okay. Ewing's is image-based, right? IBQ. Okay. Yeah, sometimes if it is a moth-eaten appearance, this moth-eaten appearance can be both in case of your chronic osteomyelitis or a tumor. Chronic osteomyelitis or a tumor. This you have to depend upon the biopsy. Okay. Okay, but to see again chronic osteomyelitis or if it was in diaphysis, so now the diaphysis plays an important role. Diaphysis is mostly towards Ewing's, but chronic osteomyelitis is mostly towards the metaphysis, right? Infections is mostly the metaphysis. So then you have to be very much sure about that. The Quadman's triangle was given as an image based or it was given in the wordings? Okay, fine. So these are the questions mostly from ortho. Yes, some yes, something has to be mentioned about the medial epicondyle, what we have discussed. supracondylar fracture, that will get back to you. And then this onion peel appearance, you have to be very sure whether it is in diaphysis or the metaphysis. If it was in diaphysis, then it is probably the answer would be Ewing sarcoma. Okay, if it was mostly in the metaphysis, but Codman's, when it is mentioned, Codman's triangle is nothing but again a periosteal reaction, right? So it is a periosteal reaction. It is most commonly seen in Ewing's, right? Periosteal reaction, it is seen in Ewing's. Yeah, moth-eaten pattern can also be seen in Ewing's as well. So mostly I think the answer would be Ewing's here. Yes, if it was diaphysis, mostly the answer would be Ewing's. Any questions we have missed out? So when it is 2 months of history, usually in chronic cases, patients doesn't come with fever or raised ESR or CRP. Only if it is acute, you will see all this. In chronic cases, you will see discharges. So there would be sinus, discharging spicules, and the X-ray. So X-ray, it could be a moth-eaten appearance or the sequestrum, as we have discussed. Okay, onion peel appearance. One more question was there. So that is Ewing's. So there is one more hand picture, spina ventosa. Okay, fine. So that is spina ventosa is nothing but it is TB hand. So whenever you see TB, in case of spine, it is spot spine. In case of hand, metacarpals is involved. It is spina ventosa. Okay. Yes, spina ventosa is again TB, tuberculosis of hand. Yeah, we have discussed fracture of humerus. What was the question? Fracture of humerus? So I think most of you have done, most of them have been discussed. Yeah, especially the age of the patient will be discussed by the forensic. And Codman's triangle, yes, it is. Codman's triangle is mostly the periosteal reaction, right? It is the elevation of the periosteum. So that depends upon whether it was seen in the diaphysis or the metaphysis. If it was mostly in diaphysis, it is Ewing's. If it is a metaphysis, we can think it could be some sort of infection. But chronic infection, mostly you will not see Codman's, but what you see is the sequestrum. That is the diagnostic for your chronic osteomyelitis. Okay, that's done. Spina ventosa. We have done no TB. Yes. Anything else, guys? So hopefully I believe that you have all done really correct. So we will get back with the supracondylar question. That one question we have to get the answer. Okay. Yeah, fracture of humerus, we have discussed that. That is the axillary nerve. MRI spine, what was the question, Pranav? TB meningitis. Okay, that will be discussed by the medicine again, TB meningitis. Okay, fine. So the next faculty will be ready. Thank you. No, osteosarcoma will not show any osteolytic lesions. Yes, okay.
Oh boy. Hi guys, how are you everybody? And great to see. I hope we are all ready with our excitement to tell all the recalls live. I think the number of recalls we are doing on multiple forums on the WhatsApp, and all my friends who are sending me, it gives me so much of pleasure to tell you that whatever we teach regularly keeps coming in the exams. And I always, before I do this recall, I want you guys to understand the importance of sticking to the core basics. Nobody has asked you what is WHO telling, what are the latest updates, and what has come in the Royal College and American College. Nothing has come in any of the subjects. So all core basics will come in the exams. And those who are seeing this live and those who are going to see this in a revision before the next exam in July, it is a very important advice that please stick to the core basics. All right, what is done in the medical colleges, and that is what is coming in the exams. They seldom ask you the latest updates. If at all they have to ask you the latest updates which has come 3 months back, it is going to be asked only about the diseases which are prevalent in the country, like something like corona, or what is happening and what is the latest best management of corona, because it's currently we are suffering with that kind of thing. Otherwise, stick to the core basics. All right, so yes, hi everybody, and good to see all of you now, and we'll start with the discussions. We'll take the first question. First question was, in India, pregnant women do not eat which fruit due to a misconception? A lot of interesting recalls I got. So yes, a lot of pregnant mothers do not take, you want to tell me the answer? There'll be some delay. I think I'll tell you the answers. I'll keep reading your comments as they keep coming. So yes, the misconception is for the favorite fruit called papaya. Yes, papaya is that one fruit where they keep thinking that if you take papaya, it's going to cause an abortion. Look, nothing like that happens. I have had enough patients ever since 1996. I'm, with obstetrics and gynae, and God bless. And I have given papaya to almost, maybe 1,000 patients. Nothing happens because of papaya. Only the papaya seeds are abortifacients, and no pregnant woman will have papaya seeds. In fact, I think even non-pregnant women don't have papaya seeds. We know that very well. So, guys, this one you got it correct. I know each one of you who's had a family member who was pregnant would have been told, don't take papaya, Yeah, but that's the love and affection of the mother-in-laws, right? They like to keep, they like to keep the next of the generation healthy. So, right. All right. We'll get into all of this in some other forum. What are you guys saying? Hi, everybody. Please say papaya, papaya. Okay, fine. Let's move on. Okay, bluish discoloration of the cervix in the pregnancy at 8 weeks. What is this sign? Come on, guys. I was telling you about this Chadwick sign so many times. I kept telling you, please do not get confused about the place where this is seen. And whichever forum I've taken this class, including, the live forums, of course, in PW also, we had so many recalls. And every time, please, if the cervix is blue, the vagina also will be blue. And this is meant specifically for the cervix. So Chadwick sign for the cervix. I don't know the other choices because these are the choices which, people have given me the body of the question and the answer. Nobody's given me all the 4 choices, so we just cooked up the other choices. So don't ask me to explain the other choices right now. We'll do the discussion on some other forum when you are coming for the next exam. All of you writing this exam, you have passed, I'm very sure. The kind of paper which came this time, I'm sure all of you passed. So this is for the people who are seeing this as a recorded session. Okay, you got it correct. Yes, Chadwick sign, everybody. Okay, आगे बढ़ते हैं. A woman has rectal bleeding every time she has menstrual cycle. No rectal bleeding otherwise. What is the diagnosis? So this is, all these choices, again, they're all cooked up. Only choice you have to look at is endometriosis, because cyclical bleeding, every time she has menstrual cycle. So it is related with menstruation. I have taught you about vicarious menstruation also. I've taught you that if the menstrual glands, the endometrial glands find their way into the lung, they find their way into the nose. They can be periodic bleeding from these sides, like periodic hemoptysis, periodic epistaxis, and sometimes these are not extragenital, because you will see the deposits of the endometriosis in the pouch of Douglas, and they can be deeply infiltrating into the rectum also. So when there are rectal endometriosis, then also a woman will have this periodic bleeding. Whenever she has periods, she'll have bleeding for 4-5 days, and then it'll stop. So yes, all of these things also cause rectal bleeding, but I'm sure the surgeon friends will tell you much better about those causes. I'm not even attempting to go that side. Endometriosis is what they are trying to ask you. Guys, she has a rectal mass. Rectal mass. Yes, if you do a PR, the rectal mass, if you do a PR, you will feel the mass. If there's a deeply infiltrating endometriosis, you can feel a nodule on the rectum. So that's all right. Yeah, that's fine. Rectal mass can be there. Why not? Definitely. And see, what is the punchline here? There is periodic bleeding. That's what is the punchline. Periodic bleeding means it is it's true with the menstrual bleeding. So nothing else will explain that. If she's having menstruation, then only bleeding, none of these other causes will explain that. So yes, there will be a rectal mass. Why endometriosis will not have? This is classical. What do we do in a case of any woman who's coming to the OPD? We do a per vaginal examination, then we do a per rectal examination, and we also do a PVR. We do a PVR. What's a PVR examination? Per vaginal and rectal examination. So one finger in the vagina, one finger in the rectum, and between the fingers we feel the rectovaginal septum, and that will have nodularity. So many times in a case of endometriosis, yes, you will feel a rectal mass in endometriosis. Who says you will not feel? So don't get worried. No. Colorectal cancer was there in the option. Don't worry. Periodic bleeding colorectal cancer mein nahi hogi na. That will not happen. So I mean, if you're going to go for rare things, then I can't help you. Definitely endometriosis. Periodic bleeding from the rectum is classical endometriosis. Again, core basics, guys. Do not go for rare presentations of things. Classical. Okay, let's move on. Nodular feeling. See, nodular feeling. Somebody is telling me, broken angel is telling me the right. You're my angel. Okay, you're my angel in distress. All right. Okay, fine. This is endometriosis, guys. Periodic bleeding. और कुछ नहीं आगे बढ़ते हैं. What does the following ultrasound on a woman with pregnancy test shows? Pregnancy test positive show us? Yes. What is this sign showing you on the ultrasound of the uterus in a pregnancy test which is positive? What is this showing you? Is it showing you normal placenta? No, it does not look like cystic like this. Is it a missed abortion? No, you will have to see a fetus to say that. Partial mole, well, an ultrasound, you will not be able to make out a molar pregnancy, a partial molar pregnancy so easily because it looks like a fetus with a placenta. So it generally looks like a baby with a placenta. It looks like a missed abortion partial mole. So you will not see partial mole anything like this. Yes, this is classically complete mole. It is a no, it is not partial mole. Those who are right, partial mole, no, not at all. The colon more pelvic plane during menstrual cycle, but bleeding not particularly during menstrual cycle. Jyoti Viresh, you'll have to send me that question, okay, in the chat, in the live chat, not in this one, not in the live chat. I mean to say, when we finish this session, after that, just send this question to us, and or on the PW forum, or if you were my student in whichever live class, you can send it to me on that group also. Right. So let's move on. This is definitely a complete mole. This is a snowstorm appearance. Yeah, again, मैं कह रहा हूँ ना, yeah, they will ask you only the straightforward question. They are not going to trouble you. They are not going to trouble you with the vague presentations of common diseases. They'll ask you common presentation, common diseases, because you have to pass the MCI exam and you have to pass the NEET PG exam. You have to know the outright basics of all the 19 subjects. So there are so many outright basics that once you know those, then you become a specialist and then a super specialist. So they are not going to ask you vague presentations of common diseases. You should know the common presentation of common disease. ये तो सीख लो पहले, know the basics, then you do the updates. Cervical insufficiency, okay. I don't know what was the question, but cervical insufficiency, they said there was a patient aborting, but the language didn't come to me. Why don't you, while I do the other questions, can you just tell me about the question? Can you just properly write me the question? I'll go to the other questions. A woman in labor is undergoing augmentation with oxytocin. She has spontaneous rupture of membranes and suddenly develops fetal bradycardia. Fetal bradycardia. Okay. Now, see, I have told you many times, bradycardia is different from distress. If anybody has a heart rate between 120 to 160, we say it is normal, and less than 110, a lot of people say less than 100, WHO especially, and more than 180 is distress. So less than 100 would be bradycardia. So if there is bradycardia, we have to do something urgently. Whatever stage of life the baby is, we have to do something urgently. So that's why continued oxytocin infusion, definitely not. Tocilization observed, could have been done. Could have been done if it was a a patient at 6-7 centimeters and you're trying to do a normal delivery. You could have been done, but this could have been done kind of questions will not come to you. So immediate delivery with intrauterine. No, I don't like this word. I just saw the immediate delivery is the answer. Whatever is the choice, just forget it. Take the baby out and resuscitate the baby, because this bradycardia, baby will be compromised. So the Apgar at 1 minute and then at 5 minutes should be good. So 5-minute Apgar, if it is good, then the baby will make it. So immediate delivery and resuscitation. If there was cesarean section, likely cause, cause kya hai? Options are wrong. Okay, likely sudden decompression after ARM. Yes, cord prolapse is the only thing which came to my mind, but I was surprised that this option was not there. So yes, I'll keep it in mind that you are asking me cord prolapse. I'll be doing some more revisions. Yes, we'll try to come out with the better choices. Let's see where and when we can do that. For the time being, yes, cord prolapse is definitely a cause of this happening. So that's good. That's good. On examining a woman oxytocin augmented labor, the fetal head is felt 5 by 5. That is, the head is not the rule of 5. The rule of 5 means the head of the baby is still not in the pelvis. We keep dividing. I keep telling you that the head of the baby is divided into 5 parts, you know, and if you see there, if you see 4 lines, my fingers are too thick, I think, but there are 4 lines drawn on the head. I mean, imaginary lines, and with that we divide the head into 5 parts. So if the head is 3/5 inside and 2/5 outside, then we say it is engaged. So if it is 5 by 5 felt in the abdomen, that means all the 5 parts of the head are felt in the abdomen and not gone into the pelvis. That means the head is not engaged. So when the head is not engaged, what could be the reason? I think that was the question. What are you trying to tell me? Cord prolapse, ठीक है, cord prolapse का हो गया, चलो आगे बढ़ते हैं. So what is the reason for that? On examining, woman had and there is bradycardia with the contraction. So head is not engaged. So I'm not giving you the choices. I'm telling you what all could be the answers. I'm trying to tell you this can be any of these. It can be a brow which will not get into the head. The head will not get into the pelvis. It can be plasma previa if the plasma is totally covering the os, or if it is it'll also present with a high floating head. It can be a cephalopelvic disproportion also. I'm just giving you what all could be the answers. So what was there? ग्रेप लाइक स्ट्रक्चर. देखो यार, इस क्वेश्चन के बारे में बात करते हैं. अभी इस क्वेश्चन बात करेंगे. वी विल स्टिक टू द क्वेश्चन व्हिच इज एट हैंड. They also said station was at 0. Okay, fine. So I don't know, with the head 5 by 5 felt per abdomen, station was 0 is unlikely kind of a combination. Yes, brow was there na, bas theek hai, brow was there, so I think I will stick with that. So it can be any of these. I'm not saying these are not choices. I'm just saying it can be any of these 3. So brow was there. That means I can understand that was the question. Chalo, what does this ultrasound picture show in the ovary? Yes, there's a picture of the ovary which is like this. It is showing multiple follicles in the periphery of the ovary. So what do you think it is? Yes, that is a straightforward. This is a straightforward, and that is a ovarian hyperstimulation, theca lutein cyst, follicular cyst, or PCOS. So yes, OHSS will have all the follicles will be big, and this is classically PCOS, multiple small follicles arranged in the periphery. I told you now 180 questions, 190 questions will be straight away. छुट्टा में marks आना ही आना है. So those 180, 190, if you got correct, then pass तो हो ही रहे हो आप लोग. Don't worry. Okay. PCOS tha, this was there in the choices. Yes, thank you so much. Woman with curdy white discharge on microscope examination shows pseudo-hyphen budding yeast. अब इसका आंसर तो यार कुछ भी नहीं हो सकता, बस एक ही हो सकता है. और इसमें गेस तो नहीं करके आया ना, इसमें ये तो नहीं करके आया कि इंकी पिंकी पोंकी, इस वाले क्वेश्चन में तो नहीं किया ना. I hope all of you wrote candidiasis. I'm very sure that this has to be candidiasis, cannot be anything else. So yes, vaginal candidiasis will show that. Somebody was telling me there was clue cells wala question bhi tha. Somebody was saying ki there was clue cell definitely. What is the clue cell? Treatment पूछा था vaginal candidiasis. Clue cell of course is there, that is bacterial vaginosis, and uska treatment, you know, it is metronidazole. Itching tha, candidiasis was not in the option. Okay, I mean, somebody sent me with this curdy white discharge with pseudo-hyphen budding yeast, तो यार candidiasis है. अब क्वेश्चन कुछ और था, तो चलो सुनते हैं आपसे क्या बोल रहे हैं आप लोग. Clue cell present था, so that is bacterial vaginosis, not foul smelling and not curdy discharge. ठीक है, pseudo था, clue cell was there, Amsel criteria was there. फिर तो it is again easy question. I said vaginitis वाला जो I gave you a comparative chart of all the 3 together, that will come in the exam. So it has come. So definitely clue cell है, तो go ahead and say it is a problem of bacterial vaginosis, and you go ahead and treat with metronidazole. All right, let's move on. Pearl index calculation, of course, this is Pearl index. All of you know that very well. PSM people will be telling you that in much more detail, whatever choices came to them. It just came in front of me, I included here. ओके चलो, इचिंग था बहुत एंड कर्डी डिस्चार्ज था. इचिंग, कर्डी डिस्चार्ज इज कैंडियासिस and history of taking antibiotics again supporting that. हो सकता है दो क्वेश्चन हो. All right, let's move on. Either way, you know the answer, guys. Simple question है, इसमें ज्यादा अपना time नहीं waste करते. Patient with IUCD presents with pain, abdomen and discomfort. IUCD seen in the uterus and the thread is seen well. IUCD seen in the uterus on ultrasound. Yes, I forgot to write that. On ultrasound, you see the IUCD in the uterus. So if you see the IUCD in the uterus, पेशेंट प्रेग्नेंट तो नहीं था ना यार, ये वाला मेरे को बता दो, ये प्रेगनेंसी वाला तो नहीं था. यू पुट एन आईयूसीडी, प्रेगनेंसी वाला तो क्वेश्चन नहीं था ना, बस एक आईयूसीडी डाला, उसको पेन हो रहा है, एंड देन यू कैन सी दी ऑन द अल्ट्रासाउंड यू कैन सी दैट द आईयूसीडी इज इनसाइड द यूट्रस एंड यू कैन सी द थ्रेड. देन व्हाट यू डू, वाज दैट द क्वेश्चन? आगे चलो यार, छोड़ दो, वो क्लू सेल वाला हो गया, व्हाटएवर वाज गिवन टू मी. यस, yeah, hypertension, what can be given? We are coming to that. That question is there. I have that question. That question is there. वो बाद में आएगा. IUCD के साथ, if she's come with pain, what do you do? Remove IUCD, start antibiotics, reassure and give an NSAID. What do you do? Bleeding भी था. Yeah, stay with the question, guys. There's so many of you, and if you keep telling me all this, then we'll lose connection. Stay with the current question. Yeah. IUCD was okay. If the woman is having bleeding, and after IUCD insertion and she's having some pain and discomfort, that is normal. That will be there in all women who have IUCDs. So pain and bleeding are the two more common presentations. IUCD, whether your PSM people teach you, pharmacology people teach you, or whether your gynecologist teaches you, IUCD is classically associated with pain abdomen and some vaginal bleeding. And the next 2-3 periods will be heavy. So we reassure and give them NSAIDs. What else? So it's all right. After insertion also भी होगा ना bleeding. थोड़ा बहुत हो सकता है. Okay. After 2 months she came with bleeding. That's all. Bleeding है. लिख देता हूँ. Bleeding. What is the most common side effect? Bleeding is 3 times. Bleeding is 3 times more common than pain. So that is the commonest presentation of IUCD. So अगर bleeding अगर है तो उसकी वजह से we do not take out the IUCD. No. It should be heavy bleeding, then we take out. If it is heavy bleeding, then sometimes we'll manage with IUCDs and tranexamic acid, because 3-4 months later it all settles. But yes, heavy bleeding, if you say, ideally we should take it out. If it is some extra bleeding, some spotting here and there in the first 2-3 months, we are not going to take out the IUCD. That's all right. That's okay. Of course, you rule out that she was not having some other endometritis, she was not having pregnancy, for God forbid. So all of these things you rule out, and then only you put the IUCD. Yeah. ठीक है, ये क्वेश्चन सेटल है. आगे बढ़ते हैं. 14 या 16-year-old girl came to the OPD having complaints of amenorrhea, but a fully developed breast and scanty pubic hair. Some people said little pubic hair. Some people said some pubic hair. All kind of choices have come. So I'll stay with scanty pubic hair. There is a blind vaginal pouch on a local examination. Ultrasound reveals there is no uterus and ovary, but the testosterone levels of this lady are of male levels. What is the diagnosis? Okay, on and off bleeding था. चलो ठीक है, एक्सप्लोरर मैं आपकी बात मान गया. अब इस पे आ जाओ यार, अगले वाले क्वेश्चन में आ जाओ. पेशेंट इरिटेटेड थी, ये भी था. हाँ, तो रीएश्योरेंस यार, तुम लोगों को रीएश्योरेंस. ऐसे तो फिर पेशेंट विल नॉट लाइक एनी सर्जरी और एनी मेडिसिन. आई डोंट लाइक द मेडिसिन, मेरा दिल कच्चा होता है, लाइक दैट, तो शी विल नॉट टेक एनी ड्रग्स. यू हैव टू हैव सम पेशेंस एंड कन्विंस पीपल अबाउट टेकिंग ड्रग्स. The question has to be better recalled, but अभी छोड़ देते हैं. अब ये वाला बताओ यार, स्कैंटी था ना? हाँ बस ठीक है, स्कैंटी प्यूबिक हेयर था, करेक्ट. अब नेक्स्ट में आ गए गाइस, छोड़ दो आईसीडी वाला क्वेश्चन, छोड़ दो गाइस. तो ठीक है, तो स्कैंटी प्यूबिक हेयर है, तो इसमें देखो वेल डेवलप्ड ब्रेस्ट. ओके, स्कैंटी प्यूबिक हेयर. देखो ऑलवेज इंटरसेक्स के क्वेश्चन में, दे विल ऑलवेज इन इंटरसेक्स क्वेश्चंस प्यूबिक हेयर विल बी मेंशन्ड. सो द प्यूबिक hair is normal for the girl, then we say it's a girl with normal androgen levels of a girl. Okay, but there are no pubic hair or scanty pubic hair. then we say the androgens are not working. With the androgen not working, we think of androgen insensitivity syndrome. And in androgen insensitivity syndrome, or also called testicular feminization syndrome, it's a boy who's looking like a very normal kind of a girl in a phenotype. The presentation will be like a normal girl, and she'll be tall and broad-chested, and she'll have a normal breast development. She'll have, external genitalia looking like a girl, but there'll be no pubic hair or scanty pubic hair. So that is testicular feminization syndrome. Yes, that is exactly how it presents. So इसमें तो मैं ज्यादा सोचूंगा नहीं, ये तो सिंपल क्वेश्चन था. जो इंटरसेक्स का सबसे सिंपल दो क्वेश्चन आता है आप लोगों को, दैट इज वन इज मुलेनजेनेसिस एंड अदर वन इज टेस्टिकुलर फेमिनाइजेशन सिंड्रोम एंड द थर्ड वन is the Turner syndrome. So apart from that, they don't bother you with the details of the, yes, very rarely one NEET PG exam I heard of a Swear syndrome as a choice, but the question was not Swear syndrome. But we keep teaching that to you anyway, wherever we are teaching you. Right, let's move on and see some other questions. Yes, next पे जा रहे हैं यार. चलो. Second baby of twins with a transverse slide. So there's a second baby of twin with the transverse slide. I was dreading that this question is going to come sooner or later in exams. Yes, if the first is cephalic, let me tell you twins ka principle. First cephalic hai, so then we can do a normal delivery. In twins, if the first is cephalic, can do a normal vaginal delivery. Yes, that is a basic rule. If the first is cephalic, second can be breech, second can be transverse lie also. Now, if the baby is in transverse lie, all right, if the baby is in transverse lie like this, okay, so what we can do, if this first baby is out and second baby is in transverse lie, so no external cephalic version, we go and burst the bag of membranes and hold the leg, and we turn the baby like this, okay, hold the leg, and with the hand on the abdomen, we turn the leg. So my hand is inside the uterus, we hold the leg and pull it down, and with the hand on the abdomen, we correct this. So it is known as an internal podalic version. So IPV is done for a second of twin in transverse lie. You know, the number of times I've done it, this is so rewarding, that transverse lie you deliver vaginally, but you can do only in a second of a twin in transverse lie. Now that question, you know, we'll have a good discussion wherever we meet. Second of twin in transverse lie, we can do it, not in any other transverse lie. So transverse lie coming in labor, a singleton transverse lie in labor, the answer is cesarean section. But second of twin in transverse lie, we can do IPV. That is a new question which has come. I have not heard this coming in a MCI exam. It has not come. It has always come in NEET PG and INICT, but coming in MCI exam, yes, more intensive training required, guys, now. So occipital posterior came, my favorite question. It came again this time, but twins in second one transfer lie, we do IPV. Pic based था, ये image based था. Sir पूछा था कि इसका non-cephalic head presentation. This option was not question. Okay, you tell me what is the question I'm here. We are discussing. Image based question था. Image बना दिया मैंने आप लोगों के लिए. बताओ what was the question? Yes, what was the question, Sina? Okay, fine. IPV कर सकते हैं second and transverse line में. I think उसके ऊपर अब छोड़ देते हैं. आगे बढ़ते हैं. Yes, now this question, guys. 53-year-old diabetic and hypertensive woman having complaints of post-menopause bleeding and an endometrium of 8 millimeters and normal ovaries. A hysterectomy was done. It reveals this kind of a uterus. Uterus with the growth. Yes, can you see this growth in the uterus? Yes, this growth in the uterus. That growth in the uterus. Tell me, guys. हाँ आईपीवी था ना, बस छोड़ दो उसको, बस आप लोगों को पता है नॉन वर्टेक्स सेकंड क्वेश्चन था, करेक्ट. ओके चलिए, व्हाट इज दिस क्वेश्चन? CA endometrium. Yes guys, CA endometrium, very good. देखो यार, I always keep telling you in your classes that India में CA cervix is the commonest genital cancer. In gynecology the commonest cancer is CA cervix. But MCI में क्वेश्चन ज्यादा endometrial cancer का पूछते हैं, and वही प्रूफ हो गया. I think there was another similar question. So MCI में endometrial cancer is a favorite, और इसमें मेरे ख्याल से diabetes hypertension भी कुछ लिखा हुआ था शायद. Yes, diabetes and hypertensive. तो ये रटा रटा के पागल हो चुका हूँ मैं क्लासेस में कि प्लीज diabetes mellitus, hypertension, obesity and a woman who's postmenopausal with irregular bleeding, with postmenopausal bleeding, it is CA endometrium, or endometrium ये growth भी दिखाया हुआ है. तो yes guys, I'm sure that you guys have fibroid does not cause postmenopausal bleeding so commonly, guys. देखो common answers, common चीजों के बारे में पढ़ो. Please do not read about vague presentations. Okay, चलिए, CA endometrium, this is CA endometrium. Woman in labor with the following trace, what does this look like? अब कई लोगों ने बोला कि लेट डिस्टिलेशन था, कई लोगों ने बोला कि अर्ली डिस्टिलेशन था, तो मैंने आपको आई हैव पुट दिस late distillation bit. So this is the uterine contraction and this is the heart rate of the baby. Another contraction and then the heart rate of the baby. So you can see this is not coinciding. This is late. So when you see a late deceleration, this is what is a late deceleration. So yes, we are very clear here. It is a case of late deceleration, and you can be asked about early deceleration. Outright simple questions. You have to read. I said, Bina, somebody before the when I was doing the marathon with you guys said, what are those topics which you keep saying? I said, do not forget to read surveillance before you leave your room. Surveillance के ऊपर क्वेश्चन आएगा ही आएगा था. वेरिएबल था, वेरिएबल आया था कि लेट आया था. ठीक है, वेरिएबल है, लेट है, ये क्वेश्चन बड़े सिंपल हैं. लेट एंड वेरिएबल यू गाइस कैन आंसर वेरी इजीली, आई एम वेरी श्योर. सो ऑलराइट, लेट्स मूव ऑन. पैप्स में ये क्वेश्चन लगा मुझे कि इस बार कोई अच्छा क्वेश्चन पूछा आपसे, बहुत मतलब एकदम अपार्ट फ्रॉम द आईपीवी एक अच्छा क्वेश्चन लगा मुझे. पैप्स मेयर शोज एटिपिकल ग्लैंडुलर टिश्यू, व्हाट इज द नेक्स्ट स्टेप? ये मैं थोड़ा वेट करता हूँ, ये थोड़ा लैग है स्टूडियो और उसमें यूट्यूब पे. कैन यू जस्ट टेल मी गाइस? यस, आई एम वेटिंग फॉर योर yes, see this guys and tell me. लेट वेरिएबल ये सब आप लोग कर लोगे. ये वाला क्वेश्चन के बारे में बताओ मुझे. पैप्स में शोइंग एटिपिकल ग्लैंडुलर सेल्स. कॉल्पोस्कोपिन बायोप्सी, एंडोसर्वाइकल बायोप्सी, एंडोमेटल बायोप्सी और रिपीट पैप्स में. तो रिपीट पैप्स में तो नहीं करना है. यहाँ पे अभी हमें आंसर मिल गया कि दे आर एटिपिकल ग्लैंडुलर सेल्स. सो दे कैन बी एटिपिकल ग्लैंडुलर सेल्स, दे कैन बी एटिपिकल स्क्वामस सेल्स व्हेन यू डू अ pap smear. So when you see atypical glandular cells, so then what do you do? So when you want to choose between these options, Pally, you tell me the options. Were all these options? Were these were the options? Yes. Can you please inform me? Were these options present? क्योंकि यहाँ पे मुझे लग रहा है कि options कुछ अलग भी हो सकते हैं. Although these are the things which we do. Actually, we do all these three, but one answer holds more weight than the other two. So that's what I'm trying to say. If there is atypical glandular cells, we are thinking of adenocarcinoma first of all, isn't it? So we are not thinking of cervical cancer. So with that hint, can you tell me the answer? It was endocervical plus endometrial biopsy in one option. It was in one option. Then yes, you've sorted out it for me. Yes, both together is a better answer. So always glandular cancer can be there in the endometrium, glandular cancer can be there in the cervix, but cervix, you know of more of cervical cancer is the squamous cell carcinoma. So on the cervix, on the surface of the cervix, you get the squamous cell carcinoma. You can also get adenocarcinoma of the cervix very rarely. So if you see atypical glandular cells, you must do endocervical biopsy and also an endometrial biopsy. Yes, glandular cells can be from both the sources. So if you had taken one of these choices, I don't know whether if somebody is saying that both these came, then that's the best answer. Otherwise, endocervical biopsy definitely you have to do. So if you have to choose just one, that's why I said there are more than one answer which is correct to this one. So yes, cervical plus endometrial tha. So I'm very happy that you know this answer. Go ahead and say that it's a case of probably adenocarcinoma of the cervix. Probably, I'm not saying it. Atypical glandular cells means nothing sometimes. So you have to just do an endocervical biopsy and you have to do the endometrial biopsy next. So that's the answer. Okay, avoid medical management with methotrexate in ectopic pregnancy if there is which of the following? Maybe the question was, what is the contraindication? What is the contraindication of doing a medical management with methotrexate? Basically, I think that's what they're trying to ask you. Leiomyosarcoma, no, that will not come with this. Leiomyosarcoma will not come with that. So that is not the answer. Yes, I'll see the chat when I'll try to get the questions again and probably come out with, let all the answers there, we have 19 subjects to do. Let all these answers finish. Let me get a clarity on the answers. We'll come back again someplace. We'll discuss. cystic something in the question. Cardiac activity is present. Was this the question? That's what is, I want to know whether this question came. Avoid medical management with methotrexate in ectopic pregnancy if which of the following is present. Yes. Fetal pulse is seen. Yeah. So, okay. That's fine. That is a contraindication. So, if you see that we will do medical management if the HCG should be less than 5,000 and the size should be less than 4 centimeters and the cardiac activity preferably should be absent. Look, a lot of us keep doing medical management even with cardiac activity present. It's not a straight away contraindication. But yes, in the scenario given to you, if the cardiac activity is present, I, as an infertility specialist, I generally try to correct the tube. I try to take the baby out and repair the tube rather than saving it for medical management. So yes, I would definitely go with this answer that cardiac activity is present and the other 2-3 parameters are following what we want to see. So then I will definitely say that I will go with the answer that cardiac activity is present. So definitely with that. Okay, guys. Because see what happens that if you do medical management, it gives us very good results. But what happens that if the cardiac activity is present and the HCG is too much, we may be able to manage medically, but you may end up with a lot of adhesions of the tube. So that tube, you may save it medically, but it is not very good. I would rather do a surgical management if the cardiac activity is present. So that is also the recommendation and that is also the answer to this question. Yes, live tubal pregnancy, I would definitely do more surgical management than medical management. That is what is the norm. We try to save the tube by the surgical management like a linear salpingostomy. I regularly do this. Yeah, I've shown you videos also. Chalo, aage badhte. Complete mole at 12 weeks. Yes, guys. So many of you asked me on my WhatsApp, so many of you in the last 1 week. So why not DNC? You kept asking me why not DNC for a complete mole. So yes, what did you mark now? Some of you, those who asked me, I think you are seeing it here also. Can you tell me what did you mark complete mole? Yes? Guys, come. So please, we will always think in terms of, not disturbing the uterine lining too much. So if you're doing a DNC, you do a curette. So traditional teaching, okay, we go by core basics. Traditional teaching, see, whatever is the teaching, there is an exception to it. So I'm teaching you traditional teaching. Traditional teaching is that when you do a curette, when you scrape, you may implant trophoblastic tissue deep into the myometrium. So we don't want to do that in a primary removal of the molar tissue. So generally what we do a suction evacuation. So yes, 13 weeks का क्वेश्चन था. Okay, 13 कर देता हूँ यार, तू बुरा मत मान यार. 13 कर देता हूँ. और बोल. और क्या था क्वेश्चन में? ectopic pregnancy diagnosed and methotrexate. Oh, छोड़ दे, ectopic खत्म हो गया यार. Suction oxytocin was not in the option. चलो ठीक है. Oxytocin नहीं था. बाकी दो ऑप्शन क्या है, छोड़ देते हैं. Suction evacuation is the answer here. इसमें let's not get into that. That's why I'm saying ना कि what you're writing here, we'll use to format the questions properly. And when we're doing a QBank update in PW, I will put all of these there. So don't worry. Suction evacuation. I hope you guys have done that correct. Okay, chalo. A pregnancy scan done in early pregnancy shows twins. What type of twins you think these are? ये तो यार ब्रेड एंड बटर क्वेश्चन है ट्विंस वाला हम जो आपको पूरा पढ़ाते हैं द होल फंडा ऑफ ट्विंस वी बेस इट ऑन यू अंडरस्टैंडिंग दिस वन पिक्चर. Yes, we start with the normal fertilization. We tell you how the embryo normally divides and then the embryo splits and all of that we build up to this one picture in the lectures. Where have you done the lectures? Yes, you always build up to this picture and once you see this picture you can understand that what type of twin it is. So you're seeing in this, you're seeing there is an intertwin membrane. Can you see this? There's an intertwin. Yes, intertwin. This is like a, oh sorry. This is like a peak sign. I'm getting my notifications. So what do I do? Okay, छोड़ देते हैं. अभी तुम लोग सुन लो मेरा WhatsApp का notification, doesn't matter. Okay. Lambda sign, clearly ultrasound image was very clear, lambda sign. So this is also known as the lambda sign. This is also known as the twin peak sign. Twin peak sign or the lambda sign. Yes, so if there is, it's looking like one placenta, but when there is a twin peak sign, it is basically a case where there are two placenta which are physically stuck to each other. So when it is two placentas, we say it is a dichorionic diamniotic pregnancy. So that is the answer to this question, dichorionic diamniotic pregnancy. Yes, Didi. It is di-di. Okay, but what is the most common type of monozygotic twin? It is the MODI, monochorionic diamniotic is the commonest, but DIDI is the safest. So safest, yes, this is what we keep teaching you in the exams. Yes, safest. Obstetrically, the safest is this one. Chalo, let's move on. Patient is in active labor at 6 centimeters and already been 8 hours since the active phase has started, and sagittal suture. Oh, wait a minute. This is looking very interesting. This is the question of the evening, guys. Patient is active labor. All right. Okay. Let's see. 6 centimeters. Already been 8 hours since the active phase has started, and sagittal suture is in right oblique plane. Right oblique plane. Okay. Okay. Right oblique, with the posterior frontal at 4 o'clock position. Can you see 4 o'clock? Am I showing? Is there a mirroring of the image? 4 o'clock will be here, I think. Yes. Now it is looking 4 o'clock. Yes. Okay. I was showing you 8 o'clock. It is at 4 o'clock with the posterior frontal at 4 o'clock position and anterior frontal easily palpable. What is the diagnosis in the delay in this patient? Yes. So if it is a case like this, see, I'm showing the pelvis and the posterior frontal is here. You see, this is the posterior frontal. Okay, the posterior frontal is at 4 o'clock like this. Then it is a case of occipito-posterior. Correct. It's a case of occipito-posterior. Occipito-posterior will deliver vaginally. We know that very well from our classes, but remember, it will be a little delayed. So, all right, can happen delay in the delivery. So, occipito-posterior, I keep telling you, last 3 years and now the 4th year, every year one question. Look, last 3 years, it has come in one exam each. So, there are 6 exams. Now is the 7th exam, it has come again. So, maybe next time it will not come in July. But remember, occipito-posterior is that hot shot question for you because it is the most common malposition. Most common malposition is right occipito-posterior, and that is what asked you here. That it's a case of occipito-posterior. What do you do? She will deliver normally. So और क्या पूछ रहे हो? Deep transfer नहीं होगा यार. 4 o'clock में deep transfer नहीं होगा. 3 o'clock होगा यार. थोड़ा सा yes, I would go with you know, occipito-posterior rather than oblique बोला है ना. देखो transverse नहीं बोला है. उन्होंने oblique बोला है. Deep transverse में transverse होगा ना. इन right oblique बोला तो हुआ है ना यार. Right oblique plane. थोड़ा सा यहाँ पे गड़बड़ है यार. ट्रांसवर्स बोलेगा तभी ट्रांसवर्स बोलूंगा. ओब्लिक में तो यार राइट ऑक्सीपिटोपोस्टेरियर बोलूंगा या लेफ्ट ऑक्सीपिटोपोस्टेरियर बोलूंगा, है ना. All right, guys. So this is a simple question. As far as those who have attended our classes, you will be able to answer this well. Chalo, let's move on and see the next one. Permanent method of female contraception is, now this that simple question. Yeah, permanent method of contraception. सैल्पिंजेक्टमी भी परमानेंट करेगा, पार्शियल भी करेगा, सैल्पिंगोस्टमी भी करेगा. गोस्टमी तो नहीं करेगा. Yes, I don't know, these were not the choices, I'm sure. What were the choices, guys? Deep transfer rest नहीं आंसर इसका, छोड़ दो. That question is over. Now you tell me about this one. It is not deep transfer rest. Yeah. So yes, permanent method, either vasectomy for a man or a tubectomy for a woman. So when you say tubectomy, the most common method of doing tubectomy, that's what we've always taught you, is the modified Pomeroy's. So the Pomeroy's is now called the modified Pomeroy's, like the Shirodkar, which you keep reading about the cervical encephalitis, is now called the modified Shirodkar. So in the exam, we'll not ask you Pomeroy's and modified Pomeroy's. It never will come like that. So you know, modified Pomeroy's only came as the question. There was something called modified. Yeah, it is called modified Pomeroy's. It is actually called modified Pomeroy's. The original Pomeroy's hardly anybody does. You know, all of us have a variation to the modification because original one we used to have a lot of re-anastomosis. So हम लोग अपना everybody has a modification of it. So modified Pomeroy's is the answer for a permanent sterilization. Okay, salpingectomy is not the answer. See, salpingectomy will cause sterilization. Hysterectomy will also cause sterilization here. है ना भाई? We don't do hysterectomy. We don't do salpingectomy. भाई, what is done for a sterilization? We will cut the tube so that you can cut only one part. Look here, guys. Look, thoda sa mota ho gaya tube, but never mind. Here, we cut the tube here at the isthmus. Why do we cut at the isthmus? Because later the cut ends will be uniform cut ends like this. So the uniform cut ends we can re-anastomose easily. So that's why we do at the isthmus. And why do we cut only one segment? Because if at all the woman loses her children, or she has divorce and the husband has taken the custody of children, she wants to re-anastomose. So when that happens, we say it is better that we cut the tube at the isthmus, and that is only a segment which is cut. We never cut off the whole tube. If you chop off this whole tube, if you take off this whole tube away and throw it in the dustbin, then later she can never reverse it if she wants. So whenever we do some sterilization procedure, we do it in a way that we keep an option of a re-anastomosis if it is required for whatever reason. All right. So salpingostomy bhi tha. Chalo, मैंने ऐसे ही अपनी मर्जी से लिख दिए choices, but fine. Modified form is the answer. चलो आगे बढ़ते हैं. Best contraceptive for a patient with uncontrolled hypertension. ये रुक जाओ guys. I'm waiting for your let the transmission go to you guys and you ask me what is to be done. Come. What were the choices? Was it these choices which I'm giving, or there's some other choices? Tubectomy agar tha, to I would have loved to write that. Uncontrolled hypertension, uncontrolled diabetes, we control it. For the surgery, we do tubectomy. I'm happy with that. But if she's got only one child, then we'll have to do these methods. Permanent is the best for patients who have medical complications. Permanent is always the best. But wo choice denge nahi na, because conception generally asks for people who have one child and then they want to space the second one. Question likha tha ki she didn't have any child further in life. She doesn't need any further. Arey yaar, how do you know what I'm going to even think, yaar? So nice. You're in sync with me, Niket Kumar. So nice, you're in sync with me. So yes, agar isme para 2 live 2 tha, then tubectomy is the best answer. And that was in the choices. Go ahead, guys, and mark that one. If it is there. If it was there, para 2 live 2 with a hypertension, I would have gone for a tubectomy. Agar wo tha. They're asking contraindication. Acha, theek hai. Contraindication. So definitely these two are contraindications. Even IUCD with levonorgestrel, I'm not very happy, because levonorgestrel is progesterone and it will get somewhat absorbed into the circulation and cause. So hota kya hai ki why we are not giving these two in hypertension? Because these steroids cause water retention. So any hormonal contraception is contraindicated with hypertensives. So I will not be very happy with levonorgestrel IUCD, but we can give. ऐसी बात नहीं है, we can give. But best would be IUCD, the best one. अब आप बोल रहे हो contraindication क्या है? Definitely COCP and POP, both are contraindications. So ट्यूबेक्टमी तो पूरे पेपर में कहीं नहीं था. हाँ, तो ये हो गया ना यार. कम ऑन, बेस्ट क्या है यार? थोड़ा सा पढ़ लो ना मुझसे. क्या बात है? आपकी बात क्या? आपकी जूनियर्स, आप लोग तो इंटर्नशिप कर रहे होगे, आपकी जूनियर्स पढ़ेंगे ना बाद में, तुमको पढ़ा भी रहे हैं साथ में. नो प्रॉब्लम. सो पैरा 2 लाइव 2 we can do tubectomy as the best option if it is there, para 2 live 2. Now what is contraindicated? If a woman is hypertensive, then you definitely not give a patient having the hormones. तो contraindicated अगर है तो hormones वाला नहीं देंगे. तो अब ये जो मैंने क्वेश्चन बनाया उसमें आंसर हो गया IUCD बेस्ट. कॉन्ट्राइंडिकेटेड मैं यहां लिख देता हूं आपके लिए, इफ दैट वाज द कॉन्ट्राइंडिकेटेड, इफ दैट वाज आस्क्ड. चलो गाइस, देयर आर अदर टीचर्स हु वांट टू टीच यू and give you the answers of what all came in the exams. They're also very excited. A lot of repeats from what PW keeps teaching you. So there's so much of excitement. Everybody wants to talk to you. आगे बढ़ते हैं. क्रिप्टो में मेरा कोई क्वेश्चन था? आई थिंक मेरा खत्म है. इसके बाद मेरे पास आई डोंट थिंक आई हैव मच आफ्टर दिस. सो क्रिप्टो में मेरा कोई क्वेश्चन था? तो was it about transvaginal septum or imperforate hymen? Generally they'll ask you that. Cryptomenorrhea means hidden period. So yes, these definitions, I told you, I taught you the definitions. I said nobody's going to ask you the definition. Based on the definition, they'll ask you what is the answer. So cryptomenorrhea means they can be blood in the uterus, that is hematometra. They can be blood in the vagina, that is hematocolpus. So it can be in a imperforate hymen. It can be there in a imperforate hymen like this, and it can be in a transvaginal septum also. इन दोनों में से एक चॉइस होगा आप लोगों के लिए. नो, इट वाज नॉट देयर. नहीं था ही नहीं. सीटीजी का लेट डिस्टिलेशन था, वो तो हो चुका है. बस इसके बाद मेरे पास क्वेश्चन है ही नहीं, लाइक ब्लैंक 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 हो गया सब कुछ। थैंक यू की स्लाइड नहीं बनाई यार, थैंक यू गाइस, थैंक यू फ्रॉम माय साइड। सो आप मुझे बताओ, आई एम हियर, another 2 minutes guys, keep telling me what are the questions if you want to ask me any, we are there, otherwise you keep writing in the chat, I'll come back to you. My next friend has to come online, so I hope PT, huh? There was an image, 2 times abortion in the first trimester history. 2 time abortion in the first trimester. First trimester. Second trimester का cervical insufficiency का question, the students are telling me. First trimester 2 times we think in terms of chromosomal causes first. Yes, can be antiphospholipid antibody also. Breakage of amniotic membrane filled bradycardia we discuss. Cord prolapse हो सकता है. Yes. Abruption का question था with recurrent pregnancy loss previously, antiphospholipid antibody. Yes, I've taught you that part. Yes, hypertension can happen. It's a very good question. Oh wow, I like that question. Abruption in this pregnancy and previously 2 first trimester abortions, classical antiphospholipid antibody syndrome. Antiphospholipid antibody syndrome can cause abortions, can also cause hypertension in the patient, and hypertension can cause abruption. Fantastic, fantastic. Very good question. 30 weeks. I'm so happy. पोस्ट मेनोपॉज ब्लीडिंग वाला हो गया क्वेश्चन, प्रसाद क्वेश्चन हो गया, दैट वी डिस्कस। 30 वीक्स ठीक है ना, 30 वीक्स पे, अरे भाई एब्रॉर्प्शन 30 वीक्स इज हाइपरटेंशन, एंड हाइपरटेंशन कैन बी बिकॉज ऑफ एंटीफॉस्फोलिपिड एंटीबॉडी सिंड्रोम, because I'm saying hypertension can be because of other causes, but it can be antiphospholipid anti because she had 2 first trimester abortions also, so that is the criteria of antiphospholipid antibody. Yes, your medicine people have taught you that very well, you must read that. ठीक है, ultrasound USG was showing ultrasound and 2 first trimester abortion, definitely was the choice given of antiphospholipid antibody? बस abruption ही पूछा था, ये 2 abortions को क्यों बीच में ला रहे हैं? चलो ठीक है, I taught you something extra then. Abruption का ultrasound था, that was very simple, that's fine. Image based question of adenomyosis was there, that's a simple one. I can show you so many images of that. Was it something like this? I can go ahead into my, I can show you, was it looking something like this? Image based questions. Oh, WhatsApp, don't look at that. Okay. Yes, was it something like this, guys? Yes, that is a picture of adenomyosis from my hospital, beloved hospital. This is one of our hysterectomy specimens in the path lab, St. Stephen's Hospital. Was this the question? That is adenomyosis, classic adenomyosis. You'll see a uniformly large uterus, and there's a cavity. In this cavity, you're seeing that there is this is compressed, and you'll see these lakes of myometrial lakes with blood. This blood is degenerated because this is a formalin jar, so that's why. Adenomyosis image हो गया, ठीक है, short cervix था, ठीक है, 2 क्वेश्चन आ सकते हैं शॉर्ट। चलो ठीक है गाइस, वी आर नाउ confabulating and thinking what all of the other questions, so we are here to discuss as and when you guys want to get in touch with us. Keep writing to the PW forum. There are people just dedicated, I mean they are just sitting waiting for you guys to write to them, and they will catch me ki sir 15 questions ye wale discuss, we have to do them because the students want you to discuss. So whether we have Sankalp coming, whether we have Farre coming, whether we have live sessions, all of those are formal. If you guys want to meet me informally, these guys will tell me, my team will tell me, sir, they want to take a 15 session question. We'll do it. Who says no? Just write to the PW forum. We're waiting for you guys. Okay. One question on polyp. Okay, chalo. Polyp is a very simple question. If it was there, I'll show you the video of polyp. I mean, yesterday, Friday, OT, we took out a polyp out of a patient who had irregular bleeding. Yes, we can show you videos of that. Chalo, ठीक है guys, we are just thinking about the polyp management. Chalo, let's see what is, we are now thinking about the choices of the questions which probably came. We have doctors waiting with the definite questions first, okay? So rather than now wasting time on this, I'll take your leave and we'll be back for more on the PW forum. Keep coming back for more. All the best guys, may all of you pass definitely with good marks so that we can have a good party in Noida 1 whenever you guys are here for the next event. Best wishes guys.
Hello, students. Very good evening. I hope you all had good food just after the exam. I know it's time to rest down, but the recall is very important. Just we have roughly around 8 to 10 questions from the section of pediatrics, and pediatrics and FMG is always very straightforward. There's no twisted questions or any confusing options as such, and very predictable this time the question paper was. So without further ado, let's start. We have the first question. We had a child with cyanosis and chest x-ray was given. This is a typical chest x-ray of boot-shaped heart, and we all know this is nothing but TOF, tetralogy of Fallot. Some of the students are telling me that they asked about the components of TOF. So tetralogy, there are going to be 4 components. What are these 4 components? We have right ventricular hypertrophy, we have pulmonary stenosis, we have VSD, and overriding aorta. Right, so whatever the question was asked, whether it was just identifying the X-ray and the telling the congenital heart disease or telling the components of TOF, very fairly repeated topic, very thoroughly discussed topic, and very frequently repeated topic. We have discussed it multiple times, whether it be your Sankalp batch marathon series or your test and discussions. Each and every forum we have discussed this. Right, so let's move to the next question. I hope there is no other query regarding this. There's certain lag in the YouTube session and the recording. So please, if there is any doubt, drop down in the comment section. I'm looking at side by side, and by the end of my analysis, we will discuss your queries, right? So let's move to the next question. We had a preterm, a typical preterm 34-weeker who presented with respiratory distress, and a typical chest X-ray was given. What can you appreciate in this chest X-ray? Bilaterally, there is white out lungs. White out lungs. This white out lungs is seen in hyaline membrane disease or respiratory distress syndrome. Preterm is a pointer. This chest X-ray is a pointer. Right? Whenever a preterm presents with respiratory distress, the first thing that should come to your mind is hyaline membrane disease or respiratory distress syndrome, and chest X-rays adding to that. Why this happens? Because of the lack of mature surfactant, the alveoli gets collapsed. Right? So this is about your hyaline membrane disease. Now let's move to the third question. A baby is born and the heart rate is given less than 88. Baby is blue. There is no movements. The child is lying limp. That means the tone is very low. The child is slowly breathing. And they asked us to calculate the APGAR score. We all understand what is APGAR score. This is the first score that we give to the child at 1 minute, then at 5 minutes. And how do we remember it? By the mnemonic APGAR only. A is appearance, P is pulse rate or heart rate, G is Grimace response, A is the activity, and R is your respiratory effort. So they said that heart rate is 88, less than 88, so below 100. Respiratory effort was given slow, muscle tone limp, no response, and blue child. So what is the total score over here? 1 plus 1. So the correct answer here is 2. Correct answer here is 2. So they asked us to calculate the APGAR score 2. Let's move to the next question. This question, I believe, is an overlap between OBGYN and pediatrics. And let me know what was the actual statement and what was actually asked. So according to the recall from the students, I got to know that they gave a girl with early breast development and very few thin sparse pubic hair. And they asked about the Tanner staging. So we all know 1 is the prepubertal stage and 5 is the adult stage. In the second stage, we have early development of the breast and very thin, sparse pubic hair. Thereafter, the pubic hair increase and become coarser. In stage 4, they're very close to the adult type, but only the no pubic hair on the medial thigh are there. So the answer here is going to be stage 2. If management was asked over here, there's no management as such. This child is developing the features of puberty. Reassurance has to be done, right? So if management was asked, the answer is going to be reassurance. It is normal, nothing has to be done, right? Normal puberty pattern is there. So next question, they gave early sign of vitamin A deficiency. So you all know what is vitamin A deficiency? What is the disease caused by vitamin A deficiency? Night blindness. First symptom is night blindness. That means whatever the complaints that your patient presents to you with. What is sign? Sign is something that you appreciate. So what is the early sign? The earliest sign is conjunctival cirrhosis. If they asked early symptom or the first symptom, then the answer would have been night blindness. But when they are asking about sign, it is conjunctival cirrhosis. Okay, they did not ask about Tanner staging. If they asked about the reassurance management, then definitely reassurance has to be done. So early sign of vitamin A deficiency is conjunctival cirrhosis. If they asked about the early symptom, that would have been night blindness. Okay. Okay, so no question on vitamin A. Fine, okay. Let's move to the next question. They asked about CFTR gene mutation. CFTR gene mutation. Which channel is affected in CFTR gene mutation? So CFTR gene mutation, we see in cystic fibrosis, and we all understand which channel is this. This is a chloride channel. Chloride channel. Very straight away, one-liner question. Okay, so let's move to the next question. We have a child with palpable purpura on lower limbs, colicky abdominal pain, and painful swelling of the ankle joints. Platelet count is normal, and they ask for the diagnosis. This is a typical triad: abdominal pain, palpable purpura, joint pain, arthralgia. This is nothing but Hinosh-Schollen purpura, HSP. Right, so palpable purpura, colloquially abdominal pain, painful swelling of the ankle, HSP, right? Let's move to the next question. They gave a child with bleeding and asked which vitamin deficiency could have been there. So we all know vitamin K deficiency is notoriously associated with bleeding. So the answer here is going to be vitamin K deficiency. Now let's move to the next question. They gave a newborn who was born via LSCS and developed respiratory distress soon after birth in the form of tachypnea. And they gave a chest X-ray. Either they gave a picture or they just gave a statement of chest X-ray, and they mentioned that there is fluid in the interlobar fissure. What is this? A typical scenario, a child born via LSCS having tachypnea and fluid in the interlobar fissure. This is nothing but transient tachypnea of newborn, which is seen in children who are born via LSCS, right? Why this happens? Because of the retention of fluid in the lungs. This is nothing but TTNB. Okay, if this was the same X-ray, this is nothing but retention of fluid in the interlobar fissure. The other sign is the sun burst appearance that is seen over here. This is nothing but retention of fluid in the lungs. Let's move to the next question. I believe this was the only milestone question they asked. They asked that if the baby has persistent asymmetric tonic neck reflex, what of the following milestones the baby won't achieve? So we all know that these primitive reflexes need to go so that the child can develop new milestones. So if this primitive reflex, asymmetrical tonic neck reflex, is persistent, which of the milestones the child won't be able to achieve? So what happens in ATNR? We know if the or to the side with which the baby has turned, on that particular side there will be extension of the upper limb and the lower limb, and on the opposite side there will be flexion. So just like as if the child is holding a bow and arrow. So if the child is looking this way, on the opposite side there will be flexion of the upper limb and the lower limb. On the other side there will be extension. So what will happen if this is persistent? The child won't be able to roll over, right? To rolling over, this extension needs to go. So roll over would be the milestone that the child won't be able to achieve, right? So roll over, we all know this ATNR, this appears around 35 weeks and disappears around 5 to 6 months. And at that period only the child begins to roll over. Around 4 to 6 months, the child needs to roll over. If crawling was in one of the options, this is definitely okay. If crawling was there, then also that is a wrong option. The correct answer here is roll over, right? So with that, we complete all the recalls from the pediatric section. If you have any other question that you feel is missing? Or you want to improve on the over the options, then please drop that down in the comment section. We will have a thorough discussion definitely of all these questions, but for now, let's stick to this. Okay, so with that, I'll take a leave if there is no other query. Thank you. And now sir will take up this biochemistry session. Thank you.
Thank you very much, ma'am. Please check my voice and just give thumbs up. Good evening, all of you. Let's discuss some biochemistry question. Hope all of you had done well, and I wish you will definitely cross the border. So there were total 9 to 10 questions, core biochemistry questions, typically PYQ based. 9 to 10 questions were there, and some questions overlapping with the other subject. You can say integrated topics, for example, ABG analysis. There were 2 to 3 questions which will cover by the Santosh sir, obviously. And some questions also, Divya ma'am just discussed not vitamin A deficiency, that is vitamin K deficiency manifestations already discussed. Also one question, surfactant deficiency, that was also discussed. So let's discuss some important questions from the biochemistry. Totally PYQ based questions were asked from the biochemistry. See, this was the first question, eruptive xanthoma with chylomicron band. This is caused by deficiency of which enzyme? So this is the typical case of familial chylomicronemia or familial hyperchylomicronemia, that is type 1. In the Fredrickson classification, it is type 1, that is type 1 hyperlipoproteinemia. Okay, in this this is mainly because of or due to the deficiency of lipoprotein lipase or ApoC2 defect This is a deficiency in the type 1, that is familial chylomicronemia. Typical feature, eruptive xanthomas, there is tendency to develop pancreatitis due to deficiency of lipoprotein lipase. LDL receptor defect, it is in the type 2A. Also, there is ApoB100 defect in the type 2A. Okay, so these are the commonly asked questions in the any entrance examination. Just wait. Now, second question, which of the following enzyme is deficient in Pompe's disease? All of you know that glycogen storage diseases, every year there is question on glycogen storage diseases, whether it is von Gogh disease, Pompe's or McArdle disease. These are commonly asked questions on the glycogen storage disease. So Pompe's disease, there is organomegaly, that is cardiac involvement is there, and the age of involvement, it is less than 2 years of age, and the life expectancy is it is 18 months to 2 years is the life expectancy due to the defect in lysosomal acid maltase, also known as alpha glucosidase. Lysosomal acid maltase, also known as alpha glucosidase. Okay, there is cardiomegaly, mostly death occur due to the pump failure, Pompe's pump failure, lysosomal acid maltase defect. Okay, second question. Third is acid maltase given and Pompe's was asked. रेप्सम, हाँ रेप्सम भी लेंगे हम, जस्ट वेट. गाउचर्स डिसीज, किसी ने बोला कि गाउचर्स पे 2 क्वेश्चन थे. Gaucher's disease slide with organomegaly was given. Which enzyme is deficient? So all of you know that Gaucher's disease is glucocerebrosidase defect. It is a glucocerebrosidase defect. Krabbe's disease, it is galactocerebrosidase defect. All of you know that there is involvement of liver, bone marrow, and spleen. Typical pancytopenia, refractory anemia is there. Crumpled tissue paper macrophages, and the Erlenmeyer-Flass deformity. These are the characteristic feature of Gaucher's disease, and there is no cherry red spot in the Gaucher's disease. Beta glucocerebrosidase. Yes, correct. Beta glucocerebrosidase. This is the enzyme defect in the Gaucher's disease. Because of this, glucocerebroside accumulates, and that gives typical crumpled tissue paper or wrinkled paper macrophages. Okay, bone marrow, spleen, and liver. These are involved. So that's why there is hepatosplenomegaly, and because of the involvement of bone marrow, there is refractory anemia. Means anemia, leukopenia, and thrombocytopenia. And because of thrombocytopenia, there is bruising or bleeding tendency. Next is the Refsum's disease, biochemical disease. Biochemical defect, which is a biochemical defect in the Refsum's disease. Now see, Refsum's, it is a paroxysomal disorder or paroxysomal biogenesis disorder, and it is somewhat less severe as compared to the Zellweger syndrome due to deficiency of enzyme phytanyl coenzyme A hydroxylase or phytanic acid oxidase defect. This is a branch fatty acid which is having the methyl group at the beta carbon. That's why it does not undergo beta oxidation of fatty acid. So special oxidation is needed, that is known as alpha oxidation. So alpha oxidation, it occurs in the peroxisome. This is peroxisomal disorder, less severe as compared to the Zellweger syndrome because of accumulation of phytanic acid. And the typical symptoms are there, that is the neuropathy, ataxia, retinitis pigmentosa. These are the symptoms of Refsum's disease. And it is generally, this Refsum's disease, it is present in the dairy food and the non-vegetarian food. So Refsum's disease, it is alpha oxidation disorder in which phytanic acid accumulation occurs. Yes, HGPRTs. Yes, I am taking that question, HGPRTs. See, the self-mutilation, all of you know that self-mutilation is there, means biting of the nail, head banging is there. मतलब थोड़ा बहुत नाखून तो हम क्रिकेट मैच देखते वक्त ऐसे ही खाते हैं, बट खून निकलने तक कोई नाखून नहीं खाता. So it is the self-mutilating activity along with the hyperuricemia is there because of the defect in the purine salvage pathway. And because of this defect, there is hyperuricemia. And as this nucleotide synthesis is important in brain and RBC, there is neurological symptoms in terms of self-mutilating behavior. So this is Leishnian syndrome. The enzyme defect in the Leishnian syndrome is hypoxanthine guanine phosphoribosyl transferase. So this is complete deficiency. Partial deficiency causes the Kelly-Sigmiller syndrome. Okay. So this is related with the purine salvage pathway defect. आप लोग मुझे बताओ, ये क्वेश्चन था कि नहीं, डीएनए मैचिंग इन फैमिली मेंबर्स व्हिच इज यूज, इस तरह के आई थिंक 2 क्वेश्चन थे, है ना. सो डीएनए फिंगरप्रिंटिंग के जनरली ये मार्कर्स है, मार्कर्स फॉर द फिंगरप्रिंटिंग मार्कर्स, इट इंक्लूड्स RFLP restriction fragment length polymorphism, then simple tandem repeats, and before that there is variable number tandem repeats VNTR, then simple tandem repeats are there, and then SNP single nucleotide polymorphism. These are the markers for the DNA fingerprinting. These markers can be used. So DNA matching in the family members which is used. So answer option में क्या क्या थे actual में mini satellite. Yes, mini satellites means the simple tandem repeat 2 to 6 nucleotide repeats in a DNA segment. So different DNA is having the different number of repeats. On the basis of that, you can identify the you can match the DNA. Okay, by matching the DNA, you can identify the particular person from the family. So the answer is simple tandem repeats. These are the markers. Clinical history with image, and there is affected conversion of uroporphyrinogen 3 to coproporphyrinogen 3. This conversion is affected. So this is UPG, uroporphyrinogen 3 to coproporphyrinogen 3. This conversion is affected. Which enzyme is defective? ऐसा ही क्वेश्चन था या कुछ मॉडिफाइड वर्जन में था या क्लिनिकल हिस्ट्री के साथ पूछा था? एक्चुअल में क्या था? प्रोटीन से अटैक होता है. ए, यहाँ पे आंसर तो ये मैंने जब पढ़ाते वक्त भी बताया है. यू कैन रिमेंबर लाइक दिस U1, U3 एंड UD. ओके, दिस इज यूरोपोर्फायरिनोजेन one synthase defect. This is defect in the, this defect causes acute intermittent porphyria in which the porphobilinogen and the porphobilinogen and the ALA accumulates in the acute intermittent porphyria. There is no photosensitivity in the acute intermittent porphyria. Uroporphyrinogen 3 co-synthase defect, this causes the congenital erythropoietic porphyria, and this uroporphyrinogen decarboxylase defect, this defect causes the porphyria cutanea tarda. Remember these three porphyrias, they are very very important and frequently asked in the entrance examination. So uroporphyrinogen 1 synthase or hydroxymethylbilane synthase or the porphobilinogen deaminase deficiency causes acute intermittent porphyria. Uroporphyrinogen 3 co-synthase defect causes congenital erythropoietic porphyria, also known as Gunther's disease, characterized by the photosensitivity. And congenital porphyria cutanea tarda, it is due to the defect in uroporphyrinogen decarboxylase. There is bullous skin lesion also associated with alcohol consumption, hepatitis, and some drugs. It is their acquired porphyria can be there because of deficiency of uroporphyrinogen decarboxylase. Here answer is uroporphyrinogen decarboxylase. Abdominal pain with normal HMB was in the question. Abdominal pain. If there is abdominal pain, this cannot be a diagnosis. Remember this, abdominal pain and neuropsychiatric symptoms, these are the manifestations of acute intermittent porphyria. Also this CpG oxidase defect, it causes the variegate porphyria, which is also having the abdominal pain and neuropsychiatric symptoms along with the photosensitivity. So depending upon the question, your answer will change. Okay. This question already addressed by the Divya ma'am. Bruising and bleeding with picture of child. Which vitamin is deficient? Answer is vitamin K. All of you know that vitamin K is required for coagulation. It is required for the post-translational gamma carboxylation. Post-translational gamma carboxylation of clotting factor. इससे क्या होता है? एक्स्ट्रा कार्बोक्सिल ग्रुप ग्लूटामेट को ऐड हो जाता, उसके वजह से निगेटिव चार्ज कैरी करते हैं ये क्लॉटिंग फैक्टर 2, 7, 9 एंड 10 के एक्टिवेशन के लिए लगता है। एक्स्ट्रा कार्बोक्सिल ग्रुप ऐड होने की वजह से कैल्शियम के साथ कॉम्प्लेक्स बना के क्लॉटिंग प्रोसेस में हेल्प करते हैं। सो दिस इज द फंक्शन ऑफ विटामिन के, पोस्ट ट्रांसलेशनल गैमा कार्बोक्सिलेशन ऑफ क्लॉटिंग फैक्टर 2, 7, 9 एंड 10। हियर आंसर इज विटामिन के। A tall individual with long limbs and big hands, which gene is defective? मार्फन सिंड्रोम डायरेक्टली दिया था कि ऐसा ही पिक्चर दिया था? ए टॉल इंडिविजुअल विद बिग मींस लॉन्ग लिम्स एंड बिग हैंड्स। यस, अल्कोहल वाज देयर। यस, करेक्ट। APTT increase था initially in the vitamin K deficiency, prothrombin time increases. In the chronic phase, the APTT also affected. सर सेम कॉन्सेप्ट। यस, मार्फन मेंशन था। ऐसे ही था, 15 years था। ओके, सो ए टॉल इंडिविजुअल विथ लॉन्ग लिम्स एंड बिग हैंड्स, ये क्वेश्चन अभी रिसेंटली बहुत सारे एग्जाम में रिपीट हो रहा है। दिस इज फिब्रिलिन 1 म्यूटेशन ऑन लॉन्ग आर्म ऑफ क्रोमोसोम 15. So this affect the periosteum, hence bones are affected. This affect the lens, hence there is superotemporal subluxation of lens occur, and aorta is affected, and cause of death is mainly because of the rupture of aorta, aneurysm of aorta. So this answer is fibrillin 1 gene mutation in the Marfan syndrome. Okay. Some questions were on the arterial blood gas analysis, then respiratory distress syndrome, and the surfactant question was there, which was also addressed by the Divya ma'am. ABG questions will be addressed by the Santosh sir, and the overlapping topics with the biochemistry, these topics will be addressed by the respective faculty. So this is all for today about the biochemistry topic. I will hand over the mic to the Manjunath sir. Sir, please. Before getting married या before conceiving child, कुछ मार्फन मेंशन नहीं था। अच्छा, कुछ लोग बोल रहे कि मार्फन मेंशन नहीं था। ओके, So this is all for today. Thank you very much, guys. Manjunath sir, please take over.
All for today. Thank you very much, guys. Manjunath sir, please take over.
So yes, thank you, sir.
All for today. Thank you very much, guys. Manjunath sir, please take over.
Yeah. So the next FMT questions, I think FMT questions were very easy, around 6 to 8 questions in exam. So yes, thank you, sir. So let's start with the FMT question. The first question, as usual, from sexual paraphilia, sexual perversion, the practice of wearing clothes of opposite gender for sexual gratification, classically known as. So the very simple, what is the best answer? Can you try? So it is not proteirism. Proteirism is nothing but toucherism. Masochism is sexual gratification by taking pain. Fetichism with the inanimate objects. So the best answer is transvestism, also known as eonism, also known as cross-dressing. So answer is eonism. Okay, fine. Eonism, transvestism, both are same. The answer is eonism. Chalo. Next question. I think the question about sodomy, I'm not sure about the co-worker, whether male or female. The co-worker was accused of having non-consensual sodomy. The next best step is, so co-worker male or female. So depending upon that, the answer changes, and also the BNS section also changes. Yes, guys? Good. So rectal, perianal, anal swab, Foley catheter insertion, blood smear, STD prevention. The next best step is to collect the trace evidence. So the answer is rectal swab or the anal swab. So basically for DNA, also for the spermatozoa or the seminal stain, which proves the sexual intercourse, which proves the anal intercourse. Okay, good. That's fine. A is the answer. And very simple question. In India, pregnant women, so any pregnant woman, which fruit not to consume? So because the papaya is the answer, the papaya consists of papain. So papain, the papain causes uterine contractions. So the answer is very simple. So it comes under abortifacients in case of criminal abortion, right? So the answer is good. What is the age of the victim of rape as per X-ray given below? The X-ray of shoulder joint was given. I think the most probable options were 3 year, 13 year, 16 year, 18 year. Yes, guys? Is this the same image given? Can anyone help me in this? In this image, what we can see here, this image. So the head of the humerus appeared, lesser tubercle appeared, greater tubercle appeared. There's a formation of conjoint tendon. And this conjoint tendon is fused with the shaft. That means the answer is 17 to 18 year. So let's see, guys. Yes. Okay. So the best answer, I'll go with the 18 year because it is more than 17 year. More than 17 year and less than 18 year. It is basically 17 to 18. And you need to look the sternal end of the clavicle to confirm whether it is more than 18 or more than 21. Okay. So 16 to 18, that is the 16 to 18, that is the correct answer. It is around 17 to 18. That is the best answer given by KSN Reddy. Okay. Good. Chalo. The next question, the question from alcohol addiction. And patient with alcohol dependence takes alcohol with the prescribed drug, develops abdominal discomfort, bloating and distension. What drug was prescribed? So the drug of antabuse in case of alcohol, that is basically disulfiram. I think this is the question asked, and options. So fomepizole, as you know, that is given in methyl alcohol poison, ethylene glycol poison, not the answer. Naltrexone is opioid antagonist. Answer is disulfiram. Yes, good, Arshad. Good, many answer. Correct. Great. Sure. The next question, already discussed by our biochemistry teacher Rajesh Jambulkar sir, principle of DNA fingerprinting. So you know DNA fingerprinting invented by Alec Jeffrey. The principle is VNTR, variable number tandem repeats, or it is mini satellite. So the best answer is VNTR or mini satellite. It is not the constant number of tandem repeats, not the exon, it is intron basically, and it is non-coding region. VNTR is the best answer. Good. Sure. Then one more, I don't know, I'm not very sure about this question. I think some student messaged me about this question, especially a case of burned dead body, advanced burned dead body. The best sample for DNA in advanced burned dead body. Options are enamel, ephemer, sternum, spleen. Can anyone help me? Whether this question was there in the exam or not. Danu and Kanish, Melody, can you just confirm this question? DNA sample in advanced bone dead body. Okay. Okay, X-ray was different, that's okay. Autopsy, okay, in bone dead body. Okay. So the answer is enamel. Enamel are the teeth. That is the best sample for DNA. Answer, I'll go with the enamel. Again, it's a repeat question in FMG around 5 years back. This question was asked. So answer is enamel. Yes, it was there. Then patient came with a history of unconsciousness. Some students said that there was a keyword lucid interval following blunt force trauma. CT image was given. It's very simple question. As you know, this is EDH, extradural hemorrhage, bleeding from middle meningeal artery. So the answer is A. Now this question, again, I got it from the students. Morphine overdosage. A patient with suspected morphine overdosage, that is opium, brought to emergency department. Which of the following clinical finding is most characteristic? As you know, triad of opium poison is the meiotic pupil, respiratory depression, and the coma, right? So the best answer, I'll go with bradyapnea. Bradyapnea is the correct answer. In case of opium poison, there will be pinpoint pupil, not the hypotension. So the answer is bradyapnea. Okay, fine. No options for entirely different. Tachycardia. Okay, so but anyway, answer is bradyapnea because respiratory depression very common in morphine poisoning. Again, a repeat question from a previous exam. And the last question. A patient with schizophrenia, split personality, reports that his neighbors are calling him and controlling his actions. What is this known as? Delusion, illusion, hallucination? None. So this is a disorder of thought. It is not the disorder of interpretation. It is not the disorder of perception. The answer is delusion. So A is the correct answer. So around 10 to 11 question asked from forensic medicine, and most of the questions were from our previous classes and also marathon session. So thank you all. Wish you all the best. We'll come up with a detailed explanation and a video in upcoming days. Thank you. Yes. Yes, Vivek sir, you can continue.
Okay. Hello, students. Welcome. Good evening. This is Dr. Vivek, and we'll be discussing the physiology questions. Every time it happens that in the recall exam, recall sessions, post exam, students say this question was there, this wasn't there. So I have double checked with the students and taken only those questions which were certainly there for physiology. I hope you can see me and you can hear me so that I can continue. Okay, chalo. Can we start? I hope you all can see me. Okay. चलो तो क्वेश्चंस एक के बाद एक देखते हैं. वैसे तो देयर इज लॉट ऑफ ओवरलैप बिटवीन द क्वेश्चंस as always the case with physiology. So I'll take the questions which are really the physiology ones where you require physiology. And second thing, before this exam, whatever sessions we conducted for FMGE, दो questions मैंने कहे थे. हाँ, दो क्वेश्चंस कहे थे. एक तो LVPV लूप, इसके ऊपर क्वेश्चन आएगा ही आएगा, ऐसा कहा था इतना एम्फेटिकली, और स्टूडेंट्स कह रहे कि आया. और दूसरा एक्शन पोटेंशियल का ग्राफ, इसके ऊपर भी हर साल क्वेश्चन आता है, तो आएगा ही आएगा. तो ये भी कहा स्टूडेंट्स ने कि ये आया था. सो लेट्स विदाउट वेस्टिंग एनी फर्दर टाइम, लेट्स स्टार्ट. एट विच पॉइंट द माइट्रल वाल्व ओपन्स, ऐसा कोई क्वेश्चन था? और अगर था तो ये LVPV लूप दिखा के एट विच पॉइंट द माइट्रल वाल्व ओपन्स, ऐसा क्वेश्चन था. तो A, B, C एंड D, क्या लगता है आपको? आप इसका आंसर देना चाहो तो यहां पर भी दे सकते हो, क्योंकि वहां एग्जाम में ABCD पॉइंट्स क्या थे आई डोंट नो एग्जैक्टली, लेकिन हमने चलो यहाँ पे मार्क कर दिया ABCD. सो इफ यू विश टू आंसर, ओके, एओर्टिक वाल्व था. ठीक है, कोई बात नहीं, फटाफट बता देता हूं. देखो, दिस इज द फेज ऑफ फिलिंग, है ना. हॉरिजॉन्टल एक्सिस पे वॉल्यूम है, दिस इज द फेज ऑफ फिलिंग, डायस्टोलिक फिलिंग. देन आइसोवॉल्यूमिक कॉन्ट्रैक्शन, प्रेशर इंक्रीजेस, वॉल्यूम रिमेन्स द सेम, 130 का 130, एंड डायस्टोलिक वॉल्यूम. उसके बाद दिस इज द फेज ऑफ इजेक्शन, देखो वॉल्यूम वापस से पीछे आया, एंड दिस इज प्रेशर फॉलिंग, वॉल्यूम रिमेनिंग द सेम, मतलब कि आइसोवॉल्यूमिक रिलैक्सेशन. सो ओके, एओर्टिक वाल्व था ऐसा कह रहे हैं, कोई बात नहीं. चलो देखते हैं. पॉइंट ए, यहां पे माइट्रल वाल्व विल ओपन, क्योंकि सीधी बात है ये पीरियड ऑफ फिलिंग है, फेज ऑफ फिलिंग है. आपको पता है दिस इज द लेफ्ट वेंट्रिकुलर प्रेशर वॉल्यूम लूप, and mitral valve is the valve between the left atrium and the left ventricle. So mitral valve opens and therefore phase of filling occurs, left ventricular filling occurs. That was point A. Then point B, mitral valve closes. यहाँ पे mitral valve close हो गई filling के बाद. अभी aortic valve open नहीं हुई है, so ejection start नहीं हो सका है. That means this is isovolumic contraction. Mitral valve भी बंद है और aortic valve भी बंद है, दोनों valves बंद है. And then at point C, यहां हमारे डायग्राम में, हाँ सर, द क्वेश्चन वाज अबाउट aortic valve closure. ओके, जोसेफ जी कह रहे हैं, ठीक है, पॉइंट नोटेड. mitral valve यहां क्लोज हो गई. At point C, aortic valve opens, और जैसे aortic valve ओपन होगी, there will be a phase of ejection, phase 3. That's the phase of ejection. And of course, then at point D, the aortic valve closes. Ejection खत्म हो गया, systolic ejection. तो यहाँ पे at this point the aortic valve closes. और उसके बाद फिर isovolumic relaxation, फिर mitral valve open and यहाँ से फिर phase of filling. तो I hope कि आपका क्वेश्चन सही, मतलब आंसर सही आ गया होगा, क्योंकि आधे लोग माइट्रल वाल्व कह रहे हैं, आधे लोग एओर्टिक वाल्व कह रहे हैं, एओर्टिक वाल्व वाले आधे लोग ओपन कह रहे हैं, आधे लोग क्लोज कह रहे हैं. तो होता है ऐसा, एग्जाम के स्ट्रेस में तो ऐसा ही होता ही है. नो इश्यूज देयर. आगे बढ़ते हैं, लेकिन मैंने चारों पॉइंट्स मार्क कर दिए हैं. तो जो भी क्वेश्चन था उस, और आपने जो भी आंसर किया वो टैली करके देख लेना. माइट्रल वाल्व ओपन्स, माइट्रल वाल्व क्लोजेस, एओर्टिक वाल्व ओपन्स, एओर्टिक वाल्व क्लोजेस, ABCD. लेकिन ये क्वेश्चन जैसा मैंने कहा हर एग्जाम में आने का चांस रहता ही है, आने का खतरा रहता ही है. तो इस बार भी आया. वेरी गुड. आगे बढ़ते हैं. ए साइंटिस्ट वॉज परफॉर्मिंग एक्सपेरिमेंट ऑन अ नर्व. क्या ये क्वेश्चन आपको दिखाई दिया एग्जाम में? ए साइंटिस्ट वॉज परफॉर्मिंग एक्सपेरिमेंट ऑन अ नर्व. ही अप्लाई स्टिमुलस ड्यूरिंग रिफ्रैक्टरी पीरियड एंड नर्व फेल्स टू एक्साइट बिकॉज. तो अगर आपको एग्जैक्ट क्वेश्चन अगर याद आ रहा हो, मुझे बताया गया कि इसमें एक्शन पोटेंशियल का ग्राफ पूछा गया था. सो इज दैट करेक्ट? एक एक्शन पोटेंशियल का ग्राफ दिखाया है. यहां पे आपने पहला स्टिमुलस अप्लाई किया और फिर यहां आगे, यहां पे एट दिस पॉइंट ऑफ टाइम अनदर स्टिमुलस वाज अप्लाइड बट इट फेल्स टू एक्साइट द नर्व. और उसका कारण क्या है, ऐसा पूछा गया है. सो व्हाट इज द रीजन? यहां पे आप स्टिमुलस अप्लाई करते हो, सेकेंड स्टिमुलस एट दिस, इन दिस टाइम पीरियड, तो एक और एक्साइटेशन नहीं मिलेगा. दैट्स बिकॉज यू आर इन द फर्स्ट पार्ट ऑफ द एब्सोल्यूट रिफ्रैक्टरी पीरियड. सो द क्वेश्चन वाज रिलेटेड टू द एब्सोल्यूट रिफ्रैक्टरी पीरियड. In the first part of the absolute refractory period, sodium channels are already opening. So you can't make one more cycle of sodium channel opening. First part में देखो, यहां पे सोडियम चैनल ओपन होना स्टार्ट हो गए, पॉजिटिव फीडबैक साइकिल. तुरंत आपने दूसरा स्टिमुलस अप्लाई किया, तो you can't generate one more cycle. And that is what happens in this period. Therefore, you cannot excite the nerve at this point of time. And अगर सेकेंड पॉइंट पूछा गया है तो देन सोडियम चैनल्स आर इनएक्टिवेटेड. ऑल सोडियम चैनल्स गेट इनएक्टिवेटेड. तो जब तक वो रेस्टिंग कंडीशन में वापस नहीं आते तब तक आप दूसरा स्टिमुलस देके कुछ फायदा नहीं. द नर्व विल बी रिफ्रैक्टरी. ओके. लीस्ट एक्शन पोटेंशियल बिटवीन सोडियम एंड पोटेशियम. ओके. हाइपरपोलराइजेशन पूछा गया था. नहीं, this is not the phase of hyperpolarization. If this phase was pointed out, then it is not hyperpolarization. Hyperpolarization occurs here at this point of time, and a hyperpolarized nerve can excite again. इसलिए इस क्वेश्चन का आंसर हाइपरपोलराइज्ड ये नहीं था. मैं आपको एक बार क्लियर कर देता हूं, फिर उसके बाद अपना आंसर आप टैली करके देख सकते हो. फर्स्ट पार्ट ऑफ द एक्शन पोटेंशियल, मतलब यहां शुरू हो गया एक्शन पोटेंशियल, तो उसके बाद तुरंत ये वाला पार्ट है. यहां पे सोडियम चैनल्स वेर ओपनिंग एंड देयरफॉर यू कैन नॉट मेक वन मोर साइकिल ऑफ सोडियम चैनल्स टू ओपन. सेकेंड पार्ट, यहां पे अगर आप स्टिमुलस देते हो तो सोडियम चैनल्स हैव गॉन इनटू इनएक्टिवेशन स्टेट. So unless they come back to resting state, you cannot excite the nerve again. Sodium by potassium ratio is least at. ऐसा क्वेश्चन पूछा गया है. सोडियम टू पोटेशियम कंडक्शन रेशियो इज लीस्ट एट. ओके 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 ओके. अब आंसर का सही सही मतलब स्वरूप सामने आ रहा है. सोडियम टू पोटेशियम कंडक्टेंस इज लीस्ट एट, मतलब सोडियम कंडक्टेंस लीस्ट एंड पोटेशियम कंडक्टेंस मैक्सिमम इज एट दिस पॉइंट ऑफ टाइम. Sodium to potassium conductance will be least at this point of time. क्यों? At this point of time. क्यों? क्योंकि सोडियम चैनल्स हैव गॉट इनएक्टिवेटेड और यहाँ पे पोटेशियम कंडक्टेंस जो है वो मैक्सिमम रहता है, जिसकी वजह से रिपोलराइजेशन रैपिडली होता है. सो देयरफॉर ये क्वेश्चन के बारे में, ओके, 2 सेपरेट क्वेश्चंस, हाइपर स्टिमुलेशन एंड नो रिस्पॉन्स, एंड सेकंड क्वेश्चन विद दिस चार्ट वेयर सोडियम पोटेशियम लीस्ट एट. ओके, 2 क्वेश्चंस थे मतलब एक्शन पोटेंशियल के ऊपर. आई एम फीलिंग सो हैप्पी एंड रिलीव्ड कि मैंने ये जो 2 चीजें कही थी, एलवी पीवी लूप और एक्शन पोटेंशियल, दोनों आ गए. आएगा ही आएगा कहा था. ओके, तो 2 क्वेश्चंस थे, अलग अलग क्वेश्चंस थे, ऐसा भी ओपिनियन आया है. तो पहला पूछ रहे हैं कि ये यहां पे हाइपर स्टिमुलेशन करने पर भी रेस्पॉन्स नहीं आ रहा, तो उसका आंसर है सोडियम चैनल्स वेर ओपनिंग एंड यू कांट मेक देम ओपन अगेन. मतलब एक और साइकिल जनरेट नहीं कर सकते, ऑलरेडी पहली साइकिल चल रही है. तो ये ऑप्शन था. नहीं, सोडियम चैनल स्टिल रिमेन्स क्लोज नहीं है, सोडियम चैनल्स आर ओपनिंग एट दिस पॉइंट ऑफ टाइम. तो ये एक ग्राफ था. और दूसरा ग्राफ, दूसरा क्वेश्चन रादर, अगर ये पूछा गया कि सोडियम टू पोटेशियम कंडक्टेंस वाज लीस्ट एट व्हाट पॉइंट ऑफ टाइम, देन ऑफ कोर्स द आंसर शुड बी एट दिस पॉइंट ऑफ टाइम. या अगर वोल्टेज पूछो तो यहां पर सोडियम का कंडक्टेंस 0 हो चुका है और पोटेशियम का कंडक्टेंस अपने खुमार पे है, तो इस वजह से रिपोलराइजेशन बहुत रैपिडली होने लगता है फ्रॉम दैट पॉइंट और ग्राफ नीचे आने लगता है. तो आप एक बार फिर से थोड़ा रिकॉल करके अगर बताएं तो बेहतर होगा. हम फिर से एक बार नेक्स्ट वीक प्रॉपरली इन क्वेश्चंस के आंसर डिस्कस कर सकेंगे. ये शायद ओके, प्रवीण जी कह रहे दूसरा एंड हाइपर पोलराइजेशन था, दूसरा ग्राफ हाइपर पोलराइजेशन वाज द आंसर. नहीं, एग्जैक्टली क्वेश्चन क्या है? एट हाइपर पोलराइजेशन पोटेशियम कंडक्टेंस पूछा गया है. आप हाइपर पोलराइजेशन क्यों दिमाग में लेके बैठे हो? क्योंकि आपको लग रहा है कि एक्सेस पोटेशियम लीव्स. अरे भाई, वो लीव्स मतलब पोटेशियम बाहर जा चुका ऑलरेडी, उसकी वजह से हाइपर पोलराइजेशन हुआ है. उस वक्त पोटेशियम कंडक्टेंस मैक्सिमम नहीं रहता. कंडक्टेंस अलग इशू है और एक्सेस पोटेशियम लीव्स ये अलग इशू है. पोटेशियम का कंडक्टेंस मैक्सिमम कब रहता है? एक्शन पोटेंशियल के पीक पे पोटेशियम का कंडक्टेंस मैक्सिमम होता है, कंडक्टेंस, जिसकी वजह से बहुत रैपिडली पोटेशियम एग्जिट होता है. और हाइपर पोलराइजेशन जो है वो होता है एक्सेस पोटेशियम लीव्स, यानी कंडक्टेंस हो गया और पोटेशियम जा चुका, उसके बाद हाइपर पोलराइजेशन होता है. तो इसलिए हाँ, तो प्रवीण जी कह रहे हैं कि एट व्हाट पॉइंट पोटेशियम एंड सोडियम, पोटेशियम टू सोडियम रेशियो इज लीस्ट. अब ये फिर से उल्टा हो गया. आप मुझे क्वेश्चन भेजो, अगले आने वाले कुछ दिनों में हम प्रॉपरली उस क्वेश्चन को डिस्कस करेंगे. कोई सोडियम कह रहा है, कोई पोटेशियम कह रहा है रेशियो. अच्छा, आगे देखो, ये लीड्स V2, V3, V4. अब ये क्वेश्चन मेडिसिन में भी डिस्कस होगा, मैं सिर्फ आपको फिजियोलॉजिकल एंगल बता दूंगा इसका. लीड्स V2, V3, V4, देयर वाज ST सेगमेंट इलेवेशन, व्हाट विल बी द डायग्नोसिस? क्या ये क्वेश्चन था? और अगर था तो यही था, और यही ऑप्शंस थे. सेप्टल इन्फार्क्ट या एंटीरियर वॉल एमआई या इंफीरियर वॉल एमआई या एंटीरोसेप्टल एमआई. ओके, तो प्रवीण जी ये बताइए कि ये ऐसे ही था क्वेश्चन और इसमें मतलब क्या यही ऑप्शन थे इन लीड्स के बारे में? तो आपको क्विकली बता दूं क्योंकि मेडिसिन में भी डिस्कस होगा थोड़ा सा. V1 V2 है तो सेप्टल इन्फार्क्ट अगर है तो V1 V2 में, एंटीरियर वॉल है तो V3 V4 में मेनली, और V5 और V6 है तो लैटरल वॉल का, मतलब लैटरली प्लेस्ड एमआई होगा. इस तरीके से आप याद रखने के लिए V1 V2 V3 V4 V5 V6 ऐसा जोड़ी बना सकते हो. सो ओके, यूरिन ब्लैडर फिलिंग ग्राफ in plateau phase, best reason why pressure is not increasing. Okay, यानी सिस्टोमेट्रोग्राम. वेरी गुड. एक और क्वेश्चन आया है तो एक और क्वेश्चन ले लेते हैं. Cystometrogram was shown. Cystometrogram, pressure volume relationship of the urinary bladder. Thanks for giving this question. वर्टिकल एक्सिस पे प्रेशर है, हॉरिजॉन्टल एक्सिस पे यूरिन वॉल्यूम है. तो लेट्स से 100 ml, 400 ml, और ये सिस्टोमेट्रोग्राम के 3 फेजेस होते हैं. 3 phases of the cystometrogram. Phase 1A, 100 ml यूरिन ब्लैडर में भरने तक, फेज 1A. उसके बाद फेज 1B, ये जो प्लेटू आप कह रहे हो, दैट इज फेज 1B. एंड देन बियॉन्ड 400 ml द ग्राफ शूट्स अप. तो इसका कारण क्या है? क्या आप में से किसी ने लिखा है? इसका आंसर है, दिस इज बिकॉज ऑफ द लाप्लेसिस लॉ. लाप्लेसिस लॉ अगर ये था ऑप्शंस में तो ये आपका आंसर होना चाहिए. यहां इस फेज में ब्लैडर में यूरिन भरती है 100 ml से लेके 400 ml तक. तो लाप्लेसिस लॉ कहता है P इज इक्वल टू 2T/R. तो ब्लैडर वॉल का टेंशन बढ़ता है लेकिन उसका रेडियस भी बढ़ता है. न्यूमरेटर डिनोमिनेटर दोनों बढ़ते हैं और इसलिए इस फेज में जो है प्रेशर कांस्टेंट रहता है. ओके, सो compliance of the bladder, yes, you can say compliance of the bladder because this is pressure volume relationship and it's because of the compliance of the bladder. क्या लाप्लेसिस लॉ ऐसा कुछ था ऑप्शंस में, या P इज इक्वल टू 2T/R ऐसा कुछ था ऑप्शंस में? ये आप याद करके बता सकते हो. compliance was the question, was the option. okay, लाप्लेसिस नहीं था ऑप्शन में. okay, fine, but question was this na. If the question was this, then yes, it is because of the bladder wall compliance. It is because of the bladder wall compliance. Compliance is the pressure volume relationship for any hollow viscous. In this case bladder, हम ये hollow viscous की pressure volume relationship discuss कर रहे हैं. ओके, compliance था नहीं था, तो फिर ऑप्शंस क्या थे इसमें? क्या पूछा गया था, क्या ऑप्शंस थे? याद करके रखो, तब तक मैं आगे का क्वेश्चन ले लेता हूं. स्ट्रेंथ ड्यूरेशन कर्व, गाइज स्ट्रेंथ ड्यूरेशन कर्व दिखाई गई थी. क्या ये बात सच है? हाँ, इसलिए पूछ रहा हूं क्योंकि बहुत टाइम के बाद ये क्वेश्चन आया. वैसे हमने डिस्कस किया अपने सारे फोरम्स पे, तो ऑफ कोर्स आपको आंसर आएगा ही, लेकिन स्ट्रेंथ ड्यूरेशन कर्व आफ्टर 3-4 इयर्स पूछा गया है. तो ये स्ट्रेंथ ड्यूरेशन कर्व. ओके, एक और क्वेश्चन आया है. आईसीपी, इंट्राक्रैनियल प्रेशर मोर विथ लो हार्ट रेट, व्हिच रिफ्लेक्स इज कॉल्ड, इज दिस कॉल्ड? यस, इट इज कुशिंग्स रिफ्लेक्स. आपको याद होगा सीएनएस इश्चेमिक रिस्पॉन्स, ऑल्सो कॉल्ड एज लास्ट डिच स्टैंड. उसका एक वेरिएंट है कुशिंग रिफ्लेक्स. हाई इंट्राक्रैनियल टेंशन होता है, सीएसएफ प्रेशर बढ़ जाता है, जिसकी वजह से सीएसएफ प्रेशर बिकम्स मोर देन द सेरेब्रल आर्टरी प्रेशर, और फिर सीएनएस इश्चेमिया. सीएनएस इश्चेमिया की वजह से क्या होगा, ये जो आपने क्वेश्चन में पूछा है. सो ICP more with low heart rate, which reflex is that called? Answer is yes, Cushing reflex. Okay, coming to the strength duration curve. देखो strength duration curve क्या है? Strength of the stimulus आप अलग अलग अप्लाई करके देखते हो, and minimum strength that excites the tissue, that's taken as Rio base. तो चलो, आपने 1 यूनिट का स्टिमुलस दिया, नो रेस्पॉन्स. 2 यूनिट का स्टिमुलस अप्लाई करने पर एक 7-8 सेकंड के बाद आपको रेस्पॉन्स मिलता है, तो आपने ये मार्क कर लिया. इसके बाद सी, ये 2 यूनिट, दिस विल बी द रियो बेस. मिनिमम स्ट्रेंथ when applied to the tissue, it excites the tissue. This is called as Rio base. and time taken by the tissue to excite. देखो यहाँ पे टाइम हॉरिजॉन्टल एक्सिस पे टाइम है 7.5 सेकेंड्स, तो ये होगा यूटिलाइजेशन टाइम. यूटिलाइजेशन टाइम. एंड देन रियोबेस इज द मिनिमम स्ट्रेंथ अप्लाइड एंड इट एक्साइट्स द टिश्यू. तो अब हम डबल द रियोबेस स्ट्रेंथ अप्लाई करेंगे. क्या करेंगे? डबल द रियोबेस स्ट्रेंथ. मतलब 2 यूनिट में टिश्यू एक्साइट हो रही है, उसके नीचे नहीं हो रही है. 2 इज द मिनिमम रिक्वायर्ड. तो अभी हम 4 यूनिट वाला स्टिमुलस स्ट्रेंथ अप्लाई करेंगे और देखेंगे कितने टाइम में टिश्यू एक्साइट हो रही है. लेट्स से 2 सेकेंड्स में टिश्यू एक्साइट होती है, तो मार्क कर लिया यहां पर. इसको कहते हैं क्रोनैक्सी. तो आप इस तरीके से ये कर्व ऑब्टेन करते हो. दिस वाज द कर्व, द स्ट्रेंथ ड्यूरेशन कर्व. ओके, तो ये होगा, ये जो 2 सेकेंड में टिश्यू एक्साइट हो रही है, दिस विल बी क्रोनैक्सी. तो क्रोनैक्सी इज द टाइम टेकन बाय द टिश्यू टू एक्साइट व्हेन स्टिमुलस स्ट्रेंथ इज डबल द रियोबेस. ये देखो, रियोबेस वाज द मिनिमम स्ट्रेंथ, फिर आपने उसका डबल किया और अप्लाई किया, तो कितने टाइम में टिश्यू एक्साइट हो रही है वो चेक किया. 2 सेकेंड में टिश्यू एक्साइट की, तो मार्क किया यहां पे ये सेकेंड्स. 2 सेकेंड्स में दैट्स द ड्यूरेशन. सो दिस वाज द कर्व. और जैसा कि मैंने कहा, दिस विल बी द क्रोनैक्सी. और सिंगल रियोबेस स्ट्रेंथ अप्लाई करने पर टिश्यू एक्साइट होती है, तो उसको यूटिलाइजेशन टाइम कहते हैं. दिस इज क्रोनैक्सी, दिस इज यूटिलाइजेशन टाइम, 7-8 सेकेंड जो भी है. एंड रियोबेस इज 2 यूनिट्स. ग्राफ में क्रोनैक्सी बना हुआ था. ओके, एंड एबीसी लिखा हुआ था, उसको अरेंज करना था कि ए क्या है, बी क्या है, सी क्या है. ओके, थैंक यू वेरी मच. तो सबसे पहले रियोबेस, ये देखो वर्टिकल एक्सिस पे स्ट्रेंथ ऑफ द स्टिमुलस है 2 यूनिट स्ट्रेंथ एंड इट एक्साइटेड द टिश्यू. सो दिस इज रियोबेस ए. उसके बाद time taken by the tissue to excite when you apply Riobase strength. This is the time taken by the tissue. देखो horizontal axis पे time है. That time is called as utilization time. So let's write it B here. And then आप double the Riobase strength apply करते हो. 2 into Riobase. यानी 2 को excite हुई थी, तो आप 4 यूनिट का अप्लाई करते हो और देखते हो कि कितने टाइम में टिश्यू एक्साइट हो रही है. इतने टाइम में, 2 सेकेंड्स में. So this will be the chronaxy. That will be the point C. So ये है रियोबेस, ये है यूटिलाइजेशन टाइम और ये है क्रोनैक्सी. ए रियोबेस, बी यूटिलाइजेशन टाइम एंड सी इज क्रोनैक्सी. दिस वन इज क्रोनैक्सी. तो आई होप कि आपको ये आया होगा. ये बहुत ही टिपिकल फिजियोलॉजी क्वेश्चन है, मतलब थोड़ा सा ज्यादा ही डिटेल्ड टाइप का क्वेश्चन है, बट कोई बात नहीं. होता है ऐसा कभी कभी. आप फिर से एक बार चेक करो दोबारा से, शायद आपका सही आया हो. ये मिक्सअप, मैंने यहाँ पे एबीसी कुछ बताया, आपने कुछ देखा, ऐसा भी हो सकता है. ओके, नो प्रॉब्लम. आगे बढ़ते हैं. एक और क्वेश्चन था फिजियोलॉजी का. आई डोंट नो गायनी में हुआ कि नहीं. A 54-year-old female presents to gynecology clinic complaining of hot flushes. क्लियरली आंसर ही बता दिया है. 54 ईयर एज है और हॉट फ्लशेस, मतलब ये मेनोपॉजल सिम्टम्स है. हॉट फ्लशेस, नाइट स्वेट्स, एमेनोरिया फॉर द पास्ट 14 months. Which hormonal profile is characteristic of this physiologic state? क्या ये क्वेश्चन था? ये क्वेश्चन था ना? ओके, सो ऑब्वियसली आपको पता है मेनोपॉजल हॉट फ्लशेस का प्राइमरीली मतलब उसमें क्या होता है, हार्मोनल पैटर्न. ईस्ट्रोजन कम होने लगता है, कम हो चुका होता है. एंड बाय नेगेटिव फीडबैक आप कह सकते हो FSH LH लेवल्स आर हाई. ओके, so FSH LH levels are high eventually they also start declining. मतलब after years even FSH LH levels begin to decline. लेकिन उन्होंने 14 months दिया है, तो आपने क्या आंसर लिखा है इसका? I just want to know कि आपका सही आया होगा. बट लो इस्ट्रोजेन वाला एक ही ऑप्शन है, दो ऑप्शन दिख रहे हैं इसमें, लो इस्ट्रोजेन एंड हाई FSH LH. अगर ये था तो high progesterone and rest all decrease. That was the last question, last option. Correct. Low FSH, high LH, high progesterone. तो आप कह रहे हो हाई प्रोजेस्टेरॉन था और बाकी ऑल डिक्रीज था. लास्ट ऑप्शन. ओके फाइन, नोटेड. हम फिर से एक बार आपके साथ आएंगे, रूबरू होंगे तो प्रॉपरली डिस्कस करेंगे, आपको भी अच्छे से वो करने को मिलेगा. लेकिन आपकी एग्जाम हुई है एंड ऑल द बेस्ट. हम चाहेंगे कि आप निकल जाए सो दैट मतलब दोबारा से वही सर्व करने का जरूरत ही ना पड़े, है ना. लेकिन फिर भी हम अपनी तरफ से ये सारे क्वेश्चन जो आप भेज रहे हो उसका फिर से एक बार प्रॉपर वीडियो बना के आपके पास भेजेंगे, आई मीन अपलोड कर देंगे. So thank you very much. I think Dr. Sanchit sir is waiting for ENT question discussion. So over to you, Sanchit sir.
सबका एग्जाम अच्छा हुआ होगा. Now as far as my subject is concerned, ENT is something जो बहुत ही easy था. इस बार बहुत इजी क्वेश्चंस आए थे. द हाईएस्ट वर द PYQs एंड द PYTs. और मान के चलो जो हमने लास्ट FMG मैराथन करी थी उसमें से स्ट्रेट फॉरवर्ड क्वेश्चंस आए. तो मैं आपको दिखाऊंगा जो हमने पढ़ा था एग्जैक्टली वही आया एज इट इज. एंड दिस टाइम अगर आपने ENT स्कोर किया है तो यू आर गोइंग टू गेट 15 क्वेश्चंस व्हिच आर गोइंग टू बी करेक्ट. ठीक है, चलो. पहला क्वेश्चन था दैट दे हैड गिवन अबाउट अ हिस्ट्री ऑफ थायराइड सर्जरी. ये कोई लेडी थी जिसकी थायराइड सर्जरी हुई है एंड दे प्रेजेंटेड विद कंप्लेंट्स ऑफ इनएबिलिटी टू हिट द हाई नोट्स on a temple choir. Now whenever they say they cannot hit the high notes, that means kaun si nerve hai? It is the external branch of superior laryngeal nerve. External laryngeal nerve supplies your cricothyroid muscle. Cricothyroid muscle is the tensor of vocal cord. That is why it is also called as the singer's muscle. अब इसके जो हायर नोट्स नहीं जा रहे हैं उसका रीजन पूछा गया है. इज इट एक्सटर्नल ब्रांच ऑफ SLN, इंटरनल ब्रांच ऑफ SLN? दे गेव एन इंट्यूबेशन ग्रैन्युलोमा और रिकरेंट लैरिंजियल नर्व. आंसर है एक्सटर्नल ब्रांच ऑफ सुपीरियर लैरिंजियल नर्व. सेम टू सेम दिस वाज अ क्वेश्चन दैट आई प्रेडिक्टेड इन योर मैराथन व्हेन आई वाज टीचिंग यू वोकल पैल्सी एंड आई टॉट द सेम क्वेश्चन राइट अवे. जैसा कहता है ऐसा था सेम. ठीक है, तो +1 करते चलो, ये सब फंसेंगे. इट्स गोइंग टू बी एज सिंपल. अगर आपके सारे आंसर सही हो गए तो ENT विल बी द सब्जेक्ट. Let me be very clear, which will push you in this exam. चलो, अब आया a patient presented with hearing loss to the ENT OPD. आपने tuning fork किया that had patients bilateral positive Rene and the Weber's was lateralized to the left ear. What is the diagnosis of this patient? ये पूछा गया है. That means if they have given bilateral positive Rene, positive Rene means air conduction is more than bone conduction, which is only seen in normal people or in sensorineural hearing loss. अब इसका Weber's is lateralized to the left, यानी कि Weber's only lateralizes to the better ear, यानी इसका right ear खराब है. If it is right ear खराब है, the answer will be right ear sensorineural hearing loss. Same to same, right? Opposite ear में SNHL होगा. ठीक, so answer will be right ear SNHL or the opposite side SNHL. Same question taught in marathon as it is. Second question जो मैराथन से फंसा. So अगर आपने वो 3 घंटे की मैराथन देखी है, सारे क्वेश्चन उसमें से ही हैं. चलो, अब आते हैं इनटू द थर्ड क्वेश्चन. ओमेगा शेप्ड एपिग्लॉटिस. दिस इज द फेवरेट क्वेश्चन दैट इज आस्क्ड इन FMG. ये मैंने आपको दिखाया था इन द मैराथन आल्सो कि अगर ओमेगा साइन या ओमेगा शेप्ड एपिग्लॉटिस दिखे, इट इज द कंडीशन व्हिच इज द मोस्ट कॉमन कंजेनाइटल इंस्पिरेटरी स्ट्राइडर. आंसर लैरिंगोमलेशिया. सेम टू सेम, राइट? सो दिस इज लैरिंगोमलेशिया. ओके, वर्ड टू वर्ड बता रहा हूं आपके. अरे मेरे पास पेपर नहीं है. दिस इज ऑन अ वेरी ब्रिलियंट रिकॉल व्हिच हैपेंस बिकॉज ऑफ स्टूडेंट्स. सो आई गॉट वेरी गुड मैसेजेस अबाउट स्टूडेंट्स फ्रॉम अक्रॉस. और सबने बोला कि ENT इस बार बहुत अच्छा हुआ है. एंड यू नो वन ऑफ द रीजंस वाज कि आपने अगर मैराथन अच्छे से करी थी, ये सारे क्वेश्चन मैराथन में थे. अब आ जाओ 45-year-old फीमेल. मैंने बताया था whenever a female smoker comes with heaviness of voice and the laryngoscopy shows bag of water appearance, जहां पे ये पॉलिथीन बैग जैसे दिख गए ना बड़े बड़े फिल्ड विद वाटर, व्हाट इज द आंसर? अनडाउटेडली इट इज रिंकीज एडिमा, राइट? और ये देखो, ये सेम इमेज आई हैड शोन इन योर मैराथन आल्सो. सेम इमेज थी जो मैंने आपको मैराथन में बताई थी. तो अगर आपने मैराथन अटेंड किया, आई एम टेलिंग यू वुड हैव गॉट दिस क्वेश्चंस राइट. आपको सारे क्वेश्चन मिल जाते बिकॉज ENT वाज अ पीस ऑफ केक दिस टाइम, अ केक वॉक. ठीक है, वेरी गुड, चलते रहो, +1 करते रहो. नाउ लेट मी कम टू द नेक्स्ट क्वेश्चन. 35-year-old फीमेल. अब ये क्वेश्चन था अबाउट राइनोस्क्लेरोमा. ओके, एंड दे हैड आस्क्ड अबाउट कि इस राइनोस्क्लेरोमा का ट्रीटमेंट क्या होता है. मैंने आपको पहले भी बताया था, व्हेन आई डिड योर मैराथन ऑल्सो, मैंने आपको बताया है कि हमेशा राइनोस्क्लेरोमा का ट्रीटमेंट पहले एंटीबायोटिक्स होता है एंड देन उसके बाद सर्जरी करनी पड़ती है. व्हाई? बिकॉज एंटीबायोटिक्स आर गोइंग टू कंट्रोल द क्लेप्शियला राइनोस्क्लेरोमैटिस इंफेक्शन. ड्रग ऑफ चॉइस स्ट्रेप्टोमाइसिन बताई थी, और उसके बाद क्योंकि देयर इज ग्रॉस डिफॉर्मिटी इन द नोज, टापीर नोज हो जाती है, एंड दैट इज द रीजन वी नीड टू डू सेप्टोराइनोप्लास्टी. सो हियर वी विल गिव हाई डोज एंटीबायोटिक्स विद सर्जरी. दैट इज गोइंग टू बी द राइट आंसर फॉर राइनोस्क्लेरोमा. बिल्कुल ठीक, चलते चलो. राइट? नहीं, मेरी सेटिंग नहीं है एनबीए में, ठीक है, जिस दिन होगी उस दिन मैं सारे क्वेश्चन बता दूंगा आप लोगों को पहले एग्जाम के. चलो अब आते हैं नेक्स्ट क्वेश्चन. 40-year-old मेल प्रेजेंटेड विद होर्सनेस ऑफ वॉइस. अब ये वोकल कॉर्ड कार्सिनोमा, क्या बताया था? पैल्सी आएगा, आया. कार्सिनोमा बोला था, आएगा, आया. सेम टू सेम क्वेश्चंस. एंड दे हैड डन अ लारिंगोस्कोपी जिसमें दिखा कि राइट वोकल कॉर्ड पे देयर इज अ ग्रोथ प्रेजेंट. एक वोकल कॉर्ड पे ग्रोथ थी. ओके, now what they have asked is that this vocal cord was fixed. मैंने आपको क्या बताया था? अगर वोकल कॉर्ड पे ग्रोथ है एंड अगर उन्होंने टर्म यूज कर लिया फिक्स्ड, ऑटोमेटिकली द स्टेज बिकम्स T3. ये मैंने आपको बताया था. When they use fixity of cord, the stage is T3, and if it is T3, the treatment of choice always becomes concurrent chemoradiation, CCRT. Right? That is going to be the choice. तो ये क्वेश्चन भी स्ट्रेट फॉरवर्ड फ्रॉम मैराथन आया, एंड आई टोल्ड यू दैट इन स्टेज 3 देयर इज ऑर्गन प्रिजर्वेशन प्रोटोकॉल वेयर वी गो फॉर द ट्रीटमेंट ऑफ चॉइस कंकरेंट कीमो आरटी विदाउट अ डाउट. और कुछ नहीं है. अगर उन्होंने फिक्सिटी ऑफ कॉर्ड मेंशन नहीं किया होता तब रेडिएशन अलोन वुड हैव बीन द आंसर, बट अगर फिक्स्ड है देन इट वुड हैव बीन कंकरेंट कीमो रेडिएशन. ठीक है, फाइन, दैट्स द ट्रीटमेंट ऑफ चॉइस एज फार एज वोकल कॉर्ड कार्सिनोमास आर कंसर्न्ड. चलो, now let me come to the next question. Now what they have given, 65-year-old patient presents with a non-healing ulcer over the tongue since the past 3 months, suspicious of oral malignancy. Which biopsy method is the best to use this diagnosis? अब हमेशा याद रखना, मैंने आपको बताया भी था और सेम मैंने अपने नोट्स में भी टंग का डायग्राम बना के दिखाया है, that whenever you have got any carcinoma at any particular site over the tongue, तो हम लोग क्या करते हैं, we take a wedge shaped biopsy. वेज की तरह हम बायोप्सी निकालते हैं. Why? Because we are going to take the normal tissue as well. We are going to confirm the normal tissue with the growth, right? So the answer here will be a wedge biopsy. That is what we are going to do in order to prove the cancer. Excision तब करेंगे once we have proven that this is a carcinoma. So the answer here will be taking a wedge biopsy will prove that this is a carcinoma. Okay, fine. तो हमेशा क्यों लिया जाता है? We always take a normal tissue with it. ठीक है, ये बात याद रखना. हमेशा बायोप्सी में हमेशा एक नॉर्मल टिश्यू भी लेना जरूरी होता है ताकि हम कंपेयर कर सकें. तभी बेस्ट आंसर अमंग इट वुड बी अ वेज बायोप्सी. राइट? अगर पंच बायोप्सी भी दिया है तभी भी द आंसर बेटर वुड बी हियर वुड बी अ वेज बायोप्सी. ओके, फाइन. चलो अब आ जाओ इनटू द नेक्स्ट क्वेश्चन. अब ये भी मैंने आपको बताया है, ये सेम टू सेम. दिस वाज द वर्डिंग इन माय नोट, दिस इज द वर्डिंग व्हिच इज गिवन इन माय लेक्चर्स एज वेल. If there was a 5-year-old child brought by the parents with a congenital deformity of the external ear, the parents are concerned about the cosmetic appearance and the social acceptance. At what age will you correct this deformity? मैंने आपको बताया भी है the rule of 6 in Pinna. Pinna develops at 6 weeks of gestation by 6 hillocks of his, and it completes its size by 6 years of age. तो 6 years is something जब पिन्ना डेवलप हो जाता है, and that is what I have told कि any particular congenital anomaly has to be treated by and after 6 years of age. उसके पहले पिन्ना का डेवलपमेंट चल रहा होता है, तो इसमें भी आप लोग +1 कर लो तो ये बिल्कुल ठीक है. राइट? ओके, चलो, वेरी गुड. तो आप लोग तो सारे आंसर सही कर रहे हो, इसका मतलब ENT was good this time. आप लोगों को मजा आया इस बार ENT देके. 65-year-old male with progressive dysphagia and regurgitation of undigested food. ये बार बार मुंह में फूड आ रहा है. Following muscle weakness will lead to this condition. What is the muscle mark? तो उन्होंने ये muscle mark करके दिया था. If I'm not wrong, right? So what are they showing over here? They are showing Killian's dehiscence. वो दिखा रहे हैं this triangle which is called as Killian's dehiscence, which is a triangle which is present between the oblique fibers of the thyropharyngeus muscle above and the horizontal fibers of the cricopharyngeus muscle below. ये दोनों inferior constrictor का part होते हैं. So what is this? This is your cricopharyngeus muscle. Right? Okay, चलो भाई. तो इसका आंसर हो गया क्रिकोफैरेंजियस। सेम क्वेश्चन देखो, यही मैराथन में मैंने पढ़ाया था, सेम क्वेश्चन पढ़ाया था मैराथन में। तो वही मैं कह रहा हूं, अगर आपने मैराथन देख ली होती 3 घंटे की तो आपका आज निकल गया था। ईएनटी वॉज थ्रू ओनली ऑन मैराथन टुडे, राइट? चलो भाई, डी डॉक्टर जी, थैंक यू वेरी मच। चलो, अब आई गॉट समथिंग फ्रॉम द स्टूडेंट्स दैट देयर वर 2 ऑडियोग्राम रिलेटेड क्वेश्चन, 2 आए थे, राइट? एक ऑडियोग्राम ऐसा था, राइट? इसमें था 30-year-old मेल फैक्ट्री वर्कर प्रेजेंटेड विद बायलैटरल हियरिंग लॉस व्हिच वाज प्रोग्रेसिव, व्हाट इज द लाइकली डायग्नोसिस बेस्ड ऑन द ऑडियोग्राम? तो ये प्योर टोन ऑडियोग्राम है। मैंने आपको क्या बताया था? मैंने आपको बताया था एयर कंडक्शन गिरा, बोन कंडक्शन गिरा, साथ साथ गिरे। अगर साथ साथ है तो सेंसोरी न्यूरल है। नाउ एट एनी ऑडियोग्राम इफ यू सी अ डिप ऑफ सेंसोरी न्यूरल हियरिंग लॉस एट 4000 हर्ट्ज, ये एग्जैक्ट क्वेश्चन है जो मैंने आपको आपके मैराथन में 4 ऑडियोग्राम पढ़ाए हैं, जिसमें से 2 ऑडियोग्राम केम टुडे। 2 ऑडियोग्राम स्ट्रेट फॉरवर्ड केम टुडे। दिस वाज द फर्स्ट। 4000 हर्ट्ज पे अगर सेंसोरी न्यूरल हियरिंग लॉस है, दिस इज कॉल्ड एज अ बॉयलर मेकर्स नॉच, एंड दिस इज अ कैरेक्टरिस्टिक फीचर ऑफ नॉइज इंड्यूस्ड हियरिंग लॉस या फिर NIHL. So the answer will be noise induced hearing loss. Same question, right? Okay. चलो, तो इससे अगर कुछ भी होगा, बट इसमें 4000 हर्ट्ज पे आपको एक डिप आई होगी, 4000 डिप आई होगी, राइट? सो देयर विल बी, ये ओटोस्क्लेरोसिस का क्वेश्चन नहीं है ना, ये ओटोस्क्लेरोसिस नहीं है, इसमें कंफ्यूज मत होना। एक और ऑडियोग्राम आया था जिसमें देयर वुड बी ओटोस्क्लेरोसिस, ओके, देयर वुड हैव बीन ओटोस्क्लेरोसिस एक और क्वेश्चन में। तो ये नॉइज इंड्यूस्ड हियरिंग लॉस है, दैट इज बॉयलर्स नॉच, 4000 पे सेंसोरी न्यूरल हियरिंग लॉस। अब आपका एक और क्वेश्चन ऑडियोग्राम पे आया था, लेट मी जस्ट रिफ्रेश यू। आपको यह पूछा गया था ऑडियोग्राम दिखा के, व्हाट इज द इन्वेस्टिगेशन एंड द डायग्नोसिस, अगर मैं रॉन्ग नहीं हूं तो आपको यह क्वेश्चन दिया गया था। एक प्योरटोन ऑडियोग्राम आया था एंड दे हैड आस्क्ड यू कि इसकी क्या डायग्नोसिस है एंड व्हाट इज द इन्वेस्टिगेशन बीइंग डन। तो what is this? I told you, if you ever get a frequency versus amplitude curve, this is a pure tone audiogram. And in pure tone audiogram दो चीजें होती हैं, जो भी broken है तो B for broken, B for bone conduction, जो भी solid है वो है air conduction. What can you see? You can see bone conduction dip at 2000 hertz. इसको क्या बोलते हैं? इसे बोलते हैं Carhart's notch. Carhart's notch किस में दिखती है? Carhart's notch is seen in cases of otosclerosis. ओटोस्क्लेरोसिस। तो आपके पास ये क्वेश्चन आया था, राइट? दैट व्हाट इज द डायग्नोसिस एंड व्हाट इज दिस इन्वेस्टिगेशन? इन्वेस्टिगेशन विल बी प्योरटोन ऑडियोमेट्री एंड ओटोस्क्लेरोसिस विल बी द डायग्नोसिस। थोड़ी बहुत डिफरेंस हो सकती है, अब प्योरटोन ऑडियोग्राम बहुत सारे होते हैं, थोड़ी बहुत डिफरेंसेस हो सकती है, बट मोस्ट कॉमनली यू विल फाइंड दिस काइंड ऑफ अ बोन कंडक्शन। NIHL का मैंने ऑलरेडी ग्राफ दिखा दिया। NIHL में बोन कंडक्शन विल गो डाउन, एयर कंडक्शन विल गो डाउन एट 4000 हर्ट्ज, दैट्स कॉल्ड एज बॉयलर मेकर्स नॉच। ठीक है, चलो आगे बढ़े। सो सेम क्वेश्चन, दिस वाज आल्सो देयर, 2000 हर्ट्ज ये था, दिस वाज डेफिनेटली देयर वेयर यू हैव बीन आस्क्ड अबाउट व्हाट इज द डायग्नोसिस एंड व्हाट इज द इन्वेस्टिगेशन। तो प्योरटोन ऑडियोमेट्री विद ओटोस्क्लेरोसिस, यही क्वेश्चन मुझे मिला है, दैट्स व्हाट द पीपल हैव टोल्ड मी आफ्टर वी डिड दैट सर्वे। चलो, अब ये क्वेश्चन आया था, I hope you got this particular question, where they had a 5-year-old child who presented to the emergency with difficulty in swallowing and drooling of saliva, right? There is no history of fever or cough. On an X-ray AP view, you find the following finding. What is the site of the foreign body lodgement? ये आया था, right? I hope this had come. That was about the foreign body. Now, what is this foreign body? This is a coin, right? Now, whenever the coin goes inside, मैंने हमेशा बताया है, when the coin goes inside, and coin का अगर आपको anteroposterior view में, if you see the face of the coin suggests that this particular foreign body is in the esophagus. तो कॉइन का फेस दिखेगा एपी व्यू में, द कॉइन इज इन द ईसोफेगस। कॉइन का लैटरल सरफेस जब आप लेंगे तो उसकी रिम दिखेगी, राइट? सो द आंसर हियर वुड बी ईसोफेगस, right? This will be esophagus. So without a doubt, this is esophagus. The same that I tell you in my lectures also, that when you see the face of the coin in the anteroposterior view and the rim of the coin on the lateral view, then this particular coin is inside the esophagus. Same to same question, same to same फंडे, बहुत easy और बहुत straightforward, right? चलो अब आगे बढ़ते हैं, आगे देखो। Now this particular question came, अब ये थोड़ा ट्रिकी था, पर मैंने अपने क्वेश्चंस में भी ये आपको बताया है, अगर आपने ध्यान से सुना है तो। A 30-year-old male presented with features of chronic sinusitis, severe crusting and saddle nose deformity. What is the likely diagnosis of this patient? तो ये आज के क्वेश्चंस में सबसे टफ क्वेश्चन यही था, राइट? तो what they have told sinusitis है, crusting है. Now crusting suggests that this is a case of secondary atrophic rhinitis. सेकेंडरी एट्रोफिक राइनाइटिस इज कॉमनली एसोसिएटेड, जब भी उसमें ग्रैनुलोमैटस डिजीजेस होती हैं, ग्रैनुलोमैटस डिजीजेस से बोन डिस्ट्रक्शन होता है, तो बोन डिस्ट्रक्शन की वजह से द बोन सैडल्स डाउन, ये एक्सटर्नल नोज सैडल कर जाती है। कौन सी ग्रैनुलोमैटस डिजीज सैडल नोज डिफॉर्मिटी और एट्रोफिक राइनाइटिस करेगी? आई टोल्ड यू दैट वेगनस ग्रैनुलोमेटोसिस इज वन पर्टिकुलर कंडीशन व्हिच विल प्रोड्यूस a saddle nose deformity together with chronic sinusitis as well as severe crusting. तो अगर आपके ऑप्शंस में कोई ग्रैनुलोमैटस डिसऑर्डर था लाइक वेगनस ग्रैनुलोमेटोसिस, या फिर उन्होंने मेंशन किया हो अबाउट ग्रैनुलोमैटस डिजीजेस ऑफ द नोज, then definitely that would have been the answer, because that triad will be seen over here. This is a type of vasculitis which happens, which causes external nasal destruction. हो सकता है आपको severe retractions in chest भी दिए, अगर severe retractions in chest है तो भी veganers will get into the answer because that also causes pulmonary involvement. Okay, fine, right? Chronic rhinitis है, that is not going to be the right answer. अगर chronic rhinitis भी इसमें एक ऑप्शन है, that is not the right answer. राइट ये सारे क्वेश्चन मेरे नोट से हैं, ये सारे के सारे सेम टू सेम सारे क्वेश्चन नोट से आए हैं, बिल्कुल जी। तो डॉक्टर जी थैंक यू जी, चलिए आगे बढ़े। नाउ दे हैड गिवन यू अ क्वेश्चन ऑन ट्रेकियोस्टमी। उन्होंने आपको ये दिया कि 22-year-old मेल है who presented with trauma to the neck with the wound present between the cricoid और mandible। यहां पे गई उसके कट इंजरी हो गई होगी थ्रोट पे, राइट? ओके, ग्रैनुलोमैटस डिजीजेस विद पॉलीएंजाइटिस का मतलब ही वेगनस ग्रैनुलोमेटोसिस है, दैट्स द अदर नेम फॉर इट, राइट? तो वही आंसर है इसका। ओके, so this is a question that has trauma to the neck with the wound present between the cricoid and the mandible. He also complained of respiratory difficulty. Where is the incision put in this condition for airway management? अब इसने आपको इस तरीके का कुछ दिया था, right? You must have been given a tracheobronchial tree और उसमें बताया गया कि आप incision कहां देंगे। तो मैंने आपको हमेशा बताया है, अपने नोट्स में भी मैंने लिखा है कि इंसिजन ट्रेकियोस्टमी में इज ऑलवेज गिवन आइडियली बिटवीन सेकंड टू फोर्थ ट्रेकियल रिंग, जिसे हम मिड ट्रेकियोस्टमी कहते हैं। That's the ideal and the most elective place. That is why the answer over here will be between second to fourth tracheal ring, and here this will be the right answer. This is the right way to do a tracheostomy, क्योंकि आपके पास एक आपको एयरवे खोलना है, तो आप कहां पे खोलेंगे? At the right place, at between second to fourth tracheal ring, right? So you're going to do a tracheostomy for this patient. That's what is the answer, right? यही क्वेश्चन था, यही पर्टिकुलर डायग्राम भी आया था, आई होप, राइट? चलो अब आ जाओ मेरे फाइनल क्वेश्चन पे। फाइनल क्वेश्चन इज 15। 15वें क्वेश्चन में आपके पास एक पेरोटिड सर्जरी दिखाई गई होगी, राइट? पेरोटिड तो इमीडिएट था क्वेश्चन में, मतलब व्हाट डू यू अंडरस्टैंड बाय इमीडिएट? तो अगर उन्होंने इमरजेंसी पूछा है तो क्रिकोथायरोटमी है, अगर उन्होंने ट्रेकियोस्टमी, आई गॉट द आंसर कि ट्रेकियोस्टमी पूछी गई है, साइट ऑफ इंसिजन पूछा गया है। पेरोटिड सर्जरी में उन्होंने इंफ्रा ऑरिक्यूलर, आपको एक डायग्राम दिखाया होगा, दिस माइट नॉट बी द एग्जैक्ट डायग्राम, बट आपको एक सर्जरी का डायग्राम होगा जिसमें उन्होंने पेरोटिड सर्जरी के समय इंफ्रा ऑरिक्यूलर, जस्ट ऑरिकल के नीचे फेशियल नर्व के अराउंड एक पॉइंटर दिखाया है कि ये कौन सा एरिया है, व्हाट इज दिस एरिया व्हाट दे हैव पॉइंटेड आउट, राइट? तो अगर इमीडिएटली आपको एक पॉइंटर दिखाया गया है और इमीडिएटली अगर आपकी बाहर फेशियल नर्व आ रही है, तो जस्ट बिलो द ऑरिकल जहां से फेशियल नर्व निकलती है, दिस इज कॉल्ड एज ट्रेगल पॉइंटर, ठीक है? अब प्रीवियस क्वेश्चन में कोई कह रहा है इमरजेंसी था, अगर इमरजेंसी है तो क्रिकोथायरोटमी करेंगे, ये बात याद रखना। इमरजेंसी में अगर है तो क्रिकोथायरोटमी करेंगे, दैट विल बी एट द क्रिकोथायरॉइड मेम्ब्रेन, राइट? बट इफ इट इज दैट इट इज दे आर डूइंग एन इलेक्टिव सर्जरी, देन आइडियली दे शुड डू between second to fourth tracheal ring, ठीक है? between second to fourth tracheal ring. तो what they have told here is, what is this? This is something which is called as tragal pointer. इसे कहते हैं ट्रेगल पॉइंटर। जब भी इंफ्रा ऑरिकुलर हो तो उसे ट्रेगल पॉइंटर कहा जाता है। व्हाट इज ट्रेगल पॉइंटर? 1 centimeter anterior and inferior and medial to the tragels you will find your facial nerve, right? That is in parotid surgery. Tympanomastoid suture भी इंपॉर्टेंट है, वो भी एक पर्टिकुलर चीज होती है, that is a suture present between the tympanic bone and the mastoid bone, जिसके 6 to 8 millimeters नीचे होती है फेशियल नर्व, साइलोइड प्रोसेस के लैटरल होती है फेशियल नर्व, पोस्टीरियर बेली डायगैस्ट्रिक के सुपीरियर होती है फेशियल नर्व। सो ऑल ऑफ देम आर पॉइंटर्स, राइट? तो अगर इमेज थी उसमें लेबल्ड पूछा था 1 2 3 कि 1 2 3 जो भी पूछा था, तो बेसिकली ऑल ऑफ दीज आर पॉइंटर्स फॉर फेशियल नर्व। I could not get this exact thing क्योंकि मुझे ट्रेगल पॉइंटर बताया बच्चों ने अबाउट द रिकॉल, बट इफ यू आर डेफिनेट देन ये ट्रेगल पॉइंटर जो दिख रही है वो ट्रेगल पॉइंटर है। ये सारे ऑप्शंस आपके सर्जिकल पॉइंटर्स ऑफ फेशियल नर्व हैं। तो ट्रेगल पॉइंटर मोस्ट कॉमन 1 centimeter बिलो एंड इंफीरियर, 6 to 8 millimeters inferior to tympanomastoid suture, lateral to the styloid and superior to the posterior belly. That is going to be the answer कि ये facial nerve के pointers क्या होते हैं. Okay, fine. So this is going to be again. So this is also, these are the pointers which I have told you in your lectures as well. That what are the pointers I have given you. अगर इसकी labeling आई थी तो वो labeling में ये 4 mentioned होंगे ही होंगे. और जहां पे भी ये 4 mentioned थे वही उसमें से सही आंसर है. ओके फाइन. तो 12 में से 15. चलो अब हो सकता है रिकॉल में सम और द अदर थिंग माइट गो हियर एंड देयर, बट दैट्स अ वेरी गुड स्कोर. बट गुड, आई एम वेरी हैप्पी दैट एट लीस्ट यू गाइस हैव गॉटन द मैक्सिमम क्वेश्चंस राइट, एंड विशिंग यू ऑल द बेस्ट. व्हेन द गोइंग गेट्स टफ, the tough get going, and you guys are really tough to go on forward. Wishing you all the very best. Over to you, Santosh sir. Thank you.
Thank you, sir, and a commendable job, sir. So guys, I know as usual medicine is the probably most complex subject when it comes to any entrance exam. Questions from medicine are generally lengthy and I haven't got the full recall yet, but whatever I've got I will definitely discuss. And how would I rate this paper? Well, the questions were on the predictable lines. Some of you might find them difficult because you could not relate to them conceptually, but they were all on the predictable lines because I told you in the marathon as well as several previous YouTube engagements, including the strategy video that I had shared, that questions will come from ABG. Between pulse and JVP, questions are going to come from there. Valvular heart disease, one question is going to come. So most of the predicted topics were asked. The language may be a bit different this time. Okay, now let me start with the first question. This was a question that I got from the students. A patient with chest pain, ECG showing ST elevation in 2-3 AVF. Was it an image based question or they had just mentioned that there is ST elevation in 2-3 AVF? I'm not very sure as of now. But nonetheless, if there was ST elevation in 2-3 AVF, we know what is it talking about, right? If there is ST elevation in 2-3 AVF, it is talking about inferior wall MI. And remember, inferior wall receives the blood supply from right coronary artery, which is also the dominant blood supplier to the posterior wall and the right ventricular wall. So inferior wall MI may be often associated with posterior wall MI and right ventricular MI. Now in this case, this particular patient has hypotension. So please remember, inferior wall MI plus hypotension or hemodynamic instability, you should think of the right ventricular MI. Now I want just a small image was given. Good. So I just want one clarification. Was the IV fluid available in the options or only it was about vasopressors, nitroglycerin, diuretics? I think it was a pretty logical answer because if it is a patient with hemodynamic instability, BP already low, do we give vasodilators? If you give vasodilators, further drop in BP happens, we wouldn't give. Would you give diuretics to a patient with low BP? Of course not. If you give diuretics, there will be volume loss, BP further drops. So we have to make a choice between vasopressors and IV fluids. Was IV fluid in the option? Because students did not tell me. I only got 3 options: vasopressors, nitroglycerin, and diuretics. Nitroglycerin is not the answers. We don't give vasodilators, especially in patients with right ventricular MI, and for that matter, anyone with hemodynamic instability. Okay, good. So there was IV fluid or normal saline mentioned. So in that case, please remember, I know some of the other faculty members in other platforms might have told you vasopressor as the right answer. I understand because their answer was based on only these 3 options available to them. But if you mention that there was also 0.9% of normal saline was mentioned, remember whenever we have right ventricular MI, the right ventricular force of contraction comes down. So right ventricular output comes down, and we know that the blood coming to the left side of the heart comes from the right. So if right is not sending sufficient blood to the left side of the heart, left ventricular filling comes down, left ventricular preload comes down, left ventricular output comes down, and BP drops. So if I want to correct this BP first, the first thing I have to do is I have to improve the right ventricular output, and I can achieve that quickly by giving some fluids. So the first step in that case, the management, the first step should be IV fluids. And once you have done the fluid resuscitation, then you should go ahead with the vasopressors. So vasopressors are not the first step. IV fluids are the first step. If IV fluid was the answer, option was there, IV fluids, then I would go ahead with IV fluids as the answer. If there was no IV fluid, then you can stick to vasopressors as the answer. But I'm very sure if IV fluid was there, the normal saline was mentioned, you are going to stick to that as your answer. Okay. Anyway, I will refine this question if I get more detailed input from the students and share it with you. Okay. The next question, again, I need a little bit of input from you. The question was about a 60-year-old female with 30 years history of smoking. FEV1 by FVC ratio was mentioned as less than 0.7. And we all know less than 0.7 means obstructive disorder. We are thinking of three conditions: asthma, COPD, and bronchiectasis. Post bronchodilator, the FEV1 increased by 18%. And there was a chest X-ray image, right? Can anybody tell me, was there a chest X-ray image given? Dr. J.I., if IV fluids were there, that's our answer. Was there a chest X-ray given with emphysematous changes? I mean, was there an image mentioning widening of rib spaces and flattened diaphragm and tubular heart? Okay, so the answer is pretty simple. If there was an X-ray with the emphysematous changes, our answer becomes, because see, from the PFT, okay, so there was no X-ray. So let me eliminate this from the question. So this is the only picture we have: 60-year-old with smoking history, FEV1 by FVC less than 0.7, and post bronchodilator 18% increase in FEV1. So then the answer is very clear. With the ratio of less than 0.7, it is obstructive lung disorder, and 12% or higher makes it a reversible obstruction. So here, if it is 18%, certainly it is reversible obstruction, and we see reversible obstruction in asthma. So the answer was pretty clear. We would go ahead with asthma as the answer. If there was an X-ray and there were emphysematous changes, that means it becomes a case of asthma plus COPD, right? So I'm going by your words, no X-ray. In that case, the answer is asthma. Okay. So Kabir says there was an X-ray. Sai Arvind says there was no X-ray. So can you guys give me a little more details, or just DM me any closely resembling X-ray image from the internet, so that I can give a more refined answer to you in the PDF that we will be sharing? Okay, but anyway, the answer's approach is very simple. If X-ray was showing emphysematous changes, then the answer is asthma COPD overlap. If X-ray was not showing, or X-ray image was not there, then the PFT is clearly favoring asthma. Okay, so this is another question. I heard that it was an image-based question with two peaks visible in the pulse, and they were asking what is the location of pathology, right? So can anybody confirm me? How was the question framed? Was the image similar to this? Two peaks visible. So if there were two peaks visible in the pulse, it could be, okay, Prashant, that means there was an X-ray with emphysematous changes, right? Okay. So let me keep the X-ray with emphysematous changes then. And if there was an X-ray with emphysematous changes, then the answer changes to asthma COPD overlap. That's pretty simple. And many times what happens is the examiners use the smoking history as a bait to push you towards the diagnosis of COPD. But the question, I guess you guys are intelligent enough to identify the emphysematous changes. So if that is the case, our answer is going to be asthma COPD overlap. Okay, so I got one image, something similar to this from one of the students, and they're asking where is the pathology? Two systolic peaks were visible is what I heard. And if you hear two systolic peaks on pulse, if you feel two pulse within systole, it is called as pulsus bispheriens. Pulsus bispheriens. Bispheriens. And pulsus bispheriens is encountered in HOCM, AR, and AS with AR. And we had discussed this point even in the marathon. And in fact, emphasized that if you have to remember one from the pulse, I wanted you to remember the pulsus bispheriens. I had even highlighted it. So it is seen in AR, HOCM, and AS and AR. So if they're asking what is the location of the valve pathology, then of course it is aortic valve. Of course it is aortic valve. AR, so pulsus bispheriens is seen in aortic regurgitation, AR plus AS, and HOCM. So if they're pointing towards the site of pathology, of course I have to choose aortic valve, because AR as well as AR plus AS are known to cause. Okay, now let me move to the next question. A patient with loud S1 on cardiac auscultation asking you the condition. Was this the question there? Because I got one more stem from the student saying that there was a question on mid diastolic murmur, asking you what is the diagnosis. And there was also a question on The pulses bisvariance question was lengthy. So can you help me to construct that stem? Was there any other clues towards the pulses bisvariance, like any murmur mentioned, early diastolic, ejection systolic, crescendo, decrescendo, or a murmur having changes with respect to... Okay, I know there was a question on mid-diastolic murmur. Prashant, can you tell me how was it framed? Were they directly asking you mid-diastolic murmur is seen in which of the following conditions, or it was a clinical stem? And was there a question on loud S1? If there was a question on loud S1, we know that loud S1 is a classical finding of MS and TS. Whenever you hear loud S1 and you're thinking of valvular heart diseases, you're thinking of mitral stenosis and tricuspid stenosis and patients with short PR interval. These are the important conditions where you get loud S1. So if this question was there, MS will be our answer. Okay, so I also got this question from one of the students. There was an image of the heart with the coronary arteries with a labeling to the left anterior descending artery. So LAD was marked and they were asking if this blood vessel is occluded, which wall of the heart will suffer through myocardial infarction? Was this question there? Prashant, so they had given a auscultogram, means they had given a phonocardiogrammic picture. Okay, so you mean a loud S1 and a mid-diastolic murmur. Is that what you mean, Prashant? So in that case, again, the answer is simple, straightforward. It is mitral stenosis. A loud S1 with mid-diastolic murmur, classical mitral stenosis. Okay, so if they are marking LAD, we know that the LAD is the main blood vessel giving the blood supply to the anterior wall. So this was also a pretty straightforward question. We have discussed this umpteen number of times in the live as well as offline classes. The coronary circulation, which walls, which leads represent. And in fact, I told you multiple times that when it comes to ECG, the three most important topics for ECG is arrhythmias, AV blocks, and MI. So you should have done that. Okay, so a murmur on mid-diastolic murmur with loud S1. Oh, they had just asked you to name the artery. Fair. But then it's a pretty simple and easy anatomy question rather. Okay, so mid-diastolic murmur with loud S1. So of course we know it is a classical finding of mitral stenosis. Okay, so ABG, I know it's the recurring template from several years. Every exam there are questions on ABG. So far I've been able to collect one question from ABG, but I know there were 3 questions on ABG. So please share it with me. I will compile and share the answers to all of you. Okay, so if you can share me a picture with the artery that was labeled, I will share the answer to you. Okay, so this is the ABG question. A pH of 7.45, bicarbonate 20, PaCO2 of 28. So let me know if the numbers were different. If numbers were this as shown here, then let me go through the analysis. So as we see here, the bicarbonate normal value of bicarbonate is 22 to 26. So bicarbonate appears to be decreased. Normal value of carbon dioxide is 35 to 45. So carbon dioxide also appears to be decreased. pH appears to be in the normal range of 7.35 to 7.45. And as you know, if internal values of the ABG are disturbed, there is always an acid-base disorder. It is not normal, even if the pH appears normal. In fact, when we were doing the marathon, I had given you an approach or algorithm for the ABG as well. And I told you to just stick to this algorithm and you will get the ABG-based questions right. First thing you have to see is pH. If pH is abnormal, then it's a simple story. But even if it is normal, you have to look at bicarbonate and carbon dioxide. If they are abnormal, it's still an acid-base disorder. And if they are abnormal, you will look at the pH. Remember, if the bicarbonate and carbon dioxide are abnormal, but if pH appears to be normal, then it is a fully compensated acid-base disorder. It's a fully compensated acid-base disorder. That's why pH is kind of pushed back to the normal range. So from the question, whatever is the answer, it has to be compensated. All uncompensated, this, that are ruled out. And in fact, as I see, there was only one option with compensated. So if I was giving the exam, I would have directly jumped to that answer. Nonetheless, once it is fully compensated pH within 7.4 to 7.35 to 7.45, we will use 7.4 as a cutoff. If it is less than 7.4, we will count it as acidosis, and more than 7.4, we will count it as alkalosis. So in this question, it is more than 7.4. So whenever we have fully compensated, we will use 7.4 as a differentiator. Otherwise, less than 7.35 is acidosis, 7.45 is alkalosis. But if the pH appears to be compensated, then 7.4 is a cutoff. Anything more than 7.4 is alkalosis. So that means we are dealing with alkalosis here because pH is 7.45. And once we have established that this is alkalosis, we will follow the ROMS criteria: respiratory opposite, metabolic same side. So pH appears to be increased, but carbon dioxide appears to be decreased. So they are in the opposite direction. And when they are in the opposite direction, it becomes respiratory. And because pH is within the normalized range, we will consider it as fully compensated respiratory alkalosis. So the answer here should be compensated respiratory alkalosis. Okay, so they had Altaf, so they had labeled left marginal. Okay, fair. So in that case, it's not a medicine question, it's a pure anatomy question. Okay, so if there's a confusion about which artery they are asking, so if you can share me an image with a marking of which artery they had marked, then I will definitely tell you what is the answer. Okay, so there was another question on hypertension and hypokalemia with metabolic alkalosis. I got two versions of this question. One student said, sir, they were asking what is the diagnosis. And another student said, sir, they were asking the patient is already suspected of having Conn's syndrome as a diagnosis, and they are asking what is the underlying pathology. How was the question framed? So remember, if it is about hypertension, hypokalemia, and metabolic alkalosis, we are talking about hyperaldosteronism. That's one of the important cause. Aldosterone increases the sodium absorption. Aldosterone increases the sodium absorption. Okay, so can anybody help me to understand the framing of this question? Was it framed as asking you the diagnosis? Okay, so Teja, can you share the stem with me? Okay, so we'll come back to this question. Let me reframe it, because if little was also there, I need little more information. So this question, we will keep it. I will come back to it once we construct the stem completely. Okay, so there was a question on meningitis as well. A patient with headache and neck stiffness, CSF showed cell count I could not get. Some students said 300, some said 300 was protein. So can anybody confirm me? CT image was there, Agniman? CT abdomen image was there? Okay, Conn's syndrome was written in the stem and then asking what is the pathology. Is that the question, Adarsh? Okay, well, we know what is the direction question is taking into. So mostly we would have to either differentiate Liddle or Conn's or diagnose it. So I will reconstruct that question after having a one-on-one with one or two of you, and then we will come back again on that. Okay, now let us address this meningitis question as well. Was there any cell count mentioned? Okay, so what was the cell count? Agnimanni, can you share a closely resembling CT image with me on my Instagram so that I can construct that question as it appeared in the exam? Okay, so what I have got so far about the meningitis question is 90% lymphocytes, CSF glucose 40 and plasma glucose 100. Beyond that, I don't have any more information. What was the cell count mentioned and the protein? Anyway, CSF protein was probably increased. Now, looking at the lymphocyte predominant picture, we know it is unlikely to be pyogenic or bacterial meningitis. It's most likely viral, fungal, or tubercular. Now, generally, viral meningitis is not associated with low CSF glucose. So, normal CSF glucose is 60% of blood glucose. That means it should be, in this case, at least 60 milligrams per deciliter. Less than that means we will count it as low. So CSF glucose is low when compared to the plasma glucose. It should be 60% of plasma. It is certainly low. So low CSF glucose is mainly encountered in two conditions. Low CSF glucose is mainly encountered in two conditions. One is bacterial and the other one is tubercular. Rarely fungal meningitis, not routine. And until and unless they talk strongly about some immunocompromised state, we should not be jumping to fungal meningitis. So we have two differential diagnoses. Bacterial is already ruled out. So it is more logical to stick to tubercular meningitis. Dr. Agnimane, my Instagram handle is Dr. Santosh P. Okay, was there a question on the severity of mitral stenosis? Clinical markers of severity of mitral stenosis. One student said there was a question on severe mitral stenosis, but I haven't got anything more from him. So this question is again on me. I need to construct this term. But if you get anything related to the CSF picture, I mean, anything related to the severity of mitral stenosis, any clinical marker based question, please let me know. I will have to reconstruct that as well. There was a question on drug that decreases the milk production. Of course, you all know it is like the milk production is with the help of prolactin plays a very, very important role. Prolactin is under the inhibitory control of dopamine. So if you give dopamine agonist like bromocriptine, they will suppress the prolactin, and if prolactin is suppressed, milk production will be suppressed. Okay. Was there a question, especially an image-based question on amyotrophic lateral sclerosis with someone with tongue atrophy or maybe the atrophy of hand muscles? Atrophy of hand muscles or tongue muscles, and asking you the diagnosis with management. A student said that there was a question with an image of a tongue atrophy, and they had one option of amyotrophic lateral sclerosis with the management by drug riluzole. Cyanosis and angina, was that an adult patient or a pediatric patient? Because angina, cyanosis, I would also think of the congenital cyanotic heart diseases. So it could be more likely a pediatric question than adult. Okay, so I'm not very sure how that ALS question was there or whether it was truly about ALS. Just give me one clarification, whether in this question with a tongue atrophy and fasciculations, image of tongue atrophy or tongue atrophy mentioned and fasciculations, was there any loss of sensations? Was there any loss of sensations mentioned? If loss of sensations mentioned, then it is not a case of ALS. ALS is a pure motor neuron disease. There is no involvement of sensory functions, only motor weakness because of upper and lower motor neuron damage happens. If there was no loss of sensation mentioned, then it is highly suggestive that the story was about ALS. And if it was about ALS, then there was an option, ALS treat with riluzole. That would be the answer. Okay. Okay, so there was a question on mitral stenosis. So patient had cyanosis, central cyanosis, peripheral cyanosis. And okay, so what makes you think that the cyanosis was related to the mitral stenosis? What makes you think that the story was pointing towards mitral stenosis? What other findings were mentioned? Was the murmur mentioned, or loud S1 mentioned, or a murmur with presystolic accentuation mentioned, opening snap mentioned, or an echo finding, or ECG with P mitral mentioned? What makes you think, Priyansh, that the question was talking about mitral stenosis? I will note down that. So there was a question with cyanosis, angina, and you're considering likelihood of mitral stenosis. Let me reconstruct this question completely. Okay. It was about aortic stenosis. So what were the symptoms, Priyadarshini, that were mentioned? Angina, fair enough. We can expect in aortic stenosis, but difficult to angina, syncope, dyspnea. Okay, fair. So that's a classical case of aortic stenosis. What were they asking about that? Were they asking diagnosis or Were they asking the markers of severity, or were they asking the management? What were they asking? Well, so these symptoms, yes, they are classical triad of aortic stenosis. There is no doubt about it. If these three things come together, we will highly suspect aortic stenosis. But what were they asking? Management, diagnosis, investigation of choice, ECG findings, cause. Diagnosis. Okay, so if they were asking if these three symptoms were mentioned, were they mentioning about the murmur as well? If they were mentioning, then even better. If they are mentioning an ejection systolic, crescendo, decrescendo murmur, ejection click, classical story, well, then it is aortic stenosis. Okay. Okay, Priyadarshini Martha. So anyway, if the ASD symptoms were there, then it is standard aortic stenosis. So you got the answer right. No debate on that. Okay. So there were probably two questions, or I don't know if one question on acute mountain sickness. Someone going to high altitude, developing shortness of breath, and they were asking either what drug can be used to prevent it, the prophylactic management, or what is the best immediate management or the definitive management. And were there two separate questions, or it was one, I'm not very sure. But if there was a question on acute mountain sickness and they were asking prophylaxis, for prophylaxis, acetazolamide is the drug of choice, as we know. And immediate, most important treatment whenever someone develops acute mountain sickness or high altitude pulmonary or cerebral edema, the treatment is going to be immediate descent to a lower altitude. Immediate descent to a lower altitude. If there were two separate questions, then acetazolamide for prophylaxis and immediate descent for the treatment, right? Those should be our answers. So these are the questions that I could recall so far from the students' inputs. Now there are a few questions that are partially done. I am waiting for your inputs. So one question on the probable question on ALS, one probable question on aortic stenosis, then a question related to endocrinology, hypokalemia, hypertension, and metabolic alkalosis. Probably an image-based question, so I'm waiting for the image. So I will reconstruct these questions and share the fully refined PDF soon with you on the Instagram, Telegram, as well as the YouTube. Right, I will pass the baton to the next faculty, and they'll take over from now on.
Thank you, sir. Thank you for that crisp discussion. So I'll quickly discuss the radiology questions. So since radiology is an integrated subject, just give me a quick confirmation that everything I'm audible and I'm visible. Yeah, so I think we are good to go. So there were a total of 12 questions which came in radiology, and some of the questions have already been discussed by the previous faculties. So I'll not take much time because again, radiology is a short subject and it's already 10. I know you guys want to just finish up with the recall. So let me just quickly go through the question. So I'm sure that this question came regarding TOF. So the child with cyanosis are given, X-ray is given. This is a classical boot-shaped heart, right? And this answer here is TOF, tetralogy of Fallot. Where is happening to my... Okay, yeah, so the answer here is TOF. Now, next question. So this is the snapshot. So we covered this TOF in all our marathons, main videos, revision videos. TOF is a very, very important topic. Again, a barium swallow image was given and it shows a posterior outpouching at the pharyngoesophageal junction. So I guess this was the image that was given. I'm not sure regarding the image. Just give me a quick confirmation. Was an image given? I'm sure the question asked that this outpouching, that is Zenker's diverticulum, is between which two muscles, right? Between which two muscles? The answer here is thyropharyngeus and cricopharyngeus, right? It's an anatomy question mainly, but I'll still cover it because we also discussed this in radiology. So many images of hypertension, bleeding. So Vishnu, this was a medicine question. What are you saying? Which images of hypertensive bleeding? Was it a brain image? Where was the image? Okay, yeah. So the answer is A, thyropharynges and cricopharynges. I'm not able to write with my pencil, but yes, the answer here is A. Again, this was covered in our class. Now, two questions from neonatal respiratory distress came, and Dr. Divya has already covered them. So this was a preterm neonate with respiratory distress. Remember, preterm is more in favor of hyaline membrane disease. Again, chest X-ray shows you typical whiteout lung that we see in hyaline membrane disease. But just as a quick reminder, whenever neonatal distress syndrome is asked, preterm is hyaline membrane disease, term is TTN and meconium aspiration, right? So that is how I remembered. So preterm दे रखा है, ज्यादा सोचना भी नहीं है. एक्सरे अगर white out lung दे रखा है आपको तो head membrane disease ही आंसर. So this was the snapshot. We covered this in test and discussion. Now it is a little. Usually these questions are asked in NEET PG and not so much in FMG regarding the respiratory distress in neonates. And that is why I really say that you should, even if you're preparing for FMG, you have to do NEET PG questions as well, right? The transient tachypnea of newborn that also came in today's paper, that was asked November INI-CT. Okay, that is a very recent question. Again, INI-CT questions are also repeated in FMG. So, okay, so 10 to 15 images of CT sections were given. Bleeding in brain, what is management option was asked. Manitol. Okay, Vishnu, I'll add that. I think Dr. Sandeep will cover the head trauma part. But again, that is again an INI-CT question. Recent INI-CT question. Vishnu, CT, I think extradural hemorrhage was given in the INI-CT, and there was a midline shift, and the options were asked. What type of surgery will you do? Craniotomy, craniectomy. Again, that was in INI-CT. So again, INI-CT questions are very, very important for FMG exam. The standard of FMG exam is now very rare. Ophtha questions, few of the ophtha questions were tough. One of the questions I'll discuss in radiology regarding general radiology physics, that was tough. So this was regarding the TTN question that I was saying, a full term newborn via LSCS. So full term में respiratory distress at birth है, आपको क्या सोचना है? Transient tachypnea of newborn and meconium aspiration syndrome. इसमें क्या दे रखा है हमें? Interpleural interlobar membrane में fluid दे रखा है, fluid in the interlobar membrane. So our answer will be transient tachypnea of newborn. ठीक है, चलो, this is also something that we covered in our test and discussion. Now, I guess a question on PCOS came. Dr. Vij has discussed this already. Multiple peripherally arranged follicles with the echogenic stroma, giving a string of pearls appearance. So I think string of pearls sign was asked, not the PCOS mainly. Correct me if I'm wrong. So the answer here is PCOS or string of pearls sign. Now, next question. It has been covered already in ENT now by Dr. Sanchit. So, a 5-year-old child presented to the emergency with difficulty in swallowing and drooling of saliva. So, whenever you have a foreign body stuck, either it's in the trachea or esophagus. How do we remember this? So, esophagus, N face. आपको N face दिखता है सामने से, अगर कोई rounded object दिख रहा है, तो it is in the esophagus, right? Why is it round anteriorly? Because if it was in the trachea, it had to be passed anteroposteriorly. हमारी vocal cords are arranged anteroposteriorly, so it has to go like a slit. And anteroposterior में अगर slit दिख रहा है, it's in trachea. Slit में T आता है, that's how I remember. Slit में T आता है तो trachea है. Esophagus में face में दिखता है आपको, as in सामने से face दिखता है तो esophagus. Okay, PCOS diagnosis was asked. ठीक है, string of pearls in the case was given. ठीक है, I'll edit it. Thank you, Vishnu. Thank you, Prabhakar. I'll edit that. Again, this we covered it in our marathon revision series as well. Again, this is the same exact repeat of last year INI-CT. I think last year FMG exam. The July FMG exam, uretrocele was asked back then. Now they have asked what is the name of the sign. So adder head appearance. Again, you've seen uretrocele. This is the exact repeat of last year's July FMG. 2 MRI images like TB or something. Okay, Vishnu, tell me what were the 2 MRI images? MRI spine. Okay. MRI spine was there one. What was the another other image? MRI spine and another TB. टीबी की स्पाइन इमेज थी, क्वाड स्पाइन था कि सीएनएस मेनिंजाइटिस की इमेज थी? कोबरा हेड था, ओके। एडर हेड नहीं था, कोबरा हेड एन ऑप्शन था, ठीक है, आई करेक्टेड। थैंक यू प्रभाकर। कैन यू ऑल्सो टेल मी विच एमआरआई इमेजेस वर आस्क्ड? एमआरआई ब्रेन हर्निएटेड, ओके। सो एमआरआई ब्रेन हर्निएशन का कोई कियारी मैल्फॉर्मेशन था कि रेव्ड आईसीपी की इमेज थी? व्हाट वाज द क्वेश्चन एग्जैक्ट? Okay, I'll write it down. Two MRI images, MRI spine and MRI brain. I'll get back to you. Don't worry. We'll edit it in the PDF that I'll send. Now, this was a question. If correct me if I'm not wrong. This was a question which was asked. Mechanism of X-ray production, photoelectric effect, Compton effect, pair production. Was this the question that was asked? Prabhakar, Vishnu, can you tell me? Priyadarshi, was a question asked on mechanism of X-ray production, like photoelectric effect, Compton effect, pair production? Because if this was asked, this is a tough question at your level. This is a tough question for an FMG. In fact, even at NEET PG 9ICT level, because usually this is not taught at MBBS level. Okay, Vishnu is saying yes, that there was a question on mechanism of X-ray production. So we did cover it in our main videos, but again, I'd say that this is a tough question at your level. So photoelectric effect is the mechanism of X-ray production. Using photoelectric, because of photoelectric effect, you get characteristic radiations which are important for X-ray production. Compton effect से हम background radiation मिलती है हमें, background radiations मिलती है. Characteristic radiations are mainly produced by photoelectric effect. Okay, linear something in the case. Linear accelerator दे रखा था. What is the mechanism of X-ray production in linear accelerators? Linac, linear accelerator दे रखा था, I think. एक mechanism of X-ray production in linear accelerator. So the answer still will be photoelectric effect. Okay, one more question on radiotherapy also. What was another question on radiotherapy? FDG PET पे दिया है question. FDG PET emits which of the following nuclear particles? Answer is positron. Positron emission tomography होता है PET का full form. Kabir is saying rays hitting against the defect in body. One more question on radiotherapy. Rays hitting against the defect in body. चलो देखते हैं. टेल मी व्हाट वाज द क्वेश्चन ऑन रेडियोथेरेपी. ये तो पेट का तो आसान था, ये हर बार पूछते हैं एफएमजी एग्जाम में. कभी कंपाउंड पूछते हैं, 18 फ्लोरीन यूज किया है, कभी पूछते हैं पार्टिकल कौन सा एमिट होता है पेट में. नो नो वन लीनियर एक्सरे रेडियोथेरेपी एफडीजी पेट सॉफ्ट टिश्यू, अगेन सॉफ्ट टिश्यू सर. कैन यू रिकॉल द एग्जैक्ट क्वेश्चन फॉर रेडियोथेरेपी? रेज हिटिंग अगेंस्ट सॉफ्ट टिश्यू. आंसर वॉज एफडीजी. चलो इसका आंसर एफडीजी था, ठीक है, इसका चेंज कर देंगे. 18 FGG was used. चलो नेक्स्ट क्वेश्चन पे आते हैं. Identify the type of twinning. Again, this is something that is covered in OBGYN by Vitzer also. So you can see a lambda sign, a thick intertwin membrane, which tells you that there are two placentae. So dichorionic and diamniotic is the answer. So what kind of effect radiation has hitting soft tissues? And what were the options? Devansh, what were the options of this? What kind of effect radiation hitting soft tissue? Okay, while we wait, let me cover the remaining questions. Again, just give me a confirmation if this was asked. Ring of beads, appearance of renal artery, a young female hypertensive. ठीक है, लैम्डा क्लियर था, ठीक है, वो तो आंसर हो गया. टेल मी, वाज दिस एन इमेज आस्क्ड? यंग hypertensive female and DSA or MRI given, string of beads appearance. So if string of beads appearance is was there, then the answer is fibromuscular dysplasia, FMD. Okay, FMD, fibromuscular dysplasia. So if the main renal artery shows bleeding, then you have FMD as the answer. But if your intrarenal arteries show aneurysm, intrarenally aneurysm दिख रहे हैं, तब आपका आंसर पॉलीआर्ट्राइटिस नोडोसा था. सो अगर देखो, जैसे इस इमेज में हम देख रहे हैं कि जो रीनल आर्टरी है उसमें बीडिंग है, देन द आंसर इज एफएमडी. अगर इंट्रारीनल aneurysms हैं तो पॉलीआर्ट्राइटिस नोडोसा. PAN usually does not present as hypertension mainly. FMD mainly presents as hypertension. FMD was an option. ठीक है, चलो ठीक है. सो आई थिंक फ्यू ऑफ द क्वेश्चंस, MRI spine, MRI brain I have to take out, and radiotherapy का one more question was there, you guys are saying that we have to cover in the recall. ठीक है, तो सर थैंक यू सो मच, थैंक यू सो मच. Let's I'll hand over to the next speaker, Dr. Era. Or Anusha, Anusha, are you there, or Dr. Era is there? I'm done with my recall.
Hi guys, I know late हो गया है, but we'll quickly look into psychiatry. So first of all, कैसा रहा and how was psychiatry for all of you all? I think pretty straightforward. हमने almost सब कुछ cover किया ही हुआ है. Correct? In fact, almost नहीं, सब कुछ ही cover किया हुआ है. आप लोगों को full एकदम जोश से आना चाहिए था. Let's hear psychiatry कैसा रहा? So as always, I think कुछ चीजें बदलती नहीं है. Substance is always a famous and a favorite of examiners. जरूर पूछते हैं. And sexual disorders is another thing जिसमें से ये काफी टाइम से काफी repetitive questions आ रहे हैं. I'm glad you found it easy. Psychopharmacology मैं हमेशा कहती हूँ, अगर कुछ टॉपिक जरूर पढ़ना है तो psychopharmac पूरा अच्छे से like the back of your hand you should know. And MSc, the conventional bit. So I'll go through the questions that I have. Of course, we will keep on bettering our recall as time goes. आप लोग at the end of the day you're very tired as well, so we want to get it out there. Feel free to chip in and tell me कौन सा सवाल है, नहीं है, कौन सा सवाल में क्या और options थे. All right, so we'll start with the first one. A patient with suspected morphine overdose, opioid, is brought to emergency department. Which of the following clinical findings is most characteristic? So there was tachypnea, bradypnea, dilated pupils and hypertension. क्या मार्क किया आप लोगों ने? पहले आप बताओ फिर मैं बताऊंगी. क्या मार्क किया आप लोगों ने? Perfect. Bradypnea is the right answer. So the breathing slows down extremely. अगर pupils का opposite लिखा होता तो then that could have been another option as well. अगर bradypnea की जगह pupils से related dilated नहीं constricted रहता तो that would have been another answer. Great. I think this everybody must have gotten it. Bradypnea. Absolutely. Absolutely right, guys. Good job. Next. A person is getting sexual gratification by wearing the clothes of the opposite gender. था ये question? Was this question there? And if yes, then please help me fill in क्या क्या options थे. Exhibitionism था, eonism था, कि fetishism लिखा था. What were the wordings and और क्या था? Pupil was not the same. Well, bradypnea was the answer there. I was just saying कि अगर कुछ और लिखा रहता, in that context I was saying. क्या क्या options थे guys ये sexual disorder वाले question में, paraphilias में? Eonism option था, और क्या क्या options थे? Eonism था, ठीक है, और क्या था? फेटिशिज्म था, अच्छा. भी अलग अलग था, फेटिशिज्म अलग अलग था. ओके, और यूनिज्म था गाइस, ठीक है. एग्जिबिशनिज्म भी था, आई एम प्रीटी श्योर. अ लॉट ऑफ स्टूडेंट्स हैव टोल्ड मी दैट. और क्या था ऑप्शंस? यूनिज्म इज द राइट आंसर. और ऑप्शंस थे क्या? If you can help me with this recall, it will be really nice. I want to finish the options off. और क्या ऑप्शंस थे? और कौन से पैराफीलियाज मेंशन किए हुए थे? स्कोटोफीलिया या फिर कुछ और लिखा हुआ था? कोई और फीलियाज लिखे हुए थे? दैट्स ऑल, 2 ही ऑप्शन थे. नॉट पॉसिबल ना. ठीक है, यूनिज्म इज द राइट आंसर. ऑलराइट. लास्ट वाज समथिंग बहुत फीकल. ठीक है, कॉप्रोफिलिया वगैरह लिखा रहा होगा. इफ यू आर सेइंग देन मे बी कॉप्रोफिलिया वाज वन ऑफ द आंसर्स. ठीक है. सो ग्रेट, आई थिंक मोस्ट ऑफ यू गॉट द यूनिज्म राइट. यूनिज्म सही किया है सबने मार्क. फेटिशिज्म वाज गिवन. ठीक है. ट्रांसवेस्टिज्म, ट्रांसवेस्टिक फेटिशिज्म, यूनिज्म, ये अगर वर्ड लिखा था दैट इज द राइट आंसर. यूनिज्म किया है मार्क सबने. यूरालजी, अच्छा यूरोले. ठीक है. ऑल राइट. सो यूनिज्म इज द राइट आंसर गाइज. ऑल राइट. नेक्स्ट क्वेश्चन. मैंने काफी बारी साइकोफार्माकोलॉजी पढ़ाते समय एनैक्ट आउट किया हुआ है मेरी वीडियोस में. ये क्वेश्चन था, रैबिट लाइक perioral chewing movements were there in a patient who has side effect of long term therapy. ये word notice करो, long term therapy. Fetishism अलग option था. Okay. Transvestism, I was searching for unism is the right answer guys. Okay. So थोड़ा सा डाउट है उस क्वेश्चन में ना सबको, तभी आंसर्स क्या ऑप्शंस थे देखो. इट्स नॉट ट्रांसवेस्टिज्म, ओनली फेटिशिज्म वाज गिवन. हाँ, तो ट्रांसवेस्टिक फेटिशिज्म एंड ट्रांसवेस्टिज्म अलग होता है. ट्रांसवेस्टिज्म इज जस्ट किसी का कपड़ा पहनना. ठीक है. एंड ट्रांसवेस्टिक फेटिशिज्म इज द सेक्सुअल प्लेजर. ईओनिज्म मार्क किया है आप लोगों ने, मैक्सिमम लोगों ने. अच्छा, फोटो था रैबिट का. कूल. सो रैबिट का फोटो था. इंटरेस्टिंग आईबीक्यू, उन्होंने रैबिट इस्तेमाल किया है. सो रैबिट कैसे करता है मूव? That makes this perioral movement, right? A very cute movement when it eats. So when rabbit or like perioral, perioral means around the mouth movements are seen as a side effect of long-term therapy. ये word important है. Which are most commonly used by which class of antipsychotic drugs? So atypical antipsychotic, typical antipsychotics, benzodiazepines and antidepressant. तो obviously guys जब लिखा ही हुआ है which class of antipsychotic drugs, last 2 option तो हम पहले ही cancel कर देंगे. So the correct answer is typical antipsychotics because this is tardive dyskinesia. ठीक है. रिस्पेरिडोन भी था ऑप्शन में. ओके ओके, रिस्पेरिडोन भी था अगर ऑप्शन में, फिर भी द बेस्ट आंसर इज टिपिकल एंटीसाइकोटिक्स और हैलोपेरिडोल. एनी फर्स्ट जनरेशन एंटीसाइकोटिक इज द करेक्ट आंसर. किया है सबने? टिपिकल किया है? मार्क किया है टिपिकल सबने? रिस्पेरिडोन. ठीक है. नहीं, आंसर इज टिपिकल और फर्स्ट जनरेशन एंटीसाइकोटिक. ओके गाइस, चलो. आई थिंक मोस्ट ऑफ यू ऑल गॉट इट. जस्ट ड्रग्स नेम थे. तो हैलोपेरिडोल फर्स्ट जनरेशन एंटीसाइकोटिक. अगला, ये क्वेश्चन मुझे थोड़ा सा इनकम्प्लीट सा मिला है, बताओ प्लीज. अ पेशेंट विद स्किज़ोफ्रेनिया रिपोर्ट्स दैट हिज नेबर्स आर कॉलिंग हिम एंड कंट्रोलिंग हिज एक्शंस. सवाल था पहले हाँ या ना. वाज दिस क्वेश्चन देयर? And if yes, were the options delusion, illusion, hallucination, pseudo hallucination? टिपिकल एटिपिकल नहीं दिया था, सिर्फ ड्रग्स का नाम दिया था. हैलोपेरिडोल अगर नाम दिया था तो आपको पता है कि वो टिपिकल एंटीसाइकोटिक है. हेंस दैट इज द राइट आंसर. हो सकता है टिपिकल एटिपिकल नहीं लिखा होगा. पॉसिबल. ये क्वेश्चन था क्या स्किज़ोफ्रेनिया में? हैलोपेरिडोल आंसर नहीं था. क्लोरप्रोमिजिन अगर ऑप्शन था तो दैट इज द राइट ऑप्शन. क्लोजअप पिन नहीं आंसर, क्लोरप्रोमिजिन अगर था. One question was on movement midline is because of what drugs? You wrote risperidone. Guys, first generation antipsychotic select करना है उसमें. क्या ऑप्शंस थे वो रिकॉल में? मुझको कुछ लोग ने हैलोपेरिडोल बोला है, क्लियर कट. मैक्सिमम लोगों ने कहा है. ओके. सो डिल्यूजन, इल्यूजन, हैलुसिनेशन ये सारे गिवन थे. क्या मार्क किया आप लोगों ने आंसर? ये क्वेश्चन था. ओके. Patient feels that he can hear voices calling him and that somebody is controlling him. After taking that drug, rabbit-like eating movement. We've covered that. Yes, photo थी. लोग कह रहे photo थी. Option में schizophrenia of more than 28 days था. Guys, अच्छा, duration of schizophrenia पे भी एक question था. तो 28 days लिखा हुआ था ऑप्शन. Told that nobody can break his belief. अच्छा. Guys, delusion, hallucination अलग अलग लिखा हुआ था. See, ये क्वेश्चन इनकम्प्लीट है मेरे हिसाब से, बिकॉज ये क्वेश्चन सही से नहीं बना हुआ है. द क्वेश्चन इज वेरी कंट्रोलिंग एक्शन एंड नोबडी कैन. अच्छा, सो ये नहीं था. आप कह रहे हैं कंट्रोलिंग एक्शन, हिज बिलीफ दैट ही इज बीइंग कंट्रोल्ड बाय समवन एंड कैन नॉट ब्रेक हिज बिलीफ, देन इट इज डिल्यूजन सर्टनली. क्या वॉइसेस के बारे में कोई कमेंट था? ही कैन हियर था. गाइस आपके ऑप्शन मुझे कंफ्यूज कर रहे हैं. दैट्स अच्छा, दैट्स अ डिफरेंट क्वेश्चन. सो इट टर्न्स आउट कि ऑडिटरी हैल्यूसिनेशंस पे सेपरेट क्वेश्चन था. साइकाट्री में कितने क्वेश्चन थे? मेरे हिसाब से इट वाज एनी वर्बल ट्रीटमेंट कांट हील द पेशेंट, मेनली डिल्यूजन वाज गिवन. अगर डिल्यूजनल वाला क्वेश्चन था जिसमें नेबर्स के बारे में, कॉलिंग हिम वगैरह नहीं लिखा था, सिर्फ मेनली कंट्रोलिंग एक्शन के बारे में, नोबडी कैन ब्रेक हिज बिलीफ लिखा था, देन क्लियरली डिल्यूजन है. Nobody can break his belief is a very good way of understanding that false, firm, fixed belief in the face of irrefutable truth. अच्छा, ठीक है, वो अलग क्वेश्चन है, ये अलग क्वेश्चन था. ओके, ये स्किज़ोफ्रेनिया के ड्यूरेशन पे क्या क्वेश्चन था गाइस? हेल्प मी. स्किज़ोफ्रेनिया के ड्यूरेशन पे क्या क्वेश्चन था? कोई कह रहा है 21 month वाला लिखा था, आईसीडी लिखा हुआ था, डीएसएम लिखा हुआ था, स्किज़ोफ्रेनिक फॉर्म ऑप्शन था क्या? स्ट्रॉन्ग बिलीफ इज अनदर क्वेश्चन. और एक क्वेश्चन था स्किज़ोफ्रेनिया व्हिच विल डिफरेंशिएट, आंसर वाज लाइक 1 month. तो 1 month सिम्टम्स मतलब ब्रीफ साइकोटिक डिसऑर्डर, ऐसे ऑप्शंस थे. ब्रीफ साइकोटिक, स्किज़ोफ्रेनिक फॉर्म, ऐसे लिखा था. सो उसमें 1 month सिम्टम्स लिखे हुए थे. गाइज हेल्प मी आउट विद दिस क्वेश्चन प्रॉपरली. एक बारी सोच के मुझे फिर से बताना. मैं अगले क्वेश्चन पे बढ़ रही हूँ. प्लीज राइट द स्किज़ोफ्रेनिया का सेकंड क्वेश्चन. 2 क्वेश्चन थे स्किज़ोफ्रेनिया पे. इट अपीयर्स सम सिम्टम्स वर गिवन. गाइज हेल्प मी प्रॉपरली फॉर्मुलेट, थोड़ा सा ना रिकॉल करो अच्छे से. ओके, ये क्वेश्चन सर्टनली था ना. अ पेशेंट विद अल्कोहल डिपेंडेंस टेक्स अल्कोहल आफ्टर टेकिंग अ पर्टिकुलर मेडिसिन एंड देन ही डेवलप्स पेट में दर्द, ब्लोटिंग, डिस्टेंशन shortly after the prescription of a drug. What drug was prescribed? The options were disulfiram, fomepizole. ये मुझे बोला है किसी ने, ये 2 options पक्का थे. ये ऑप्शन ये था पक्का. क्या मार्क किया आप लोगों ने? डी, disulfiram. Correct. Disulfiram is the right answer. ये पक्का था. अच्छा, now thank you for this. You're telling me that there was a question that which of the following is important to distinguish between depression and schizophrenia option था more than 1 month. तो आप कह रहे हो कि डिप्रेशन वर्सेस स्किज़ोफ्रेनिया एंड ऑप्शंस में ड्यूरेशन लिखा हुआ था. ड्यूरेशन था, नॉट मूड और हैल्यूसिनेशंस और अदर सिम्टम्स. ऐसा क्वेश्चन था गाइज, प्लीज कंफर्म. ये क्वेश्चन था विच वन इज मोर एक्यूरेट अबाउट स्किज़ोफ्रेनिया, ऑप्शन मोर देन 1 month, female is feeling depressed every time, not able to go to office and feeling heaviness in limbs. Options please. कितने? मेरे हिसाब से 1 2 3 4 5 थे. तुम्हारे हिसाब से इट सीम्स यू गाइज आर टेलिंग मी 6+. दिस क्वेश्चन डॉक्टर साहब जो आप हमें बता रहे हैं, मैम, 1 question that female is feeling depressed every time, not able to go to office, feeling heaviness, about depression but some delusion and all symptom. Auditory hallucination था ऑप्शंस में. लेडी हैज हेमीप्लीजिया. ये 2 मिक्स हो रहे हैं क्वेश्चन मुझे लग रहा है. 6 to 7 questions थे. So guys, can you maybe even later, we will keep coming back and bettering our recall of course. Duration was one of the option. I think कुछ mix up हो रहा है. कोई कह रहा है schizophrenia का duration था. How can you tell it's schizophrenia not delusion? Delusion is a part of schizophrenia. अलग नहीं होगा ये. क्या क्वेश्चन ये था that delusional disorder versus schizophrenia and ऑप्शन में ड्यूरेशन लिखी हुई थी? Was this the question? Ladies felt rejected, gets active when her mother comes to meet her. Wow, you're telling me one more question. Major depression पे भी था, atypical symptoms भी था. तो अब 8+ बता रहे हैं आप मुझे. Is that right? Normally depression, but feel good when her mother came. Ladies is feeling rejected, gets activated. So, अच्छा, तो atypical depression पे एक question था कि basically she's having mood reactivity. Okay, thank you for telling me that. So, mood reactivity was in the option, it appears, and it was shown by showing that the mother के आने पे उसका better हो जाता है. Delusional disorder versus schizophrenia. Option क्या थे? Great. Delusional disorder versus schizophrenia. So we've discovered 2 more. Lady with major depression, atypical depression था पक्का. That's right. अगर ये question था कि a lady is feeling rejected, so interpersonal rejection sensitivity, mood reactivity, and she gets better. IPR rejection sensitivity plus mood reactivity. Yes, this is atypical depression. Correct. Absolutely. One was girl gets bullied in social anxiety and something. Major depression in option and case, bully in her school year previously. There was depression, there was mood swings, and schizophrenia का A था auditory hallucination में, second person perspective, B running auditory hallucination, third perspective, something एक question था. Atypical depression sort हो गया, was we are on page. Atypical, yes, we have all agreed. Person thinks neighbors commenting about him. ठीक है. He hears someone ordering him from radio. Auditory hallucination from third person. हाँ, तो ये question नहीं था क्या? ये क्या different question था? Dr. Asif, last question. Lady is feeling rejected is atypical depression for sure. ये bullying वाला question complete नहीं हुआ है मेरे को. इसके ऑप्शंस नहीं मिले मेरे को. ये क्वेश्चन क्लैरिफाई कर लेते हैं. ये था क्या? डिल्यूजन स्किज़ोफ्रेनिया ऑफ मोर देन मंथ्स. ये 3 क्वेश्चन थे क्या? स्किज़ोफ्रेनिया ड्यूरेशन, स्किज़ोफ्रेनिया वर्सेस डिल्यूजनल डिसऑर्डर एंड स्किज़ोफ्रेनिया जिसमें ऑडिटरी हैलुसिनेशन सेकंड पर्सन पर्सपेक्टिव में रनिंग ऑडिटरी, ये वाला था. 3 क्वेश्चन थे क्या स्किज़ोफ्रेनिया पे? It was there. Okay, guys, of course I'll not take up so much more of your time. मैं next teacher को hand over करूंगी. Please leave it in the comments. I'm here, I'm going to answer them in the comments for some time, and definitely thank you for making this helpful, and we will come back with a better recall in some time. अगर और questions मिलते रहेंगे, एक बारी options ठीक हो जाएंगे, so I'll better the recall format very shortly. Handing over to the next teacher. Thank you.
Hi, ma'am. Thank you, Dr. Ira, ma'am. All right,
Thank you.
guys. So, of course, it's 10:30. थक गए हो बहुत ज़्यादा, right? Exam भी खत्म हो गया है. Now, I mean, this is just the very last step. जल्दी से खत्म करेंगे. So, microbiology, I feel was, I mean, it was straightforward. Not much controversy has come my way. Not much has, been confusing. But at all, if you feel at any point that probably this question was not asked or any questions I have missed, then please do let me know. Based on your recall, the very first impression, we have come up with about 17 questions in microbiology. That is as expected. That is not too many and not too less also, right? Okay, micro was weird. Okay, Dr. Kabir, I think we can really help you with this recall. So what was the tone? What was the mood of the recall? What was the important questions? Of course, the very common ones, which we keep talking about all the time: special bacteria, sexually transmitted diseases, fungal stains, especially morphology, food poisoning, and at least one question has to come from farmer. This has been a common theme, right? And of course, I felt many questions, especially special bacteria, leptospirosis, farmer-based questions, thorn prick, everything is a direct repeat of the previous, I think, FMG. 2025 direct repeats. So of course the theory, I mean the theme remains the same exact topics we keep talking about all the time, and most of them we've also discussed in the marathon. So if you had attended it and you had read it even once, I am sure that you were able to do it, right? Of course, आ जाते हैं पहले क्वेश्चन पे. बिल्कुल टाइम ज्यादा नहीं लेंगे because they were स्ट्रेट फॉरवर्ड क्वेश्चंस. ट्रक ड्राइवर आते ही आपके दिमाग में सिफिलिस आएगा. दे भी दिया उन्होंने सिंगल पेनलेस अल्सर ऑन द penis and around the corners of the mouth. ही around the corners of the mouth दिया गया था to confuse you with herpes labialis, but you know herpes is always going to be painful. दो questions थे STD से, right? Let me know if the options you think are correct. It was primary syphilis, herpes labialis, chancroid, and donovanosis. And the second question related to STDs was, okay, yeah, this one, right? Patient with painful genital ulcer with tender lymphadenopathy. So ये हमने भी मैराथन में भी कवर किया है that first of all genital ulcer you have to see whether it is painless or painful, and that is how we divide it, right? So if we have painless ulcers, then it has to be syphilis or donovanosis, where we had read dono nahi means not painful ulcers and not even tender lymphadenopathy. Similarly, syphilis is also a prototype of that. अगर उनको हमें even though they have confused with lesions around the mouth, they had to tell that they were painful in order for it to be herpes labialis. तो वो तो सीधे सीधे आउट हो जाता है हमारा. And single painless ulcer, right? So of course what disease are they talking about? Primary syphilis. In fact marathon में जब हमने डिस्कस किया था, we had the exact same options. The way the question was presented was a little bit tweaked, but we had the exact same options और exactly वही question आ गया. So congratulations to those जिन्होंने पढ़ लिया था. But anyways, I don't think it was a very difficult question. I think most of you must have gotten it right. Yes, micro easy था, correct, right? अच्छा मुझको एक बात बताओ. Okay, food poisoning can open and causing infection. What is the mode of infection? Okay, fine. So I will add that question, can opening wala. So you are asking about botulism. So yeah, that is my question. So botulism was the toxin. Mechanism of action of toxin asked, or was the mechanism of action of transmission asked, right? So please let me know that if you're talking about transmission or it was the mechanism of action of toxin. So this question we will add. And of course, one question on pic showing long worm with tapered ends. So क्या trichuris का coconut cake rectum, was it there? Long worm with tapered ends like the thin ends. Okay, chalo, ठीक है. We will add that question also. Two different mechanisms. Yes, ma'am. Yes, ma'am. To what? Yes, ma'am. To mechanism of action of toxin or type of transmission. You are saying, ठीक है, type of transmission. So I will definitely add that question. Obviously, type of transmission of food poisoning is vertical vehicle transmission. Vertical कैसे हो सकता है? Vertical transmission is mother to child, parent to progeny. So vertical should not have been there. Exocytosis inhibitions. Okay, this is completely new. Okay, so please let us know, and that is how we are going to improve whether the mechanism of action of toxin or mechanism of transmission of toxin has been asked. Agar mechanism of transmission hai, to obviously can opening only they have said. So it could be improper storage of food or transport of food, right? Improper storage and transport of the canned food items could be a thing. वापस आ जाते हैं. Okay, yes, something binding of vesicles to wall. What, Dr. Vishnu? Vector toxin. Okay, vehicle borne. Yeah, so it is not vector borne toxin. Okay, right, fine, ठीक है. So I will get back to you with this. Please, you can DM me also on my social media in case you do recall the question properly, and I'm going to add it to it. वापस आ जाते हैं. हमारे ट्रक ड्राइवर के पास सिंगल पेनलेस अल्सर है, ठीक है, अराउंड द कॉर्नर्स ऑफ माउथ. हर्पीस लेबियालिस से कंफ्यूज करना चाह रहे थे. सिंगल वर्ड सुनते ही यू आर टॉकिंग अबाउट प्राइमरी सिफिलिस, ठीक है. शैंक्रोइड डोनोवनोसिस का कोई मतलब नहीं है. नेक्स्ट में HIV पॉजिटिव पेशेंट प्रेजेंट्स विद कर्डी वाइट विजाइनल डिस्चार्ज. बात ही खत्म हो जाती है. माइक्रोस्कोपी भी दे दी. नैरो वेस्ड बडिंग ईज सेल्स विद सूडो हाइफे. विच ऑर्गेनिज्म? कोई दिक्कत ही नहीं है. मैराथन में भी बात करी. सो मेनी टाइम्स वी हैव टॉक्ड अबाउट कैंडिडा एल्बिकेंस. द मोमेंट दिस इज सूडो हाइफे, they're talking about some candida species, most commonly candida albicans they're talking about. कोई डाउट ही नहीं है. नैरो बेस बडिंग के साथ हिस्टोप्लाज्मा कैप्सुलेटम से आप कंफ्यूज कर सकते हो, बट कर्डी वाइट विजाइनल डिस्चार्ज, एंड ऑफ स्टोरी, राइट? Organism shown in the image is a bacteriophage. एक bacteriophage का image दिया था. What process does it show? Of course हमने मैराथन में भी डिस्कस किया था that Bacteriophage has the pick and drop service with the transduction, right? It transduction करता है इधर से उठा के उधर. Simple, not a problem. I don't think anybody of you must have had a problem with this. Conjugation में क्या होगा? Sex tube बनेगी, sex pili. Transformation क्या है? Passive uptake of genetic material, right? Translocation is with the genes within the genome. ठीक है. Immunocompromised patient presents with unilateral painful black necrotic scar on the face. क्या याद आना चाहिए इससे? ब्लैक नेक्रोटिक स्कार ऑन द फेस, पेनफुल, राइनो ओरबाइटो सेरेब्रो म्यूकर माइकोसिस. क्या याद आना चाहिए? राइनो सेरेब्रो और बाइटल म्यूकर माइकोसिस. द मोमेंट वी थिंक म्यूकर माइकोसिस, हमने डिस्कस किया था मैराथन में. ट्रीटमेंट ऑफ चॉइस क्या होगी? लाइपोसोमल एम्फोबी एंड सर्जिकल डिब्राइडमेंट. तो क्या एंटीफंगल अलोन? नहीं, सर्जरी करनी पड़ेगी. डिब्राइडमेंट हैज टू बी डन. एंटीबैक्टीरियल का तो कोई मतलब ही नहीं है. एंटीफंगल्स विद सर्जिकल रिसेक्शन, दैट इज द करेक्ट ऑप्शन हियर. ठीक है, इसमें आपको म्यूकर माइकोसिस ये डिटेक्ट करना था. ओके, इफ यू थॉट ऑफ सम पेनफुल एस्चार और स्पेशल बैक्टीरिया, देन यू वुड हैव गॉन रॉन्ग देयर. ठीक है, इसलिए ये थोड़ा सा, आई थिंक दिस वाज अ मॉडरेट डिफिकल्टी लेवल क्वेश्चन, because from this much information you had to guess mucormycosis. Was more information provided to you in the question? Please let me know. ठीक है, अगर इससे ज्यादा इंफॉर्मेशन प्रोवाइडेड थी, इट वाज नॉट सिंपली यूनिलैटरल पेनफुल ब्लैक नेक्रोटिक स्कार. सो द नेक्रोटिक स्कार इज योर वर्ड हियर, राइट? फॉरेनर प्रेजेंट्स विद राइस वाटर स्टूल, सुनते ही बात खत्म. कॉलरा, उसमें भी इतना ही इजी क्वेश्चन पूछा, डायरेक्टली दे आस्क्ड द टॉक्सिन. अब आपको फॉरेनर से ट्रैवल दिमाग में आता है, सो ट्रैवलर से यू यूजुअली थिंक ऑफ इकोलाई टॉक्सिन. ठीक है, सो प्रोबेबली दैट इज हाउ दे ट्राई टू कंफ्यूज यू, बट आई थिंक इसमें कंफ्यूज होने के लिए थोड़ा स्पेशल टैलेंट लग जाएगा. सो ऑफ कोर्स राइस वाटर स्टूल, ऑफ कोर्स दे टॉक अबाउट कॉलरा टॉक्सिन. हमने सिर्फ टॉक्सिन्स नहीं, टॉक्सिन्स का मैकेनिज्म ऑफ एक्शन सारा कुछ हम पढ़ के गए थे, मैराथन में भी पढ़ा था, अदरवाइज भी हमने बहुत बार पढ़ा है. सो हमें कोई प्रॉब्लम इसमें होनी नहीं चाहिए थी. पेशेंट प्रेजेंट्स विद पेनफुल जिलाइटेड अल्सर एंड टेंडर लिम्फेडिनोपैथी. आगे बात वहीं पे, पेनफुल अल्सर, टेंडर लिम्फोडेनोपैथी, मतलब दोनों पेनफुल, अल्सर भी पेनफुल और लिम्फ नोड भी पेनफुल. हमें पता है दो ही होते हैं, शैंकरॉइड एंड जेनाइटल हर्पीज. जेनाइटल हर्पीज हैज टू वर्ड्स, सो इट्स बायलेटरल. तो अगर यहाँ पे इन्होंने लिखा होता ना मल्टीपल अल्सर्स या बायलेटरल अल्सर्स, तब हमारा आंसर बन जाता है HSV. प्लीज लेट मी नो कि HSV वॉज गिवन इन ऑप्शन और नॉट, बिकॉज देयर सीम्स टू बी सम कंफ्यूजन कि HSV ऑप्शन में था या नहीं. था भी तो भी, इफ दे हैड नॉट मेंशन मल्टीपल अल्सर्स और बायलेटरल अल्सर्स, वेरी लेस लाइकली दैट दे आर टॉकिंग अबाउट HSV. तो यहाँ पे क्या हो रहा है? शैंकरॉइड, ओ का साउंड, सो यूनिलैटरल ब्यूबो, टेंडर लिम्फेडिनोपैथी ब्यूबो, राइट? सो हमारा आंसर क्या बनेगा? शैंकरॉइड इज कॉज्ड बाय हीमोफिलस ड्यूक्री. सीधे सीधे आंसर बनेगा हीमोफिलस ड्यूक्री. यस, करेक्ट, ड्यूक्री, यू आर राइट. व्हाट आई एम आस्किंग डॉक्टर विष्णु इज व्हाट HSV एंड वाज HSV एन ऑप्शन और नॉट, या उसके अलावा कोई और ऑप्शन था क्या? ठीक है, HSV था ही नहीं, इज व्हाट यू आर टेलिंग. सो व्हाट वाज द ऑप्शन अदर देन HSV? HSV ऑप्शन में ही नहीं था तो बात ही खत्म हो गई. दो ही DD बनेंगे, पेनफुल अल्सर और पेनफुल लिम्फ नोड के साथ, या तो शैंकरॉइड या जेनाइटल हर्पीज. हर्पीज ऑप्शन से ही हटा दिया, तो इसलिए ड्यूक्री. अच्छा, दैट इज वाई यू मार्क ड्यूक्री. तो याद है कौन सा ऑप्शन था या नहीं याद है? किसी और को याद है तो ऑफ कोर्स दे कैन टॉक अबाउट इट. ठीक है, चलो आगे बढ़ जाते हैं. आइडेंटिफाई द ऑर्गेनिज्म फ्राइड एग कॉलोनीज. ओ गॉड, नींद में भी पूछोगे तो बता देंगे. क्या बता देंगे? माइकोप्लाज्मा. माइकोप्लाज्मा बता देंगे. कुछ लोगों ने कंफ्यूज किया होगा, किसके साथ कंफ्यूज किया होगा फ्राइड एग कॉलोनीज को? माइकोबैक्टीरिया के साथ. ध्यान से जिसने नहीं पढ़ा, आई डोंट थिंक किसी ने भी कंफ्यूज किया, राइट? चलो आगे बढ़ते हैं. ये क्या है, कौन सा अगार? PPLO अगार. एग्जैक्ट सेम इमेजेस हमने देखी हुई हैं. इमेज वाज गिवन इन द क्वेश्चन. प्लीज लेट मी नो, इमेज वाज गिवन इन द क्वेश्चन. इमेज रखनी है, इमेज हटानी है? सिर्फ फ्राइड एग कॉलोनीज मेंशन था या सिर्फ इमेज मेंशन थी, या फिर दोनों चीजें मेंशन थी? PPLO भी था क्वेश्चन में, मेंशन था ऑन कल्चर ऑन PPLO. अच्छा, वेरी नाइस डॉक्टर विष्णु, थैंक यू. सिंपल, या ओके, वेरी नाइस. हाँ, सिंपल. सो माइक्रो वाज वेरी वेरी सिंपल. चलो आगे आ जाते हैं. फार्मर आ गए हमारे. फार्मर के बिना और लेप्टोस्पायरा के बिना और ट्रक ड्राइवर के बिना तो कोई एग्जाम ही नहीं जाएगा। ये हमारे लकी मैस्कॉट्स है ना। फार्मर वर्किंग ऑन राइस फील्ड, बात ही खत्म। रैट यूरिन, राइस फील्ड एंड रेन वाटर प्रेजेंट्स विद कंजक्टाइवल सफिशिएंट। एग्जैक्ट क्वेश्चन PYQ पिछली बार 2025 FMG। वर्ड्स भी बदलना सही नहीं समझा, बस वहां फार्मर की जगह सीवेज वर्कर था। ठीक है, इक्टेरस भी आ गया। इक्टेरस आते ही आपको पता है कि दिस इज योर इनिशियल icteric disease। अच्छा, नो इमेज, ठीक है भाई, वी विल रिमूव द इमेज एंड वी विल से दैट द वर्ड्स वर रिटन एंड द PPLO वाज मेंशन्ड। ठीक है, थैंक यू गाइस। व्हाट इज द डिजीज कॉजिंग दीज सिम्टम्स, बात ही खत्म हो गई। व्हील्स डिजीज है हमारी, है ना, कितनी बार भी अब डिस्कस, मैराथन में डिस्कस्ड, क्लिनिकल केस सिनेरियो में डिस्कस्ड। अब तक ऐसा कोई भी रिकॉल सेशन ही नहीं हुआ है, बीट एनी एग्जाम, जिसमें व्हील्स डिजीज या लेप्टोस्पायरोसिस की बात ही नहीं आएगा। aggressive symptoms present of leptospirosis, क्वेश्चन वाज लाइक अग्रेसिव सिम्टम्स प्रेजेंट ऑफ लेप्टोस्पायरोसिस, क्या हिपैटोरीनल फेलियर की बात कर रहे थे क्या? हाँ, ऑब्वियसली व्हील्स डिजीज is the dangerous one. So the mild one, leptospirosis, is not your hepatorenal hemorrhagic fever. But अगर देखो, अगर conjunctival sufficient word था, if only conjunctival redness was there and icterus was there, तो अलग बात हो जाएगी। But if they were talking about hepatorenal hemorrhagic involvement, तब अलग बात हो जाएगी। In any scenario, दूसरे ऑप्शंस में लेप्टोस्पायरोसिस नहीं है ना, कुछ भी दिया हो, माइल्ड दिया हो या सिवियर दिया हो, लेप्टोस्पायरोसिस पूछना चाहते हैं। लेप्टोस्पायरोसिस था ऑप्शन, ओके, नाउ दैट चेंजेस इट टोटली। ये बताओ किसको हटाओ फिर, डेंगी, हेपेटाइटिस, मलेरिया। व्हील्स नॉट गिवन इन ऑप्शन तो भी कोई दिक्कत नहीं है। अच्छा, तो आप ये बोल रहे हो कि इट वाज लेप्टोस्पायरोसिस गिवन इन द ऑप्शन, नॉट व्हील्स। ठीक है, स्पीशीज मेंशन्ड इन क्वेश्चन, तो इसको छोड़ के ये नहीं रख के देयर वर लाइक ट्रिपोनीमा मेंशन्ड, ओके, ट्रिपोनीमा मेंशन्ड, लेप्टोस्पायरोसिस गिवन और अदर स्पायरोकीट्स वर मेंशन्ड। अच्छा ठीक है, फाइन, इसको हम स्पायरोकीट्स कर देंगे। तो दे जस्ट वांटेड यू टू मार्क लेप्टोस्पायरोसिस। ठीक है, लेप्टोस्पायरोसिस भी करेक्ट ऑप्शन है, बात तो एक ही है। आप कोई कह रहे था व्हील्स, गाइस जो भी था, व्हील्स था या लेप्टोस्पायरोसिस था, दोनों आंसर आपके करेक्ट हैं। दैट इज व्हाट दे वांटेड टू आस्क यू। कोई बात नहीं, हो गया, आगे बढ़ते हैं। वूल सॉर्टर प्रेजेंट्स विद ब्लैक स्कार ऑन हिज आर्म। अब बहुत सारे बच्चे बोल रहे हैं मैम वूल सॉर्टर, हाइड पोर्टर, क्या फर्क पड़ता है, क्या पूछना चाह रहे हैं? रिकेट्सिया, क्लोस्ट्रीडियम, क्लोस्ट्रीडियम तो नहीं होने वाला ना, क्या होने वाला है? एंथ्रैक्स होने वाला है, बात भी करी थी हमने, चाहे क्यूटेनियस एंथ्रैक्स हो चाहे पल्मोनरी एंथ्रैक्स हो। ठीक है, probably they have given wool sorter, but of course wool sorter can also come in contact with the wool, है ना, ऐसा कोई जरूरी तो नहीं है कि उसको पल्मोनरी ही होगा। बात इतनी सी है कि दे वांटेड यू टू नो कि ब्लैक स्कार अगर आम पे आ रहा है और कोई भी एनिमल हैंडलर है किसी भी तरह का, यू शुड हैव मार्क बैसिलस एंथ्रासिस। ठीक है, व्हील्स डिजीज, नॉर्मल लेप्टोस्पायरोसिस, व्हाट आर डिफरेंट? डॉक्टर विष्णु, कैन यू प्लीज एलाबोरेट द क्वेश्चन? अगर व्हील्स एंड लेप्टोस्पायरोसिस बोथ फॉर टू डिफरेंट ऑप्शंस, तो फिर उन्होंने डिफरेंसेस पूछे थे। ओके, दैट डज नॉट साउंड राइट। चलो चलो, ओके फाइन, इफ यू स्लीप ओवर इट, इफ यू कैन रिमेंबर इट, प्लीज DM मी ऑन माय सोशल मीडिया, डायरेक्टली मुझको बोलो, आई एम गोइंग टू अपडेट इट। मदुराई फूड का ट्रीटमेंट का क्वेश्चन था, हाँ ठीक है, वे कमिंग ऑन टू इट, कमिंग ऑन टू इट। अब ये डाउट है, ये क्वेश्चन पूछा गया था, कफ कोराइजा, कॉप्लिक स्पॉट्स और ब्लूइश स्पॉट्स इन द म्यूकोजा और ब्लूइश स्पॉट्स, इमेज दिया था, बच्चा था, वाज दिस क्वेश्चन गिवन? दिस इज ऑब्वियसली मीजल्स ही होगा ना, ऑब्वियसली मीजल्स ही होगा। यस, दिस वाज गिवन। कैन यू रिकॉल सम अदर क्वेश्चंस? कैन यू रिकॉल सम अदर ऑप्शंस सॉरी। इजी पेपर था, हाँ, नहीं रोते, कोई नहीं रोता बेटा, दे आर जस्ट ट्राइंग टू रिकॉल, है ना। अभी सब थक गए हैं, थकने की वजह से एम्प्यूटेशन। अरे इसका ऑप्शंस प्लीज टेल मी द ऑप्शंस ऑफ कॉप्लिक स्पॉट एक्सप्लेन था इन टेक्स्ट। अच्छा, एक्सप्लेन्ड इन टेक्स्ट, अच्छा, तो ब्लूइश स्पॉट करके उन्होंने ऐसे बोल दिया, इमेज नहीं दिया था, नो इमेज, नो इमेज। अच्छा ठीक है, नो इमेज, ओके 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 फाइन, ओके गाइज, नो स्पैमिंग। चलो, क्या है, बच्चा है, ऑब्वियसली मीजल्स है। ऑप्शंस बता दो, कुछ थे क्या? रुबेला, रुबेला वाज देयर, ठीक है ठीक है, ओके, रुबेला, और कुछ मिलता जुलता, हैंड फुट माउथ डिजीज, कुछ भी, वायरल एक्जांथम्स ऑफ चाइल्डहुड, स्कारलेट फीवर, ऐसे कोई। अच्छा, मम्प्स, मम्प्स वाज एन ऑप्शन, चलो ठीक है। और कुछ मिलता जुलता, रिंगिंग अ बेल, रिंगिंग अ बेल, स्कारलेट फीवर जैसा, रोजियोला, रुबेला मम्प्स, ठीक है, रुबेला मम्प्स आ गया। फोर्थ ऑप्शन किसी को याद आ रहा है तो बात करेंगे। चलो ठीक है, फाइन। ओके ओके, मम्प्स, रुबेला, मीजल्स, ठीक है, मीजल्स है, बात ही खत्म हो गई है ना। मीजल्स हमारा ऑप्शन है। 3 Cs, कफ कोराइजा कंजंक्टिवाइटिस प्लस फीवर पहले। लॉन्ग केस प्रेजेंटेशन, लॉन्ग केस की तरह दिया था क्या, क्लिनिकल केस की तरह, दैट देयर इज अ चाइल्ड हु प्रेजेंट्स विद, मतलब रैश वैश भी एक्सप्लेन किया हुआ था। FMG पेपर इजी, ओहो, आई एम आस्किंग लॉन्ग केस प्रेजेंटेशन यू आर सीइंग वाज रैश एक्सप्लेन्ड, रैश वाज एक्सप्लेन्ड। चलो मुझे बता देना गाइस, ठीक है, लेट मी नो, कोई बात नहीं। इट वाज एक्सप्लेन, ठीक है, आप कह रहे हो कि रैश वाज एक्सप्लेन्ड, ज्यादा ये क्लिनिकल स्टेम क्वेश्चन की तरह था, ठीक है, फाइन फाइन फाइन, वी विल ट्राई टू कम अप विद द क्लोजेस्ट पॉसिबल क्वेश्चन। चलो ये था, वाज मलेरिया देयर। अब मलेरिया में सिर्फ आइडेंटिफिकेशन थी, लॉन्ग केस क्लिनिकल सिनेरियो, ठीक है, समझ गए, फाइन, आई विल ऐड इट। ये क्वेश्चन था, वाज दिस इमेज गिवन, क्या हमको आइडेंटिफाई करने थे हमारे फैल्सीपैरम के मल्टीपल डॉट्स या गैमेटोसाइट्स या कुछ। 3 lines, yes, explain, ठीक है, 230 plus correct, thank you so much, all right, Dr. Morphine, so happy. I hope you're not manifesting and this is the truth, along with all symptoms, Koplik spot explained in text, ठीक है, got it, got it. This was a long clinical case, लिख लिया मैंने, long clinical case, इसको we will update in the final recall, ठीक है। मलेरिया विद इमेज, बोला था मलेरिया है, मलेरिया वाज मेंशन, या बस ये था कि विच ऑर्गेनिज्म, क्या लिखूं। ऑब्वियसली आंसर आप बोल रहे हो कि प्लाज्मोडियम फैल्सीपैरम था, तो प्लाज्मोडियम फैल्सीपैरम ही मार्क करना था, या फिर दे हैड मेंशन, यस, बट ट्रीटमेंट बताना था। इमेज गिवन, ट्रीटमेंट आंसर, सो अच्छा, फैल्सीपैरम वाज मेंशन्ड इन क्वेश्चन और यू हैड टू आइडेंटिफाई। Guys, don't talk about all this right now. Micropharma integrated, I get it, artisanate wala. Falciparum was mentioned in the question, yeah, you had to identify. You had to first identify, and then treatment. चलो ठीक है, तो सिराज सर will take it up. बता दो, you had to integrate it, ठीक है, बात समझ आ गई। First you had to identify North Indian patient, falciparum treatment, image given, only image given, एंड आपको बोला नॉर्थ इंडियन। अच्छा ओके, ठीक है, फार्मा में ले जाएंगे, नो प्रॉब्लम, ठीक है ठीक है, वी हैड टू गिव ट्रीटमेंट इन, अच्छा मणिपुर हो गया, नॉर्थ ईस्ट था क्या, नॉर्थ ईस्ट पूछना चाह रहे थे, ठीक है, फाइन फाइन, ओके ओके ओके, नो आइडेंटिटी। पेशेंट फ्रॉम तमिलनाडु प्रेजेंट्स विद मल्टीपल ड्रेनिंग साइनसेस, बात ही खत्म भाई, ऑन फीट बायोप्सी शोज हाइफे ट्रू, यू माइसेटोमा, बात खत्म, कितनी बार डिस्कस, क्या करेंगे, ये है इंपॉर्टेंट, क्या करेंगे। एंटी फंगल और सर्जिकल रिसेक्शन, सिर्फ सर्जिकल रिसेक्शन, सीधे एम्प्यूटेट तो नहीं कर देंगे भाई पेशेंट को, एंटीबायोटिक्स अलोन, एंटीबायोटिक्स का कोई मतलब नहीं है, एंटीबायोटिक्स मतलब एंटीबैक्टीरियल। अब बताओ, सर्जिकल रिसेक्शन सिर्फ या फिर एंटी फंगल के साथ सर्जिकल रिसेक्शन आना चाहिए। नॉर्थ ईस्ट ठीक है, अब इम्फाल हो, मणिपुर हो, कुछ भी हो, नॉर्थ ईस्ट इज व्हाट दे वर आस्किंग, लेट्स मूव अहेड फ्रॉम दैट। ठीक है, कोई बात नहीं, यू आर टायर्ड, चलो ठीक है, एंटी फंगल थेरेपी प्लस सर्जिकल रिसेक्शन है ना, ऑब्वियसली, एंड दोनों चीजें करेंगे हम पेशेंट के साथ, एकदम से एम्प्यूटेट तो कर नहीं देंगे। पूछना क्या चाह रहे थे, ये मदुरा फुट, तमिलनाडु आते ही दिमाग में आना चाहिए मदुरा फुट, ठीक है, बहुत अच्छे अच्छे बजवर्ड्स, वेरी वेरी सिंपल, है ना। पेशेंट प्रेजेंट्स विद फास्ट मूविंग सर्पिजिनस रैश ओवर द बॉडी, सर्पिजिनस रैश आते ही क्या आएगा दिमाग में, लार्वा, लार्वा माइग्रेंस, क्यूटेनियस लार्वा माइग्रेंस। अब इसमें क्या बजवर्ड, फास्ट मूविंग, क्या हो गया, लार्वा करंस, मतलब के स्ट्रोंगिलॉइड्स टर्कोरालिस। अच्छा अब ये बताओ, इसकी इमेज गिवन थी क्या, वो जो तुम बोल रहे हो कि लॉन्ग वोम विद टेपरिंग एंड्स, वाज द इमेज ऑफ लार्वा गिवन, इसी के लिए बोल रहे थे क्या, इसी के लिए बोल रहे थे क्या, इमेज ऑफ लार्वा, माइक्रो में तमिलनाडु वाले, ओके ओके, इमेज ऑफ लार्वा वाज गिवन, ऐसा कुछ था? नहीं था? वो जो तुम बोल रहे हो लॉन्ग वर्म विद टेपरिंग एंड, वो ऐसा स्ट्रोंगिलॉइड स्टर्कोलारिस का लार्वा तो नहीं दिखा रहे थे ऐसा? यस, इसी में इमेज थी। ओके ओके ओके, इसमें इमेज ऑफ लार्वा हम ऐड कर देंगे, खत्म, फिर तो और भी कोई टेंशन नहीं है। इमेज ऑफ लार्वा ऐड कर देंगे, और भी कोई टेंशन नहीं है, फिर तो बहुत ही क्लियर हो गया आंसर, है ना? डिफरेंट इमेजेस, हाँ ठीक है, कोई बात नहीं। डिफरेंट इमेज, सिंगल इमेज, गॉट इट। पेशेंट प्रेजेंटेड विद बर्किट लिम्फोमा, पॉल बनल, कितनी बार पढ़ा? टीबी इज इक्वल टू ईबी, पढ़ा था ना हमने? पीनट बटर सैंडविचेस ऑन वेंसडेज एंड फ्राइडेज, हेट्रोफाइल एंटीजन, पीबी इज फॉर ईबी, सीधे ही बात खत्म हमारी। एप्स्टीन बार वायरस, सिंगल इमेज ऑफ स्ट्रोंगिलॉइड्स, गॉट इट, आई विल अपडेट इट। एक्स एंड वी फैक्टर्स, ये क्वेश्चन था क्या? Are used to grow which of the following organisms? Was this question asked? X and V factors, Haemophilus influenzae पूछना चाहते थे with option like influenza, confusing options. Nope, that was colored image of worm. कोई बात नहीं, कोई बात नहीं। I think we have reached a common consensus अब तक कि image of worm जो थी वो strongyloids, larva currents वाले question में थी। सर्पिजिनस ट्रैक्स की इमेज थी क्या? इमेज लार्वा की थी या सर्पिजिनस ट्रैक्स की थी? अब तुम कलर्ड वर्म्स बोल रहे हो, तो क्या वो वर्म्स मूविंग अंडर द स्किन, रेड रेड कलर्ड अंडर द स्किन, ऐसी इमेज थी? इमेज ऑफ लार्वा है या इमेज ऑफ रैश है? ये सर्पिजिनस रैश। अब लार्वा की कलरलेस इमेज माइक्रोस्कोपिक फोटो थी या सर्पिजिनस ट्रैक्स जो बनाएगा स्किन के अंदर लार्वी, उसकी इमेज थी? डॉक्टर कबीर, ये क्लियर करो। लार्वा की इमेज थी, लार्वा इमेज, बात ही खत्म। ठीक, ठीक है ना? तो 2 क्वेश्चंस हमारे ऐसे ही थी। ओके ओके डॉक्टर अक्षय, फाइन फाइन फाइन, ओनली सिंगल वर्म, ऑल राइट कबीर, गॉट इट। चलो, ये था क्वेश्चन। एक्स एंड वी फैक्टर्स था, एक्स एंड वी फैक्टर्स था, इमेज ऑफ लार्वी, थैंक यू गाइज, यस गॉट इट। एक्स एंड वी फैक्टर्स वाज देयर, was it there or not? ऑक्सिलरी फैक्टर वाला क्वेश्चन अब था, डायरेक्ट येलोइश लाइट, हाँ हाँ, ओके ओके, गॉट इट गाइस, आगे बढ़े, खत्म करते हैं ना? एवरीबडी इज टायर्ड। एक्स एंड वी फैक्टर्स इन मीडिया टू ग्रो विच ऑफ द फॉलोइंग ऑर्गेनिजम्स, ऐसे डायरेक्ट क्वेश्चन। एच इन्फ्लुएंजी कोई दिक्कत ही नहीं है, हमने हमने मैराथन में सारे स्पेशल बैक्टीरिया और कल्चर्स हमने कवर करे थे, राइट? अच्छा, yes it was there। चलो, तो डायरेक्टली ऐसे ही पूछा था, एक्स एंड वी फैक्टर्स आर यूज्ड टू ग्रो विच ऑफ द फॉलोइंग ऑर्गेनिजम्स। एच इन्फ्लुएंजा के पीछे वैसे भी पड़े रहते हैं वो, सैटेलिटिज्म पूछ लेंगे, हर बार सैटेलिटिज्म पूछते हैं, तो इस बार क्या किया? सैटेलिटिज्म से क्या होता था? एक्स एंड वी निकलता था, स्टाफ ऑरियस देता था, इसलिए ग्रो करता था, उसको अदरवाइज घुमा के पूछ लिया, एक्स एंड वी करके पूछ लिया, है ना? वेरी टायर्ड, ओके वी डन देन। Reduced use of step wells has led to a decrease in which parasitic infection, हम बात कर चुके हैं। गिनी वर्म ड्रैकनक्यूलोसिस इंडिया से इरेडिकेट हो चुका है, दैट इज व्हाट दे वर ट्राइंग टू आस्क यू। स्टेप वेल्स होते हैं जिसमें जाने से डायरेक्ट स्किन पेनिट्रेशन से द वर्म यूज टू एंटर इनसाइड, अभी कोई भी नहीं इसकी बात करता है, दिस इज एन ओल्ड क्वेश्चन। नाउ यू टेल मी वन थिंग गाइज, आपने एक मुझे बोला टू ऐड द क्वेश्चन बॉट्यूलिज्म, बॉट्यूलिज्म का आपने मैकेनिज्म ऑफ ट्रांसमिशन बोला है मुझे, ठीक है? मैकेनिज्म ऑफ ट्रांसमिशन ऑब्वियसली फूड बॉर्न है, फूड पॉइजनिंग कराएगा, इट्स अ टॉक्सिन मीडिएटेड डिजीज, ठीक है, नो प्रॉब्लम। अब मुझको ये बताओ, वाज देयर एनी क्वेश्चन ऑन साइटोटॉक्सिक ड्रग्स, साइटोटॉक्सिक ड्रग्स बायोमेडिकल वेस्ट मैनेजमेंट, साइटोटॉक्सिक ड्रग्स डिस्पोजल बायोमेडिकल वेस्ट मैनेजमेंट, वाज देयर एनी क्वेश्चन? Biomedical waste management of cytotoxic drugs, how will they be discarded, ऐसा कोई question? Is it ringing a bell? Okay, is this ringing a bell? Cytotoxic drugs था, can you recall it? Dr. Vishnu, Dr. Akshay, Dr. Priyadarshini, can you recall the question? See, there was it a direct question? asking where do you discard it? Yellow bag, cytotoxic label. Biomedical waste. How they are sterilized. Final step of sterilization. Final disposal. अब expired tablets था या cytotoxic drugs था? टोटल पेरेंटल न्यूट्रिशन बैग पूछा था, एक टीपीएन का क्वेश्चन है. चलो आई थिंक टीपीएन वाला तो येलो बैग फाइनल डिस्पोजल स्टेप पूछा था. ठीक है, सो दैट मेक्स इट 18 क्वेश्चंस एक्चुअली, है ना. वन यू हैव टोल्ड मी कि was not asked and then 2 more you have added, so I had 17 questions, so that means 18 questions were asked in microbiology. कोई दिक्कत नहीं है, इतना तो एक्सपेक्टेड ही होता है. सो आई थिंक वी विल स्टॉप द रिकॉल हियर एंड आई विल आस्क द नेक्स्ट फैकल्टी टू प्लीज ज्वाइन. एंड थैंक यू सो मच गाइज. अभी सो जाओ आराम से, नॉट अ प्रॉब्लम. बस रिकॉल खत्म करके, एंड इफ यू रिकॉल एनी सच मोर क्वेश्चंस देन प्लीज फील फ्री टू डीएम मी. ऑलराइट, थैंक यू गाइज. ओवर टू यू सर.
All right, thank you very much, ma'am, for this wonderful recall of microbiology. And I'm going to quickly cover up the pharmacology that was asked. And let me tell you, most of the pharmacology that we covered here was mostly covered in RR and the 4-hour session that we conducted on YouTube. What are the questions that was asked in pharmacology? The very first question was mechanism of action of finasteride. Now, let me tell you the question that was not very straightforward as it is, but gist यही है. अगर पूरा लैंग्वेज आप भी समझ सकते हैं कि द टाइम लिमिटेशन इज देयर, बट लास्ट लाइन क्वेश्चन यही है कि भाई मैकेनिज्म ऑफ एक्शन ऑफ फिनास्टेराइड क्या है. And here I have added the screenshot from the lecture as well. And finasteride is one of the 5 alpha reductase inhibitor that is actually utilized in the management of the benign prostatic hypertrophy. So this question we have covered also in the class as well, right? The next question is going to be about a male patient from Imphal. तो कई लोग इम्फाल बोल रहे हैं, कई लोग मणिपुर बोल रहे हैं. अल्टीमेटली सब जगह एक ही है. कहने का मतलब ये है कि पेशेंट इज कमिंग फ्रॉम नॉर्थ ईस्ट स्टेट विद प्लाज्मोडियम falciparum and cerebral malaria. Now there is a lot of confusion around this question, and I actually want to see your comments as well at any point of time. Just allow me a minute, please. All right, so I'll keep an eye on the this comment section. So at any point of time, if you feel that particular question was not there in the option, you can definitely give your reply in the comment section. So इसमें काफी सारे डाउट्स है. बहुत सारे बच्चे बोल रहे हैं सर 3 days था, बहुत सारे बच्चे बोल रहे हैं सर 14 days था. बट अगेन मेल पेशेंट सेरेब्रल मलेरिया यूजुअली फाल्सिपारम के थ्रू होगा, आर्टिमिथर for 3 days, primaquine on day 2. अगर ऐसा कुछ ऑप्शन था तो the correct answer will be undoubtedly this one. However, 14 days you give mainly primaquine 14 days you mainly give for Vivax and Oval. Vivax and Oval में 14 days देने का मतलब क्या होता है? Our purpose here is actually to take care in this condition for the radical cure. Radical cure के लिए mainly हम at least 14 days के लिए देते हैं in this case scenario, right? Artesunate sulfadoxine pyrimethamine we are going to give it for 3 days if the patient is coming from rest part of India से हम ये देते हैं, right? Chloroquine primaquine again is not going to be the option. Chloroquine have a resistance pattern that we know here already. All right, so A वाला था, अगर A वाला था तो यही correct answer था, right? So I hope all of you guys have got this question as well. So we are done with the second question as well here. And this is a screenshot from the examination, I mean from the lecture that we know. अगर mix था तो इसके पहले mix भी पूछा हुआ है, तो this is the mix. इसमें हम प्राइमाक्विन भले ही हम देते हैं for 2 weeks, 14 days के लिए इसमें हम प्राइमाक्विन देते हैं. और Vivax and Oval में we are going to give for 2 weeks, that is for 14 days, right? ये भी highlighted है. Rest part या north east state से artemether-lumefantrine plus primaquine is given 45 milligram single dose on day 2. So this is a straightforward question from 2024 NEET PG as well. A similar kind of question was also asked in NEET PG. Remember that. A child with history of uncontrolled epilepsy was added on drugs. मतलब uncontrolled epilepsy है, they will keep on giving the drugs like lamotrigine, carbamazepine, valproate, phenytoin was given. He is having maculopapular rash. Again, this was not, once again I'm telling you the exact question. The students had sir question थोड़ा सा बड़ा था, but gist यही था कि भाई बहुत सारे मेडिसिन दिए गए, मल्टीपल मेडिसिन पे कंट्रोल नहीं था, इसलिए ऐड किया गया. Now he is having maculopapular rash. Which drug is safe to continue? Always to remember, Stevens-Johnson syndrome rashes are commonly associated with lamotrigine, carbamazepine, and phenytoin. So which one is safe to be given in this case scenario? That is going to be valproate is the one that is going to be safe in this case scenario, right? ठीक है. हाँ, रैश अगर है, मैक्यूलोपैपुलर रैश हो गया ना. सो रैश अगर दिया है, रैश है मतलब कि स्टीवन जॉनसन सिंड्रोम या अदर रैश जो ड्रग कराते हैं, ऐसे ड्रग्स को हम नहीं देंगे, राइट? सो इट्स प्रीटी सिंपल, वी आर नॉट गोइंग टू गिव द ड्रग दैट कैन एक्चुअली कॉज द रैश. ओके, प्रीटी मच सेम, देन दैट्स इट, है ना? प्रीटी मच सेम है, मतलब वही है, ठीक है. अगेन लैमोट्रिजिन कॉजिंग रैश, देखिए मैंने बताया भी था, लैम्बोर्गिनी कार लेके जाओगे तो घर पे रेड पड़ जाएगा, है ना? रेड का जमाना चल रहा है, तो रैश इज वन ऑफ द वेरी इंपॉर्टेंट साइड इफेक्ट. कार्बामाजिपिन में भी मैंने बताया था कार्बामाड, तो कार्बामाड में आर से रैश कार्बामाजिपिन में भी है. वी कुड नॉट ऐड द स्क्रीनशॉट हियर ड्यू टू सम रीजन, फोन में अगेन वो स्क्रीनशॉट आ नहीं पा रहा था, बट अगेन कार्बामाजिपिन में भी हैव डिस्कस्ड, फेनिटोइन में भी आल्सो रिमेंबर वी हैव डिस्कस्ड. A patient with lepra reaction, as it is line by line, हमने RR में भी same topic. ये forget about the question, the same forget about the topic. The same question was discussed actually in our RR. You can check it out. RR same question, same image के साथ, almost similar kind of image was asked. कि भाई type 1 lepra reaction या lepra reaction हो गया तो इसमें आप क्या करोगे? तो in that case scenario you are not going to stop, continue the multi drug therapy and add oral steroids, right? So the same question आप आर चेक करिएगा as it is. So this is like नीट पीजी का PYQ उठा करके और कट पेस्ट कर दिया गया in this case scenario. Remember this one, ठीक है? So lepra reaction. अगर cause of rash most commonly पूछा था तो in that case scenario carbamazepine, lamotrigine अगर ऑप्शन में था तो we can go ahead with the carbamazepine followed by lamotrigine. lepra reaction again देखिए क्या लिखा है मैंने यहाँ पे, do not stop multi drug therapy and add the steroid. Drug of choice will be steroid. So as it is, line by line, continue the multi drug therapy and steroid, add the steroids. Which of the following immunosuppressant doesn't act by calcineurin inhibition? Again, this was a little controversial because drugs like voclosporin is very new, and I'm not sure if voclosporin was actually there in the option. To those 2021 का approved drug है, तो इतना recent drug अगर पूछा हुआ है, तो you have to see cyclosporin definitely is one of the calcineurin inhibitor. Tacrolimus likewise, mycophenolate, mofetil, they are the DNA synthesis inhibitor, right? So they are also an immunosuppressant. अगर ये question था, if something like this was asked, remember the correct answer for this one is going to be mycophenolate, mofetil. और Zozo बोल रहे हैं a non-calcineurin inhibitor to replace in a patient, and options were azathioprine, mycophenolate, mofetil. Cyclosporin was given before, okay? Cyclosporin दे दिया गया है. See, इसमें मैं बता दे रहा हूं, अगर साइक्लोस्पोरिन रेजिस्टेंट है, मैं आपको क्वेश्चन का जिस्ट दे दे रहा हूं, इफ देयर इज अ साइक्लोस्पोरिन नॉन रेस्पॉन्सिव, एनआर मतलब नॉन रेस्पॉन्सिव और रेजिस्टेंट, बिकॉज ये इफ्लक्स पंप के थ्रू ना रेजिस्टेंट हो जाते हैं, जो पी ग्लाइकोप्रोटीन है इनको इमीडिएटली किक आउट कर देते हैं. तो इन दैट के सिनारियो द नेक्स्ट प्रिफर्ड विल बी योर टैक्रोलिमस. वी कैन एक्चुअली यूज टैक्रोलिमस. तो क्वेश्चन का लैंग्वेज अगर मिल जाता है, बिकॉज आई गॉट द क्वेश्चन विच ऑफ द फॉलोइंग डजंट एक्ट बाय साइक्लोस्पोरिन, तो मुझे खुद भी लगा यार ऐसा क्वेश्चन कैसे आ गया. साइक्लोस्पोरिन वाज गिवन बिफोर, इफ इट इज नॉन रेस्पॉन्सिव देन अगर टैक्रोलिमस था तो वी कैन ऐड टैक्रोलिमस. अगर कुछ और था, बिकॉज साइक्लोस्पोरिन का रेजिस्टेंट पूछ रहा है विच इज द नेक्स्ट कैल्सिन्यूरिन इनहिबिटर, तो टैक्रोलिमस इज वन ऑफ द कैल्सिन्यूरिन इनहिबिटर. रिमेंबर दैट. Non-calcineurin inhibitor to replace in a patient, and options were azathioprine, mycophenolate, mofetil. Interleukin 2 inhibitor will be daclizumab, basiliximab. अगर interleukin 2 का क्वेश्चन आया हुआ है तो I'll just add it here. Interleukin 2 inhibitor will be drugs like your daclizumab and basiliximab. Daclizumab and basiliximab. That is the interleukin 2 inhibitor. अगर वो क्वेश्चन आया हुआ था तो नॉन कैल्सिनुरिन, अगेन अगर नॉन कैल्सिनुरिन है तो साइक्लोस्पिरिन टैक्रोलिमस तो हो ही नहीं सकता। इसके अलावा बाकी जो भी ऑप्शन होगा, अगर एजाथायोप्रिन है दैट इज वन ऑफ द इम्यूनोमॉड्यूलेटर, माइक्रोफिनोलेट है तो माइक्रोफिनोलेट मोफेटिल इज वन ऑफ द ऑप्शन। इस क्वेश्चन को थोड़ा एक बार और रिफ्रेश करिएगा, एंड आई एम पुटिंग अ क्वेश्चन मार्क ऑन दिस क्वेश्चन, वी कैन वर्क ऑन दिस क्वेश्चन ऑल ओवर वंस अगेन। इस क्वेश्चन की एक बार और हम वर्कअप करें किस तरह क्वेश्चन आया था। कैल्सिनुरिन इनहिबिटर, एज आई टोल्ड यू साइक्लोस्पिरिन, इसके आगे वाले स्लाइड्स में आई हैव कवर्ड हियर ऑलरेडी दैट साइक्लोस्पिरिन कैसे रेजिस्टेंट होता है, तो वी यूज टैक्रोलिमस। देन इसके बाद से द नेक्स्ट ड्रग दैट वी हैव लाइक azathioprine, mycophenolate, meflotil comes next in the immunosuppressant. ठीक है, then this question was the patient with CML. Now again this was a case based scenario and integrated with the path integrated. अगर ये path integrated था, case based scenario आया था, तो imatinib CML के लिए the drug of choice है। if CML was there in the option और CML was case में पता चल रहा था, imatinib mesylate was there in the option, that is the correct one। अगर वो नहीं था, second generation भी हम use कर सकते हैं, like bosutinib है ना, पोनाटिनिब, वो भी हो सकते हैं as a tyrosine kinase inhibitor as the next drug. Next is going to be a patient on antihypertensive drug presented with a hyperkalemia or hyperkalemia like features. अगर hyperkalemia के साथ आ रहा है तो remember all the RAS system inhibitor, I always tell you all the RAS system inhibitor are going to be associated with hyperkalemia. तो ACE inhibitor, ARBs and aldosterone receptor blocker, they all can cause. Furosemide is one of the diuretic, they are going to be associated with hypokalemia. They are going to be associated with the hypokalemia. So remember this, they themselves are causing elevated potassium, that is hyperkalemia. All the RAS system inhibitor is causing hyperkalemia. Do remember this one as well. ठीक है, अगर ये क्वेश्चन हाइपरकैलेमिया वाला था तो द करेक्ट आंसर फॉर दिस वन विल बी फ्यूरोसेमाइड। या हाइपरकैलेमिया वाला अगर क्वेश्चन था और पूछा कौन सा ड्रग नहीं देंगे तो एनी ऑफ द RAS सिस्टम इनहिबिटर विल नॉट बी गिवन, राइट। कैप्टोप्रिल भी नहीं देंगे, अगर कैप्टोप्रिल 5 मिलीग्राम था तो वो भी नहीं देंगे, वो भी नहीं देंगे। मान लीजिए टेलमिसार्टान 20 मिलीग्राम था तो वो भी नहीं देंगे, बिकॉज दे देमसेल्फ कॉज hyperkalemia. Alcoholic patient was started on de-addiction therapy. So this question ka language I tried to correct as much as I could, and he consumed alcohol. He is actually on de-addiction therapy. Later he developed vomiting, flushing, headache and fall in the blood pressure. Which of the following drug can cause this symptom? Again, this is actually a case of disulfiram like reaction. Because this question has been asked, let's prepare the next possible question. अगले एग्जाम में क्या आएगा कि ये जो ड्रग दिया गया which is causing this de-addiction वाला symptom, it is acting by inhibiting D for disulfiram, D for aldehyde dehydrogenase inhibitor. They are going to be aldehyde dehydrogenase inhibitor. That is the next one, right? So disulfiram is one of them that is going to be associated with the disulfiram or other drugs that is causing disulfiram like reaction. तो disulfiram मैं बार बार बोलता हूँ, ये इनका पेट क्वेश्चन है, हर एग्जाम में ऑलमोस्ट ये क्वेश्चन रहता ही रहता है, ठीक है। Memantine is one of the NMDA antagonists. Again लेक्चर का स्क्रीनशॉट भी है. They are one of the NMDA antagonists utilized in the treatment of Alzheimer's disease, right? Alzheimer's disease. इसके पहले वाले एग्जाम में 2024, 2023, 2024 नीट पीजी में पूछा कि which of the following drug is the one that is going to be utilized in Parkinson, sorry, not utilized in Parkinson disease, right? तो उसमें बहुत सारे ड्रग पार्किंसन के थे और एक ही ड्रग था उसमें अल्जाइमर का. इस बार अल्जाइमर डिजीज टॉपिक से नेक्स्ट क्वेश्चन दे दिया. तो रिमेंबर मेमेंटिन इज वन ऑफ द एनएमडीए एंटागनिस्ट. ठीक है, अगर उसमें भी अल्कोहल लिया है ना तो अगेन डाइसल्फिराम ही होगा, that is causing aldehyde dehydrogenase. A patient of gout was started on colchicine, C for colchicine, and RR में भी हमने इसको डिस्कस किया था. Colchicine is one of the right chemotaxis, C for chemotaxis inhibitor, right? Chemotaxis inhibitor. So remember this one, colchicine specific drug है, chemotaxis inhibitor, microtubule polymerization inhibitor as well. So again this question was also something that we discussed. So gout पे again, gout इनका एक पेट टॉपिक है, मैं बार बार बोलता हूँ, gout पे भी दो क्वेश्चन थे. Again, a patient with history of gout presented with severe pain of metatarsophalangeal joint. Which of the following is the immediate management? Immediate management में हम क्या देंगे? COX inhibitor. So the best drug is going to be indomethacin. Probenecid, uricosuric है, and these are used for the chronic. So immediate management के लिए हम जो use करेंगे that is going to be your indomethacin. बाकी सारे के सारे हम देते हैं chronic gout में, right? Indomethacin as rightly mentioned here in the acute scenario. ठीक है. All right, Vishnu, that is still going to be the drug that is causing the symptom will be disulfiram. कहने का मतलब ये है कि लैंग्वेज थोड़ा चेंज होगा, लैंग्वेज विल बी डिफरेंट. आप क्वेश्चन का स्टेम अगर आपको लग रहा है कि सेम था तो करेक्ट आंसर वाज disulfiram. Patient with history of peripheral neuropathy. Now, this question was also pretty long case, right? Neuropathic pain hai. He was given some drug, non-responsive. Then he was added on pregabalin. What is the mechanism of action of pregabalin? So, pregabalin is one of the drug that is going to act by inhibiting N-type calcium channel. They also have GABAergic property utilized in neuropathic pain. So, they are the sodium channel blocker. N-type sodium. Sorry, they are one of the N-type calcium channel blocker, right? Not voltage sodium channel. They are the N-type calcium channel. See, I have written here already N-type calcium channel blocker. So again, pregabalin, the mechanism which was correct here was this one. A patient with lithium toxicity presented with the ECG changes. Now इसमें भी कई सारे ऑप्शन में थोड़ा हैफेजार्ड था, स्टूडेंट्स का जो थॉट प्रोसेस था वो लिटरली इतना सही नहीं था, एंड आई कुड नॉट पुश हियर आल्सो, बट अगेन आई ट्राई टू आस्क ECG चेंजेस पूछा था, बच्चों ने बोला यस ECG चेंजेस. तो ECG चेंजेस समथिंग दैट वाज एक्सपेक्टेड इन नीट पीजी, राइट, नॉट इन योर एग्जामिनेशन, बट स्टिल अगर पूछा तो क्या QT प्रोलॉन्गेशन कर सकता है? यस. क्या ये टी को फ्लैट करेगा? एंड फ्लैट टी वेव, यहाँ पे एक टी छूट गया है, फ्लैट टी वेव, क्या ये कर सकता है? यस, ये भी कर सकता है. तो करेक्ट आंसर इज दिस वन, फ्लैट टी वेव, right? QT prolongation, flat T wave. It can even lead to ST changes as well, right? So again, among the given choices, that was correct, and it was also discussed here. See, QT prolongation, T wave का flattening, right? Lithium toxicity. अगले एग्जाम में पूछेगा lithium toxicity का मैनेजमेंट कैसे करेंगे, तो नेक्स्ट एग्जामिनेशन की तैयारी करिए कि मैनेजमेंट में lithium toxicity हम क्या करते हैं. तो ट्रीटमेंट में हम देंगे हीमोडायलिसिस, या अगले एग्जामिनेशन में जब ये पूछ लिया ऑलरेडी, तो दे विल बी आस्किंग कि इस पेशेंट का थेराप्यूटिक ड्रग मॉनिटरिंग कैसे करेंगे, किस पे टॉक्सिसिटी आएगा, कौन सा थेराप्यूटिक रेंज है. डू रिमेंबर दैट. Which of the following the first symptom of opioid overdose? Again, there was a case-based scenario. Opioid overdose होता है, क्या सबसे पहला symptom होता है? If this was something like this was the option, meiosis. जब हमने RR लिया था, RR में भी डिस्कस किया, रेगुलर में भी डिस्कस किया, और जो लास्ट में 4 घंटे का YouTube था उसमें भी डिस्कस किया. The first phase of the 4-hour lecture was this, opioid poisoning. बस symptom is meiosis. I always say in case of toxicity, poisoning, look in the eyes, because eyes never lies, है ना, आंखें कभी झूठ नहीं बोलती हैं. So again, they will be causing meiosis. That is going to be centrally acting, their action at the Edinger-Westphal nucleus. That is leading to meiosis. Sometimes it is also given the name as a pinpoint pupil. ठीक है. अगर QT prolongation के साथ T wave flattening था, that is said by students, then that will be correct. अगर सिर्फ QT prolongation था, then QT prolongation, मतलब अगर QT prolongation था और T wave inversion था, then go with the QT prolongation. ठीक है. Next one, which agent decreased lactation? Again, this was a case based scenario. जो एक पॉइंट में अगर बताया जाए, जो क्वेश्चन का स्टेम था, जो क्वेश्चन का जिस था, वो ये था कि लैक्टेशन को कौन कम करेगा? ब्रोमोक्रिप्टिन, बिकॉज रिमेंबर हियर दैट डोपामीन हैज इनहिबिटरी इफेक्ट ऑन द प्रोलैक्टिन. Dopamine has inhibitory effect on the prolactin, and in that case scenario, remember, अगर आपने dopamine agonist दिया like bromocriptine, cabergoline, so they will actually lead to inhibiting action on the prolactin. They are going to inhibit the action of prolactin. So this was also discussed in regular classes, also in RR also, उसमें भी discuss किया गया. तो correct answer for this one was bromocriptine. Remember, decrease lactation. Bromocriptine, cabergoline दोनों ही dopamine receptor agonist है. Mechanism of action of methotrexate, I am not sure if this question was asked. अगर methotrexate का mechanism of action rheumatoid arthritis में पूछा, तो देखिए दो तरह के क्वेश्चन इसमें आते हैं. एक mechanism of action that is going to be dihydrofolate reductase. अगर इस क्वेश्चन का था methotrexate in rheumatoid arthritis as anti-inflammatory, then the answer will be something else. So you guys have to let me know, was it anti-inflammatory या यही था mechanism of action of methotrexate. अगर methotrexate था, तो still remember that drug of choice, dihydrofolate reductase inhibitor is the correct answer. Female got pregnant and given stillbirth. ठीक है. अगर stillbirth दिया and you don't want lactation, तो still क्या देंगे? Bromocriptine, because bromocriptine is one of the dopamine agonist. ठीक है. In the management of the Salmonella typhi, patient is non-responsive to ciprofloxacin. Ciprofloxacin is oral drug that has been used in the past for the typhoid. Which of the following the next best? तो typhoid के लिए पूछा ना, तो ceftriaxone, that is one of the third generation cephalosporin. ये क्वेश्चन तो था ही, ये क्वेश्चन तो बहुत सारे बच्चों ने बोला सर ये क्वेश्चन केस बेस्ड सिनेरियो था. This was also one of the question for the typhoid. Again, we could not add the screenshot here. Again, सारे के सारे चीजें ली गई हैं. कुछ चीजें ऐप से हम स्क्रीनशॉट नहीं ले पाए because of time constraint. Rabbit syndrome is seen with which of the following? Again, this was actually image based question, और इस क्वेश्चन में भी काफी कंट्रोवर्सी बच्चों ने लेकर आया. 3-4 बच्चों से मैंने अलग से बात किया. तो what they said is rabbit syndrome का इमेज था with no trunk protrusion, if I am not wrong. बच्चा बोला कि सर ये वर्ड दिया हुआ था no trunk protrusion. तो बेसिकली दे वर एक्चुअली रैबिट सिंड्रोम लाइक फीचर था, रैबिट सिंड्रोम लाइक फीचर, rabbit syndrome like feature, no trunk protrusion. So they were actually talking about tardive dyskinesia. ये एक्चुअली टार्डिव डिस्काइनेशिया की बात कर रहे थे, टार्डिव डिस्काइनेशिया, और कौन सा ड्रग करेगा। तो आई ऑलवेज से दैट टार्डिव डिस्काइनेशिया एक्स्ट्रापिनोल सिम्पटम मोस्टली सीन विद योर टिपिकल्स, है ना, टिपिकल जो D2 ब्लॉकर होते हैं, इट इज मेनली कॉज्ड बाय D2 ब्लॉकर। लेकिन एक एटिपिकल में बड़ा रिस्की ड्रग है, उसको मैं बोलता हूं रिस्क पेरिडोन, रिस्क पेरिडोन नहीं, 2018 नीट पीजी क्वेश्चन है रिस्क पेरिडोन, और मैंने देखिए लिखा हुआ है, देखिए एक्स्ट्रा पिरामिडल सिम्टम मोस्टली सीन विद द मैक्सिमली एसोसिएटेड विद, क्या लिखा है, मैक्सिमली एसोसिएटेड विद टिपिकल्स, दैट इज हेलोपेरिडोल। एटिपिकल में कौन है, मैक्सिमम इन एटिपिकल इज गोइंग टू बी अ रिस्की ड्रग बाय द नेम ऑफ रिस्क पेरिडोन, है ना, लर्न फ्रॉम माय स्टाइल, बार बार बोलता हूं, रिस्की ड्रग है रिस्क पेरिडोन, करेक्ट आंसर इज गोइंग टू बी रिस्क पेरिडोन। क्लोजापिन के बारे में बोलता हूं कि ओवरऑल देखिए लीस्ट, अगर लीस्ट टिपिकल में देखा जाए तो थायोडाजिन क्लोरप्रोमाजिन टिपिकल में, एटिपिकल में नोट, राइट, ओवरऑल लिस्ट या नो एक्स्ट्रा पिरामिडल सिम्टम, ओवरऑल लिस्ट और नो एक्स्ट्रा पिरामिडल सिम्टम क्लोजापिन, तो क्लोजापिन तो एक्स्ट्रा पिरामिडल सिम्टम करता ही नहीं, राइट। अदर ऑप्शन जो भी थे, इसका करेक्ट आंसर रिस्पेरिडोन था, डू रिमेंबर दैट। हेलोपेरिडोल आई ट्राई टू आस्क, दे सेड कि नहीं सर हेलोपेरिडोल ऑप्शन में नहीं था, अगर हेलोपेरिडोल होता तो शायद वो सवाल वो जवाब सही होता, बट हेलोपेरिडोल वाज नॉट इन द ऑप्शन एज पर द स्टूडेंट्स, ठीक है। A drug is given orally to one person and IV to other person. Now this was a very typical question of general pharmacology. एक oral दिया गया, एक को IV दिया गया, and IV will have faster clearance. क्यों? Because जैसे ही आप IV drug देते हो, अगर आपने oral drug दिया, if you are going to give let's say the drug orally, then the drug will actually pass through the liver and liver के through ये जाएगा, first pass metabolism होगा and तब जाके वो circulation में आएगा. This is how it is going to be, right? This is how it is going to be. All right, it is going to be like this. But if you want to give directly IV, अगर आपने directly IV दे दिया, अगर आपने directly IV दे दिया, if you are going to give directly IV, तो most of the drug will be immediately available in the IV. Most of the drug will immediately act and ready for the metabolism. ठीक है, तो IV has less fast metabolism, इसीलिए IV का always faster clearance होगा, ठीक है, IV का always faster clearance होगा, oral and IV glucose, ठीक है, oral and IV glucose, so IV has less phosphorus metabolism, that is why IV will have faster clearance, ठीक है। A patient with primary open angle glaucoma, pilocarpine was given. Was it pilocarpine? Seriously, was it pilocarpine? What is the reason for giving pilocarpine in this one? See, pilocarpine का दोनों में दे सकते हैं, अब दोनों के अलग मैकेनिज्म है। एंगल क्लोजर ग्लोकोमा में they actually break the synapse, they break the adhesion, राइट, और सिनेकिए, दिस इज एंगल क्लोजर ग्लोकोमा में। और ओपन एंगल ग्लोकोमा की अगर बात करेंगे तो ओपन एंगल ग्लोकोमा में सी एंगल इज ऑलरेडी ओपन, इन द ओपन एंगल ग्लोकोमा दे एक्चुअली हैव शोन टू इंक्रीज द ट्रेबेकुलर आउटफ्लो। तो अगर ओपन एंगल ग्लोकोमा का केस था और ट्रेबेकुलर आउटफ्लो वाला ऑप्शन था, then you will go with the trabecular outflow. Correct answer is increasing the trabecular meshwork outflow. अगर पाइलोकार्पिन दिया गया है तो मियोटिक एजेंट तो पाइलोकार्पिन ही होता है, because phenylephrine dipivefrin is not meiotic agent. Dipivefrin, कई बच्चे बोले थे सर शायद dipivefrin था, no it was not dipivefrin because dipivefrin is not meiotic. अगर meiotic दिया गया है, राइट, meiotic दिया गया है और ओपन एंगल ग्लोकोमा है, तो अगेन दे इम्प्रोवाइज द ओपन एंगल ग्लोकोमा में इशू क्या है, इंट्राओक्युलर प्रेशर बढ़ा हुआ है, एंगल ओपन है फिर भी, तो हमें आउटफ्लो को बढ़ाना है, तो ट्रेबेकुलर आउटफ्लो को बढ़ाने वाला ड्रग है ये, ठीक है। एजेंट एडेड अलोंग विद द meiotic ड्रग, which agent? Pilocarpine was added. Pilocarpine itself is a meiotic agent. आप इसको प्लीज थोड़ा सा रिफ्रेम करिए, अगर आप इसको रिफ्रेम कर सकते हैं तो प्लीज रिफ्रेम करिए। नाउ दिस वाज अ क्वेश्चन जो कि यूजुअली लैब में कराया जाता है, इसीलिए बोला जाता है कि एमबीबीएस का सिलेबस ठीक से करना जरूरी, बिकॉज 2-3 क्वेश्चन आप एमबीबीएस के सिलेबस पे कर लेते हो। यूजुअली लैब का टॉपिक है, एमबीबीएस के लैब में पढ़ाया जाता है कि पेशेंट को आस्मा है, इनहेलर के साथ एक स्पेसर दिया गया, एंड व्हाट इज द पर्पस ऑफ एडिंग स्पेसर, दिस इज द स्पेसर। स्पेसर वी एड मेनली फॉर मल्टीपल रीजन, एक तो पीडियाट्रिक पॉपुलेशन में ड्यू टू इनकोऑर्डिनेटेड ब्रीदिंग, एल्डरली में दोज वर नॉट एबल टू अंडरस्टैंड, एंड आल्सो टू रिड्यूस द रिस्क ऑफ कैंडिडियासिस, टू प्रिवेंट द कैंडिडियासिस, बिकॉज डायरेक्टली ये जाके स्टिक नहीं करता आपके फेरिंग्स में, द ड्रग विल एक्चुअली बी स्टेइंग हियर इन द स्पेसर वाले एरिया, यहाँ पे ड्रग रहेगा एंड द पेशेंट विल बी ब्रीदिंग आराम से, राइट। इट विल नॉट इम्प्रोवाइज द एब्जॉर्प्शन, एब्जॉर्प्शन बढ़ाने के लिए अदर फार्माकोकाइनेटिक प्रॉपर्टी ऑफ द ड्रग को बढ़ाना पड़ेगा, राइट। तो टू प्रिवेंट या टू रिड्यूस द रिस्क ऑफ कैंडिडियासिस, दैट कुड बी द करेक्ट ऑप्शन गिवन द ऑप्शन दैट वी हैव। कोई ऑप्शन करेक्ट नहीं है, किसमें कोई ऑप्शन करेक्ट नहीं है? इसमें एट्रोपिन वाज इन ऑप्शन। दिस वाज अगेन स्क्रीनशॉट फ्रॉम द क्लास। मैंने बताया था कि हम देते हैं और इसके साथ में भी स्पेसर ऐड करते हैं, मेनली इन द पीडियाट्रिक एल्डरली पॉपुलेशन हु आर नॉट एबल टू अंडरस्टैंड। अगेन स्क्रीनशॉट ऑफ की लेक्चर का है। एट्रोपिन आप ओपन एंगल ग्लोकोमा में क्यों दोगे? एट्रोपिन इज वन ऑफ द माइड्रेटिक एजेंट, एट्रोपिन क्यों देंगे ओपन एंगल ग्लोकोमा में? अगर एट्रोपिन ऑप्शन में था, कौन से क्वेश्चन की अब बात कर रहे हैं आप लोग? एट्रोपिन, इन विच क्वेश्चन एट्रोपिन वाज देयर? ट्रेबेकुलर मेशवर्क, एट्रोपिन किस क्वेश्चन में था? एट्रोपिन इज नॉट समथिंग that is used in atropine is not something that is used in glaucoma. ड्रग ऑफ चॉइस पैरोक्सिस्मल नॉक्टर्नल ग्लोबिन्यूरिया, पीएनएस के लिए ड्रग ऑफ चॉइस। तो मैंने बताया था इसमें मोनोक्लोनल एंटीबॉडी अगेंस्ट कॉम्प्लीमेंट 5 बढ़े रहते हैं, तो कॉम्प्लीमेंट 5 सी इज द फिफ्थ लेटर एंड ई इज आल्सो द फिफ्थ लेटर। तो इक्विलिजुमाब अ मोनोक्लोनल एंटीबॉडी दैट वाज आस्क्ड एंड स्क्रीनशॉट आपके लेक्चर का यहाँ पे अवेलेबल। इक्विलिजुमाब, रावुलिजुमाब। स्पेसर वाले में ओके, स्पेसर वाज एडेड टू प्रिवेंट कैंडिडियासिस। एट्रोपिन वाला फिर आप कहां फिट करोगे कि पेशेंट इज ऑलरेडी टेकिंग एट्रोपिन? एट्रोपिन इज अ नॉन सेलेक्टिव मस्कुलिनिक एंटागनिस्ट। ये क्वेश्चन नीट पीजी 2024 का डायरेक्ट टू द पॉइंट क्वेश्चन है। पेशेंट मेटफॉर्मिन और इंसुलिन ले रहा है, नॉन अनकंट्रोल्ड डायबिटीज है, HbA1c 8.2 है, और एग्जाम से जस्ट 2 दिन पहले जो मैंने यूट्यूब पे सेशन लिया था एज इट इज सेम क्वेश्चन है ना, उसका इजेक्शन फ्रैक्शन का भी जिक्र हुआ था, इजेक्शन फ्रैक्शन भी कम है, HbA1c भी बढ़ा हुआ है, which is the next best. So in that case scenario, देखिए the cardioprotective agent that we are going to utilize because ejection fraction की बात हो रही है, that is going to be one of the SGLT2 inhibitors. तो कुछ क्वेश्चंस ऐसे थे जो डायरेक्टली आपके नीट पीजी वाले एज इट इज उठा के चले आए थे। एट्रोपिन वाले जो ड्रग थे, प्लीज सेंड मी इफ यू कैन। Furosemide was given to a patient. Now this is integrated with ENT. दिस इज गोइंग टू बी इंटीग्रेटेड विद ईएनटी, ईएनटी के साथ ये इंटीग्रेटेड है। फ्यूरोसमाइड दिया गया, तो मेनली क्या करता है, तो फ्यूरोसमाइड मेनली इज अ ड्रग दैट इज गोइंग टू कॉज डैमेज ऑफ द हेयर सेल्स एंड बिकॉज ऑफ दैट दे आर गोइंग टू बी एसोसिएटेड विद ऑटोटॉक्सिटी। तो ऑटोटॉक्सिक ड्रग है फ्यूरोसमाइड, इज वन ऑफ द लूप डायरेक्टिव। इसीलिए किसी भी अदर ड्रग्स जो ऑटोटॉक्सिक है लाइक अमाइनोग्लाइकोसाइड सिस्प्लेटिन के साथ नहीं देंगे, एंड दैट इज द नेक्स्ट पोटेंशियल एमसीक्यू। एंटी कैंसर ड्रग वाला क्लासिफिकेशन बहुत सारे बच्चों ने बोला कुछ आया था, याद नहीं है, कुछ बच्चों ने बोला आया था। सो दिस इज एवरीथिंग, क्विकली 1 मिनट का क्विक रिकैप हम करेंगे। ऑटोटॉक्सिक ड्रग फ्यूरोसमाइड कॉजिंग डैमेज टू द हेयर सेल, डायबिटिक पेशेंट एज इट इज क्वेश्चन, ये लाइन बाय लाइन क्वेश्चन है आपके नीट पीजी 2025 का। मैंने एग्जाम से 2 दिन पहले जो लिया था एज इट इज ये आपको दिख जाएगा। PNS इक्विलिजुमाब, राइट, देन स्पेसर वी आर एडिंग मेनली टू प्रिवेंट द रिड्यूस द रिस्क ऑफ कैंडिडियासिस। A patient primary open angle glaucoma, अगर हम पाइलोकार्पिन दे रहे हैं या मायोटिक एजेंट दे रहे हैं इन ओपन एंगल ग्लोकोमा, तो आवर पर्पस इज मेनली टू इम्प्रोवाइज द ट्रेबेकुलर आउटफ्लो, और IV has a lesser first pass metabolism, therefore it will have faster clearance. Risperidone is a very risky drug. Among the atypical, they are the one that is mainly associated with the extrapyramidal symptom like tardive dyskinesia. In the management of the Salmonella typhi, if it is non-responsive to Cipro, we can go with the ceftriaxone, methotrexate, dihydrofolate, and you guys are saying this is not us, so I'm putting a question mark on this one. Which drug reduces the lactation? That is bromocriptine. First symptom in opioid, that is going to be meiosis. Further, it can lead to pinpoint pupil. QT prolongation अगर था तो QT prolongation will be the correct one. अगर flat T wave नहीं था, still then QT prolongation will be the correct answer. Which of the following the first symptom opioid हो गया? Patient with history of peripheral neuropathy, pregabalin का mechanism of action, that is going to be N-type calcium channel blocker, and gout वाले में immediate management के लिए NSAID like indomethacin और chemotaxis inhibitor colchicine। 2 क्वेश्चन डायरेक्टली आपके और स्क्रीनशॉट अटैच है क्लास के यहाँ पे। NMD एंटागोनिस्ट मेमेंटिन यूटिलाइज्ड इन अल्जाइमर्स। Alcoholic patient again de-addiction therapy पे है, disulfiram is something that could cause all this symptom, and these hyperkalemia will be associated with all the RAS system inhibitor. Okay, CML का ड्रग ऑफ चॉइस इमार्टिनिब, एंड माइक्रोफिनोलेट मोफेटिल, अगेन दिस इज अ क्वेश्चनेबल मार्क, तो मैंने इसमें बोला इसको वी नीड टू रिफाइन इट। इंटरल्यूकिन 2 वाला क्वेश्चन अलग था या इट इज इंक्लूडेड विद दिस वन, सो वी नीड टू वर्क ऑन दिस क्वेश्चन बिकॉज ये काफी थोड़ा सा आप लोग भी रिकॉल करने में टाइम लगाओगे, अगर ठीक से रिकॉल करोगे तो वी कैन डिस्कस ऑन दिस वन। बट अगेन अगर ये क्वेश्चन एज इट इज था, डजंट एक्ट बाय कैल्सिनिन, तो माइक्रोफिनोलेट मोफेटिल, देयर इज अ डीएनए सिंथेसिस इनहिबिटर। Dapsone में do not stop multi-drug therapy, continue the continue anti-drug therapy, multi-drug therapy, and give steroid. Lamotrigine, carbamazepine, phenytoin, they are rash-causing drugs. Remember that. Valproate can be continued. Malaria में artemisinin and combination therapy plus lumefantrine. इम्फाल है तो नॉर्थ ईस्ट स्टेट से पेशेंट आया हुआ है, तो इसमें 3 दिन के लिए ये देंगे, और ऑन डे 2 को विल बी गिविंग प्राइमाक्वीन एज वेल। ठीक है, finasteride 5-alpha reductase inhibitor, right? So this is everything about pharmacology which I quickly wanted to discuss for all of you guys. So we took around 20-25 minutes to cover all the 24-25 question that was asked. There are many other question. अगर आप लोग उस question को जैसे याद आए, you guys can search for me in any of the social media platform. You can message me. We can definitely work it out. We can definitely discuss and we can see the possibility कि question actually में कैसा था. ठीक है? You continue with your next subject का revision and do not panic at all, because as I told you, this is a first hand question. There are a lot of changes that are possible in the question. लेकिन अगर आपको अपना question याद है, इसमें से जो मिल रहा है आप उसको कंटिन्यू कर सकते हैं, काउंट कर सकते हैं अपने लिए। ठीक है, एसिटाजोलामाइड का क्वेश्चन जो भी था आप मुझे एक बार भेज दीजिएगा। ठीक है, यू विल कंटिन्यू विद द अदर वन, डॉक्टर कामिल खान। एसिटाजोलामाइड का स्पेलिंग सही कर लीजिएगा। ठीक है, चलो बाय बाय टू ऑल ऑफ यू गाइस, एंजॉय योर नेक्स्ट डिस्कशन। थैंक यू।
Hello, my dear friend. A very warm welcome to all of you. In this recall session, let's start with our first question. In the first question, they had given that prevalence. Okay. So, in the first question, they have given that prevalence of disease is 30%. And according to the rule of half, what proportion of patients are aware of their condition? So, in the rule of half, the first line is for the disease population. And in this question, it is given that disease population is 30%. So this information is given, disease population 30%. Now, half of 30% are aware patient. जितने लोग बीमार है उसके आधे को पता है. So if total disease is 30%, half of 30% is 15%. जितने लोग बीमार होते हैं आधे को पता होता है, उसमें से आधे जांच कराने जाते हैं, और जांच कराने के बाद बीमारी पता चलने के बाद भी इलाज आधे ही शुरू करते हैं, और जो इलाज शुरू भी करते हैं उसमें से आधे ही सही होते हैं. तो ये क्योंकि रूल ऑफ हाफ है तो 30 का आप हाफ ही खोजोगे, कोई भी क्वार्टर है भी नहीं, 7.5 ऑप्शन में भी नहीं है, तो अगर ऐसे भी है तो बना सकते थे. बट याद रखना, डिजीज पॉपुलेशन इफ देयर इज 30%, then half of them are aware about their condition, and half of 30% is 15%. So 15% are aware, and the people who are aware, half of them are on treatment. So on treatment there should be 7.5%, and half of it are adequately treated. Finally, this is the last half adequate treated, so it will be half of 7.5, like 3.75%. Okay, so I think you must have been confused in this question, but now you understand it. Some question, if you know the correct option, kindly suggest. Of course, it is a recall based on memory of 2 sessions, and it's not going to be accurate. So if you know the option, please tell me the correct option, dear, if you have some correct option. Now, Pearl index, what is the use of Pearl index? Or there was a numerical. Some students said there was a numerical, some students said it was conceptual question. So definitely Pearl index is effectiveness of contraceptive method. If you look at the Park textbook, in the Park textbook, they have written it in the first line that Pearl index tell about contraceptive efficacy, ki how useful is condom or OCP or ICD and all. And how we calculate Pearl index, we write the accidental pregnancy by total month of exposure. In the month of exposure, there is number of female who is taking that contraceptive and total month of use. So most commonly the numerical which they gave, they put 10 pregnancy, and they put 100 female who are consuming it, and the month of use they put 2 year. So 2 year means 48, and because we multiply it with 1200, So this 0, 0 and this 1200 0, 0 will cancel out, and 12 will cut 48 by 4. So finally 2 into 4 is 8, and a total 48 month. So 48 it will come by 4. So finally we have 4 in the denominator and 10 in the numerator. And it was 2 years. So 2 years of 48 months. So 12 will cut 48 by 4. So 10 by 4 it will come out 2.5 if they give this data. But if it is theoretical question, definitely Pearl index deal with contraceptive efficacy. So there was no doubt about it. Do let me know what was the correct answer. This question which you are saying 4 get pregnant, 6 get pregnant is also the next question. They are saying कि 500 women were followed for 6 months and 4 pregnancy occurred. But is the answer in a numerical form, or was the answer option where like this incidence rate, attack rate, Pearl index, or gross reproduction rate? Because if they are talking like this, that 500 women used a contraceptive or OCP, and after using contraceptive, they are followed. So then it is telling us contraceptive failure rate, and contraceptive efficacy is told by Pearl index. If they have used the word contraceptive, then this is the definition of Pearl index. If not, it can also be definition of incidence rate, because incidence rate also tell about total new case which occurred, like here total new case were 4, total person who are affected 500 female, and time in year is 6 months, so half year. So it can be definition of incidence rate if contraceptive is not written. If contraceptive is written, then it will be Pearl index. But was it the calculation? Okay, this was the for the calculation. So if you have to calculate this data, let's calculate this data on our data, on our formula of Pearl index. What was the total number of accidental pregnancy? 4 accidental pregnancy. What was the total month of exposure? 6 months of exposure. And how many female were followed? 500 female were followed. So let's write it down in a fresh page. Accidental pregnancy were 4. Female who were there were 500. And total month of exposure was 6 months. And then we multiply it by 1200. So this will give us the Pearl index. Some of you have already done the calculation, but let's do it here again. This 500, 20 and this 20 will cancel out, and the 6 will cut 12 by 2. So we will have 4 into 2 by 5. That means 8 by 5. And 8 by 5 will be 1.6, which is being correctly calculated by my dear friend Reddy, then Vizu. Acha, Vizu is also here telling me it was calculation. Okay. Do suggest me the correct option and correct questions. If you can make some correction in my recall, most welcome. Agni Mane is also correct. Many students are correctly finding it 1.6 if this is the calculation. Chalo. So next question. A person call people and ask about exercise habit. Do you do exercise and not? And cardiovascular disease status at one point of time. So whenever they talk about one point of time, they are doing the study in present moment, and that is cross-sectional study. And this activity which they are doing here was the same activity which was also done in Monica project, which is for monitoring trend and determinant of cardiovascular disease. Basically, it was some lover of Monica. He took Moni from here and Ka from here and made it Monica. And in this also, people were asked similarly that do you do exercise, do you have cardiovascular disease? So all the survey which we do in people, those survey are cross-sectional study. And here also they are talking about survey. And I hope you understand this concept also, that whenever we talk about at present moment, this is cross-sectional study. And it is done at one time, like in this question. If you go in past history, it will become case control study, which is effect to cause, where one group is disease, one group is without disease. And if you go in future, it will become cohort, cause to effect, which start with risk factor present absent. So because they have written at one time, it was definitely cross-sectional study. I hope there is no confusion in this question. Chalo. Now, next question is, which statistical test is most appropriate for comparing cholesterol level within the same group? So first thing is, same group, that means there is one group, and unpaired t-test is for 2 group, ANOVA is for 3 or more group, chi-square test is for 2 or more group. So only one test out of the 4 is what we do for one group. One group can be paired t-test or it can be sign test. And a sign test is also for one group when it is qualitative data. But because they have not used the qualitative data is like which can only be categorized. जैसे सारी बीमारियां qualitative data है, diabetes is qualitative, hypertension is qualitative, those are qualitative data. So if it is qualitative data in percentage proportion about disease and one group, then answer will be sign test. But if it is measurable data, like cholesterol we can measure, so measurable data and one group, answer will be paired t-test. I hope this is one concept we have discussed in class again and again, that if it is qualitative data like hypertension, obesity and any other disease, and 2 or more group, then we have chi-square test, one group sign test. And if it is quantitative data like cholesterol and they have used the word pre-post test, before after test from the same group, it is definitely paired t-test or dependent t-test. If there is 2 group unpaired t-test or student 2 test, which we also call as independent, and 3 group or more ANOVA. So why we call it paired t-test? Because suppose you try to make me slim, and suppose you want to see me as Noora Fateh or someone. So you gave me some anti-obesity drug and you measured my weight before giving drug and after giving drug. So you are comparing both the data from the same person. That's why both these data are paired. Both these data are dependent. So whenever there is one group and we are taking the data before and after, it is paired or dependent t-test. Okay, like in this question. I hope it is clear. If not, please do write. Next question is, in an ideal consultation group setup, what is the window? How the window should act? So do tell me what was the option, because the option were not so clear. But the window in an ideal consultation room should be one-way mirror. One-way mirror is something which you must have seen in many of the James Bond movies and all interrogation movie, where police or someone is or some researcher is standing this side and they can see the inside from their side. So that kind of mirror is one-way mirror. You can see, but the other part cannot see. And this window should be having this one-way mirror, so that light should come and fall on the face of the patient, so that doctor can see the patient well. So the window should also always be on the back side of the doctor, because if window is on the back side, exposure of light will be proper on the patient. But if window is facing the patient, then it can leak the privacy of patient. So that is why this window should be one-way mirror, that patient can see what is going outside, so that he feel that the room is open and he will not feel claustrophobic. He can see what is going outside, but outside people cannot see the patient. Only light can come inside, but they cannot see what is going inside. So this type of mirror is the ideal, should be in the ideal consultation room. It should be one-way mirror. It is a privacy window. There is a window, but still there is a privacy, because patient is standing outside, people standing outside cannot see what is going inside. So light will also come and it will act as a privacy window. So this should be in the option. But if this is not in the option, then we can choose this as noise barrier, because it is a source of light, but not only source of light. There are multiple role of window. One role of window is maintaining privacy. One way of window is stopping noise. One role of window is source of light. So it multiple role, but if it is out of 4 option, noise barrier can be ticked, because there is only option here. If only is not there, then of course source of light will also be correct, because window has multiple role. So do tell me, my friend, what was in the option. Okay, so the question, Dr. Duty is saying, Devi Roy is saying, the patient was TB positive, there is window and door, what should be the position of doctor and patient? Yes, that's what I got from many of the students. What should be the position of doctor and patient? So remember, doctor window should be on the back side of doctor, because if window is on the back side, light will fall on patient face and doctor will be able to see the patient much better, more clear. So this should be the sitting arrangement. Patient, doctor and window should be on the back of the doctor. Okay. Okay, so window and respect to door. I hope it is clear. But if it is not yet clear, then I will try to find some guidelines on this regard, and maybe I will come back in the main recall session with some detailed guideline on this topic. Okay. Chalo, next question is कि the appropriate biomedical waste disposal method for parenteral feeding package. Parenteral means IV line, IV cannula. So when we are feeding in IV line, we will use the plastic bag, which is RL or NS. We will have the plastic tube, syringes without needle, and the gloves. And all of these things go in red color. So if it is parenteral feeding package or if it is PPE kit, that PPE kit or parenteral feeding package both goes in red bag where all the plastic goes. Okay. Next question is about pap smear, and then some students say that there was also a question on BP measurement in health fair. So no matter which screening test we are doing, all screening tests are done on any population for only one purpose, to make an early diagnosis. Suppose I am measuring BP of a 10-year-old kid also. The purpose is to diagnose BP early, because a 10-year-old kid can also have a horseshoe kidney or nephrotic syndrome or some other reason of high BP. So no matter whose screening test we are doing, where we are doing the screening test, all screening tests are done for early diagnosis, so they are secondary prevention. So this pap smear will always be secondary prevention. Okay. Of course, you know, primordial is before appearance of risk factor, primary is when risk factor is there, and tertiary is rehabilitation or disability limitation. So they cannot be the answer of a screening test. This question was that 40 children need vaccination in 2 hours with 2 ANM available. What should be the most appropriate strategy? First thing, we can never cancel the session. Second thing, we cannot decrease beneficiary, because if you say that today 40, no, only 20 will come, maybe that remaining 20 will never come. So we cannot say no to anyone. It is written in PARC, never say no to anyone who came without immunization card, also give them vaccine. So don't say no and don't cancel. This cannot be there. Now, pre-open vaccine vial is contraindicated by multiple way, because if you open the vaccine vial before giving it, the potency can be affected, efficacy can be affected, and adverse effect can occur. Like if you kept measles vaccine open for more than even 1 hour, but they say ideally more than 4 hours, then anaphylactic reaction can occur in the patient, and patient can die because you have opened it earlier. So opening it earlier is never a option. Only one thing we can do, we can extend the session, of course. We can take more time to do the session in a better way. But other than this, also they suggest some other guideline that one nurse should be in the vaccination injection part, other should be maintaining record, giving the diluent, mixing the diluent, and other work should be done by that. So in that way, they can do this work in 2 hours also, but it's better to extend the time if that is the option. Okay. Chalo, thank you so much. Now, next question is, if you know, one of the option was keep one person for vaccination and only one for recording. Yes, this is the correct answer. If this is the option, that keep one person, that's what I was saying in the guideline of Government of India also, that if there is 2 person for managing, keep one person for vaccination who will give vaccine, and other for this other for recording. Why recording? You will say, sir, what is recording? Why recording is so important? Because when we record many things. We are recording all the adverse effect, if any adverse effect occur. We are also recording all the names of the kid. We are also recording past history of vaccination, and we are deciding which vaccine has to be given, which vaccine we are deciding. And after deciding which vaccine, this recording person will keep diluent plus vaccine separately. Diluent plus vaccines he will keep separately, and now vaccinator has just to keep giving it. No other paperwork she need to do. So she can do it like this for 1 hour, and after 1 hour they can exchange the duty, and they both can do. So this is the actual ideal guideline, first point in the national guideline, to maintain if there is a staff shortage, that one should go for vaccination and other for recording. If that is the option according to Duty Devi Roy, then it is definitely the correct. Okay, 1 ANM for vaccination, 1 ANM for recording. This is the correct answer. Undoubtedly, this is the correct answer. Okay. Next question was, this logo was given, some people were saying, and based on this logo, they asked, what is this? So this was older logo of Health and Wellness Center. This was an old name. Actually, first of all, there was Sub-Center and PSC. It was replaced by the name Health and Wellness Center. Then the government said, if we change Health and Wellness Center into Arogya Mandir, this will add the word Mandir and it will help us in political propaganda also. So they added Mandir, and now Health and Wellness Center is known as Ayushman Arogya Mandir, and there is an app also, which when I Google this word, there is an app also which I downloaded on my phone also. So do remember, if you have to choose the name of the program which is newly changed and which is there. So the newly changed program name is Arogya Mandir, Ayushman Arogya Mandir. This is the new name of Health and Wellness Center. So if any option have Arogya Mandir, definitely that is going to be the correct answer. Okay. Yes, one should do documentation and one should do vaccination is the correct answer for that ANM work, undoubtedly. And this was the question which I was able to recall. Our team was able to recall and help me here. And if you have more question, feel free to share it on my WhatsApp so that I can collect it and discuss it with you. You can also share all your questions and suggestion on PW Meded app and Telegram group, and let me know how I can do better, how I can help you better. Okay, thank you so much. Bye bye. Enjoy your time, and till result, do good party. Okay, bye bye. Thank you so much. Dasvidanya. Bye bye. Over to you, ma'am. Next, sir or ma'am, whoever. Sir is there. Bye, sir. Thank you.
Hi, hello. Hello. Thank you, Dr. Ashwini. Thank you. So, hello, students. Let us begin. Anatomy was good. Yes, straightforward सवाल थे anatomy के, straightforward questions. Let us start. We'll finish it off fast. Straightforward questions. I am sure that you must have answered everything. ठीक है? चलो, let us start. I'm audible now to all of you. Let us start with the first MCQ. I'm sure this must have been discussed. Chest X-ray shows a boot-shaped structured heart. What is the most likely clinical condition? क्या है ये? इसका answer? Transposition of gray. This is phallic cetrology. Yes, phallic cetrology. The boot-shaped heart. This we have been discussing. Pulmonary stenosis, right ventricular hypertrophy, interventricular septal defect, and the overriding of aorta. ठीक है? So the first question, clear है ना? Phallic cetrology. Coming to the next, ansa cervicalis का एक image था. Yes, there was an image of ansa cervicalis. It supplies all the following muscles except. Answer this. Ansa cervicalis, we have been discussing this in the classroom also. It lies on the carotid sheath. U-shaped loop है. This ansa cervicalis supplies all the strap muscles except. क्या लिखा है बच्चों? What have you written? Yes, what was the answer for this? It supplies all the strap muscles except thyrohyoid. Thyroid is supplied by C1 through the hypoglossal nerve. Okay, thyroid is supplied by C1. Fine. So this also we have discussed in the lectures. ठीक है ना? ये तो सबने लिखा ही होगा. This is very easy. So answer for that is thyroid supplies all the strap muscles. Right? This was the visual. Okay. Coming to the next MCQ, fracture of the medial epicondyle of humerus is most associated with injury to which nerve? Yes, बोलो. ये भी बहुत easy था. I'm sure you must have answered this. That's the ulnar nerve. The ulnar nerve pierces the medial intermuscular septum along with the superior ulnar collateral artery, and then it goes to lie behind the medial epicondyle. And this nerve is injured, is damaged behind the medial epicondyle. ठीक है ना? I'm not able to see you all. One moment. हाँ. Fine. हाँ. Digastric बाद में देखते हैं. Digastric we'll see later. एक मिनट. Digastric का सवाल बाद में देखते हैं. Fine. So what is the answer for this? Fracture of medial epicondyle. The nerve injured is ulnar nerve. बहुत easy सवाल था. I'm sure you must have answered this. Neck of the humerus भी है बच्चे. Neck of the humerus भी है. Wait no. Coming to the next, the artery highlighted in the given heart diagram. Identify the artery. Yes, this this was the highlighted artery. ये highlighted artery था, ये भी हमने discuss किया है lectures में. This is the artery which is highlighted. Yes, what is this? इसका answer क्या लिखा है? क्या लिखा है ये? The groove is anterior. हाँ, groove कौन सा है ये? The groove is anterior interventricular groove, and the artery which lies in the anterior interventricular groove is, बोलो बच्चों, what is the name of the artery? It's the anterior interventricular branch of left coronary artery, right? Very good. So it is anterior interventricular artery, also known as LAD. LAD. Simple सवाल था. I'm sure you all must have answered this. Anterior interventricular branch of left coronary, left anterior descending. Very good. Very good. तो ये भी हमने discuss किया है lectures में. Fine. Okay. Simple, straightforward MCQs है. A patient presented with numbness near the chin and the lower lip. Chin and the lower lip, which is the nerve involved. बोल सकते हो? What have you written? Patient presented with numbness near the chin and the lower lip. Have a look at this. Who supplies the skin here? This also we have discussed during the lectures. The skin of the lower lip and the chin. Sensory nerve supply पूछा है. Sensory nerve supply. Motor नहीं है. It's a sensory nerve supply, which is the nerve which supplies the हाँ, yes, क्या लिखा है? बोलो. Arrow pointed. हाँ, very good. So that's a mental nerve. Mental nerve. Mental nerve. Options were mental nerve. Answer is mental nerve. अगर angle of the mandible है तो great auricular nerve है. Okay, skin over the angle of mandible, that's great auricular nerve. Skin on the chin and the lower lip, that is mental nerve, right? Mental nerve. हाँ, वो trigeminal की branch है ना? Trigeminal की branch है. Mandibular division की branch inferior alveolar का continuation is the mental nerve. ठीक है, trigeminal nerve है तो that's fine. So अगर trigeminal nerve है ना, अगर trigeminal nerve है तो trigeminal की mandibular nerve की ये branch है. This branch is the inferior alveolar, and the same inferior alveolar nerve enters and comes out from here. That's the mental nerve. हाँ, okay, fine. Okay, that's fine. जो भी है देख लो, बाद में will come up with the questions. The muscle shown produces abduction of fingers. What is this? Answer this. ये बोलो. This you must have answered. Abduction of fingers is done by whom? Abduction of fingers. What are these muscles between the bones on the dorsal aspect? That's a dorsal interossei. This are the dorsal interossei. Palmar interossei causes adduction of fingers. This are the dorsal interossei जो bipinnate muscles होते हैं. हाँ प्रिंस, थैंक यू. थैंक यू. सो डॉर्सल इंट्रोशा है. ठीक है, abduction of fingers, dorsal interossei. Very good. Okay, have a look at this. Posterior dislocation of the hip bone following dashboard injury. Dashboard injury हो गया, posterior dislocation हो गया hip bone का. So the hip bone will come backwards. The big nerve behind is the sciatic nerve. The sciatic nerve gets injured. Sciatic nerve gets injured. ठीक है. So answer for this is sciatic nerve. Posterior dislocation. The answer for this would be sciatic nerve, the thick nerve which emerges below the piriformis and which is injured because of the backwards movement of the hip bone. Okay, that's a sciatic nerve. ठीक है, लिखा है ना ये सब? Yes, बच्चों. Very good. Very good. Answer for this is sciatic nerve. Sciatic nerve. Fine. Coming to the next MCQ, X-ray shown which nerve is most likely injured. चलो बोलो बच्चों fast. This is fracture of the neck of the humerus. Fracture of the neck of the humerus. चलो मैं भी एक डायग्राम ड्रॉ ही कर लेता हूँ. हाँ चलो fast you tell me. This is the scapula. इसका slide है ना? Okay, I couldn't get the slide. ये humerus है. चलो fast you tell me what is this muscle here? This muscle. ये है long head of triceps. Long head of triceps. ये कौन है? What is this muscle? This is teres minor, and this muscle is teres major. Teres minor, teres major. Fine. Okay, so we get three spaces here. बोलो बच्चों, what is this space? Upper triangular space. ये है lower triangular space. ये है quadrangular space. Quadrangular space में एक nerve होती है which winds around the neck of the humerus along with an artery. The nerve is axillary nerve. The artery is posterior circumflex humeral artery. Right. So axillary nerve passes through the quadrangular space, winds around the surgical neck of the humerus. So agar there's a fracture of the neck of the humerus, which nerve is damaged? Axillary nerve. Simple. ठीक है ना? So इसका आंसर क्या लिखा आपने? Axillary nerve. Perfect. Straightforward, simple MCQs है. Regimen batch sign. Very good. A deltoid teres minor and regimen batch sign. Very good. Very good. Chalo, coming to the next question. Varicose veins involving the medial side of the leg are due to incompetence of which vein? अभी ये तो बहुत ही easy है. Which is the vein on the medial aspect of the leg, which begins from the medial end of the dorsal venous arch. कौन सी vein है ये? ये भी हमने डिस्कस किया लेक्चर्स के दरमियान. Yeah, what is this vein? That's a great saphenous vein. Great saphenous vein begins from the medial end of the dorsal venous arch. ये medial malleolus के आगे होती है and then it comes to the leg, right? So it is due to competency of the great saphenous vein. So which vein? Great saphenous. Lateral side पे है तो short saphenous vein. ठीक है ना? Very good, very good. बहुत अच्छे. चलो. Next, a constriction is seen at 40 centimeters from incisors during endoscopy. What is the cause? So we know constrictions of the esophagus. The first constriction is 15 centimeters, cricopharyngeal junction. दूसरा होता है 25 centimeters, crossing of the aortic arch. 28 centimeters, that T6 vertebral level, crossing of the left bronchus. And finally, pierces the diaphragm. That's 40 centimeters. That's at T10, 40 centimeters, right? So what is the answer for this? Opening of diaphragm. 40 centimeters है. The esophagus, where it enters into the diaphragm, the constriction there, that's at 40 centimeters. सबने लिखा है? ये भी easy था. Arch of aorta T4, bronchus T6, pharyngoesophageal junction C6, and ये fine T10. So answer for this is esophagus. Answer for this is opening in the diaphragm. ठीक है. Okay, coming to the next MCQ. Identify the marked structure in the mid-sagittal section of the brain. बच्चों आंसर कर सकते हो. ये भी हमने देखा है during the lectures. That's a section and this is the one which is marked. ये marked था. What is that? क्या लिखा है बच्चों? क्या लिखा है आपने? What have you written there? The same, you know, I showed you we are taking a section here. Same section हमने यहाँ पे देखा था. That is the corpus callosum. That's the corpus callosum. तो इसका आंसर क्या था? This was pointed. The answer for this is corpus callosum. Perfect. Very good. Very good. So identify the mark structure. Answer for this is corpus callosum. अगर अच्छे से मतलब अगर concept clear है तो everything in anatomy would be correct. ठीक है? Fine. And एक last सवाल था ये the triangle here. हाँ कोई बोल रहा था ना अभी यहाँ पे एक triangle था which is formed by the anterior belly of digastric, posterior belly of digastric. Anterior belly of digastric, the midline of the neck and the hyoid bone. Anterior belly of digastric, the midline of the neck and the hyoid bone. What is that triangle? एक मिनट. Medial varicose veins. अरे बच्चे क्या बोलो? The question sir, it was medial varicose veins. But medial वो great saphenous vein ही है. Great saphenous vein ही है. Great saphenous vein ही है वो answer उसका. So what is the answer for this? This is the submental triangle that's below the chin. Submental triangle कैसे बनता है? Midline of the neck, anterior belly of digastric, and the hyoid bone. Hyoid bone, है ना? So I hope everything, most क्या? All the questions you must have been able to answer. सब कुछ तो notes से ही था. Everything was there from the notes. I hope you've answered everything. That's for anatomy. Okay. Thank you so much. Thank you to all of you. Let us start with the next session. Hello, madam. I finished
Hello,
it.
sir. Hello.
Chalo, bye-bye.
Bye-bye. So, hi, bachon. Let us start with Ophthal. So, Ophthal शुरू करते हैं and I know how tired and exhausted you are. मतलब even though I have not given the exam, I am already exhausted. तो तुम लोग कितने exhausted हो मुझे समझ में आ रहा है. I'll just quickly run you through the Ophthal questions. Ophthal जब पहले बच्चों से पूछा तो they recalled like 5 to 6 questions which were like easy. But उसके बाद जो questions आए हैं, some of the questions are a little on the more difficult side. So quickly run through करते हैं. So this is the first question that I got, where this picture was given. This picture, all of you know, this is a picture of Munson sign. And what exactly was the question, I do not know, but the question said that there is a patient who is presenting with these clinical signs, which suggests that the patient is having keratoconus. अब इसमें पूछा गया था that what is the investigation of choice or how would you confirm the diagnosis. So basically, instead of directly asking that what is the investigation for keratoconus, investigation of choice for keratoconus, they had given a picture of Munson sign and then they had asked what is the investigation of choice. Correct? यही था ना question? Yes. So the investigation of choice for this is corneal topography. So whatever the other options were, it actually does not matter क्योंकि इसका आंसर है corneal topography. So I hope that corneal topography was there and that is what you have marked. क्योंकि this is actually a one liner which we discuss. उन्होंने उसको one liner के तरीके से दिया नहीं है, वो अलग बात है. Right? They have given it in the form of Munson sign and a clinical case of keratoconus, and then they have asked what is the investigation of choice. So this is the first question. It was one of the easier ones. Then there was this picture. Obviously, this is a picture of a dendritic ulcer. This is a picture of dendritic ulcer, which is caused by herpes simplex virus, right? So this is a picture of HSV keratitis. And what kind of HSV keratitis? This is a type of epithelial keratitis. And epithelial keratitis is caused by direct invasion of the epithelium by the virus and active viral replication. So this kind of a keratitis is caused by an actively replicating virus. So इसमें शायद पूछा गया था that what is the drug of choice या what is the treatment, correct? Yeah, what is the treatment? Yes. Now the only thing is, I don't know why some students are saying that इसमें pain mention किया गया था. Usually कैसा होता है कि viral keratitis is typically a painless ulcer because of a decrease in corneal sensation. Generally उसमें pain नहीं होता है. The presentation should be with foreign body sensation, irritation and photophobia. But अगर pain mention था भी, but if this is the picture where you can clearly see a fluorescein stained lesion which is examined under cobalt blue filter और उसमें ऐसे dividing branches हैं, तो ये HSV ही है बच्चों. I don't know why कुछ बच्चों को इसमें confusion हुआ with fungal keratitis, probably because they mentioned pain. Ideally, in a viral keratitis, pain should not be mentioned. So the treatment for this is acyclovir. It is topical acyclovir, which is given in the form of 3% eye ointment, which should be given in the form of 3% eye ointment. But I think that in general, most of you would have got it right because this is an image that we constantly keep discussing. It is an image where the lesion is stained with fluorescein, examined under cobalt blue light. There are branches. There is a linear lesion with branches and there is terminal bulbs, right? So the answer is, yeah, it is acyclovir 3% eye ointment. I think probably that pain misled all of you because fungal corneal ulcer का ना presentation would not be like this. उस question में हमेशा trauma with vegetative matter या फिर farmer या फिर satellite lesion ऐसा कुछ जरूर mentioned होता है. Always it will be mentioned something like that. So I think this is probably the question here. Now the third one, this was an image-based question which said that this is an image of a clinical image was given and this is post-chemical injury, right? This is post-chemical injury. Now this is an image that we have discussed in our classes also. So see here, what you see is that there is an addition of the lid with the ocular surface. जो lid है उसका attachment है with the ocular surface, that is the conjunctiva and the cornea. And what is the diagnosis is, I think, what was the question. So this is called as a symblepharon. So was this there in the option? Symblepharon? हाँ, सो प्रीवियस क्वेश्चन में या तो एसाइक्लोविर या एंटीवायरल कुछ ऐसे कुछ whatever is there in the option you mark that. इसमें सिम्बलेफ्रॉन था ऑप्शन में. I hope that it was there because post-chemical injury, this addition between the lid and the ocular surface, whether it is the conjunctiva or the cornea or both, this is called as symblepharon. Okay, so this is the third question. Next one. Next is this. There was a case scenario described where they have said that there is a patient who has a fold of conjunctiva growing onto the surface of the cornea, and it is encroaching the pupillary area, all suggestive of a pterygium. So exactly वो बड़ा question कैसा था? बच्चे बोल रहे हैं कि एक बड़ा सा case scenario type था. Now what exactly the case scenario was is not very clear, but it was probably something like this, suggestive of a pterygium which is encroaching the pupillary area. And इसमें पूछा गया था what is the treatment. Now this is something which we all of you know. Question जितना भी घुमा के पूछे, basically question तो वही है ना कि what is the treatment of pterygium. So the treatment of pterygium is excision with conjunctival autograft. Excision with conjunctival autograft, and I am sure that this was there in the option. Excision with conjunctival autograft, right? So CAG option में था. Correct? This was the option. What will you advise the patient? मतलब वही ना, what will you advise the patient or what is the treatment? Yeah, it was on the nasal side was mentioned. हाँ, मतलब they would probably have mentioned that he is a person who has got lot of sun exposure, presence with a growth on the nasal side, a fold of conjunctiva on the nasal side, growing onto the cornea, blocking the pupillary area. What will you advise to the patient? तो इसका जो भी पूछे मतलब वही है कि what is the treatment of pterygium? It is excision with conjunctival autograft. अब देखो नेक्स्ट, आई बिलीव दैट ऐसा कोई क्वेश्चन आया था विच प्रोबेबली सेड दैट इट इज अ फीमेल पेशेंट, एंड नंबर 2 इसमें बताया गया था दैट देर इज अ रेस्ट्रिक्शन इन ऑक्यूलर मूवमेंट्स, there is restriction in ocular movements, and this kind of a picture was given जिसमें bilateral proptosis visible है, right? So female patient, restriction in ocular movements, and there is a picture which shows bilateral proptosis. अब ये भी देखो सीधे सी चीज को घुमा के पूछने वाली बात है basically. What is the most common cause of proptosis in an adult patient? The most common cause of proptosis in an adult patient is thyroid ophthalmopathy. Right, the most common cause of proptosis in an adult patient is thyroid ophthalmopathy. I'm sure this was there in the option और इसी को mark करना है. बाकी कुछ भी हो उससे कुछ फर्क नहीं पड़ता है, because if they say that if they've just given a picture, mentioned only that there is restriction in ocular movements and there is proptosis in the picture, और कुछ अगर question में नहीं है, तो we have to assume that we have to mark the commonest cause of proptosis in an adult, and commonest cause of proptosis in an adult is thyroid. Yeah. So I think that this was the question. What I talked to the number of students that I have spoken to, that is what I could gather. That nothing else was actually given in the question. Now next, this is a question which some students said that there was this kind of an image of a festooned pupil. Right now, why do we have this kind of a festooned pupil? Festooned pupil इसलिए है because there are these adhesions which are the posterior synechiae, right? So what are posterior synechiae? They are the adhesions between the cornea and the lens. Now they are seen in what? They are seen in chronic uveitis. Probably the question here that was asked was, what is the drug used to break the posterior synechiae, right? Drug used to break the posterior synechiae. Was this the question? Drug used to break the posterior synechiae? Something on those lines? Okay, previous question mein diplopia was also mentioned. Yeah, that is also possible. Because of the restriction of ocular movements, there may be some patients may present with diplopia. तो उसमें diplopia का भी mention हो सकता है. That's also possible. So tell me, इसमें chronic यही था ना question, that chronic uveitis है, like patient को festoon pupil है due to formation of posterior synechiae. Either it was mentioned in words or it was mentioned, just the image was given. So हमें ये सब सोच के लेना था. What is the drug used to break the posterior synechiae? वही था question. If this was the question, then the answer to this is atropine. Atropine is used to break the posterior synechiae, because you know that what does atropine do? Atropine, excuse me, it's a cycloplegic, and it is also a very strong dilator, right? So it just dilates the pupil, and in the process of dilating the pupil, it will just break up the posterior synechiae. They ask the diagnosis. The question was not which is the drug used to break posterior synechiae. वही था ना question, that what is the drug used to break the posterior synechiae, or what is the drug that is to be given in this question as to break the synechiae. I know you all are really very, very exhausted. Diagnosis था तो फिर it is chronic uveitis. I believe there were two questions like this. There are two questions जिसमें शायद तुम लोग confuse हो रहे हो. Atropine, cyclopentolate, epinephrine was there in the options. आई थिंक ऐसे ना दो क्वेश्चंस थे. एक क्वेश्चन ऐसा था और दूसरा क्वेश्चन शायद यूवियाइटिक ग्लोकोमा पे था, जिसके इमेजेस थोड़े से सिमिलर थे, जिसमें बच्चे कंफ्यूज हो रहे हैं. एंड बिकॉज यू आर लाइक ऑल ऑफ यू आर एक्सट्रीमली एग्जॉस्टेड, you are not being able to recall. But I believe that there were two questions. I have not been able to get hold till now of what are the two questions. एक question ऐसा था जिसमें ये पूछा था कि what is the drug that is to be used to break the posterior synechiae, and then there was another question with a very similar image जिसमें diagnosis पूछा था that the patient is presenting with this kind of thing and उसका IOP high है. Probably the answer to that question is uveitic glaucoma. Probably, I am not sure. Okay, so we'll just go to the next question. ये वाला question भी, it is a little confusing. It was the question, which of the following is not a contraindication for LASIK? Which of the following is not a contraindication for LASIK? Was that the question? So age less than 13 years. Age less than 13 years. Stable refraction for 1 year, corneal thickness of 450 microns, corneal thickness of 450 microns, and something else was there. Which of the following is not? Yes, there are two different questions of this uveitis. मुझे समझ में आ गया. We'll just recall this, get you a proper recall of this. Once we are able, once all of you are a little bit fresh, we will try to recall this again. Yeah, which of the following is not a contraindication for LASIK? ऐसे करके पूछा था. Which of the following is not a contraindication for LASIK? Which of the following is a contraindication for LASIK? Which of the following is a contraindication for LASIK? So which of the following is a contraindication for LASIK is obviously this, that is age less than 13 years. Age less than 13 years is obviously a contraindication for LASIK, because we know that LASIK should not, the minimum age for LASIK is greater than equal to 18 years. So ये corneal thickness का value कितना है I do not know, but the third option would have been something about corneal thickness, and the fourth option we are yet to recall. So which of the following is a contraindication for LASIK? Which of the following is a contraindication of LASIK? So contraindication for LASIK is age less than 13 years, because minimum age for LASIK should be 18 years. So then this becomes a really simple question. Yeah, contraindication अगर पूछा था तो age ही है. Age less than 13 years is obviously a contraindication. Now I think this was another question which said that there is a blunt trauma to the eye with a cricket ball. Blunt trauma to the eye with a cricket ball, and this kind of image was given. Blunt trauma to the eye. Yes. Okay, this question is fine. So contraindication was asked, and the contraindication is age less than 13 years or age equal to 13 years. Yes. Next question, blunt trauma to the eye with a cricket ball, and this kind of image was given. And इसमें पूछा था कि what is the diagnosis? So देखो, the diagnosis to this is hyphema. What is hyphema? It is blood in the anterior chamber. यही था ना image? So blood in the anterior chamber is hyphema. blood in the anterior chamber, that is hyphema. Blunt trauma, इसमें शायद vitreous hemorrhage, ऐसे hypopion, ये सब options में था. Probably vitreous hemorrhage, hypopion, all this was there in the options, but the answer to this is hyphema. This was the question, right? Image was different, I mean similar image, ऐसा ही था जिसमें blood दिख रहा था ऐसे in the anterior chamber. Yes, another option was hypopion. I know hypopion एक option था, vitreous hemorrhage एक option था, और एक option hyphema था. But blunt trauma में there obviously they would have shown some blood like this in the anterior chamber. Image was different. It may have been a different image, but what did they show? They probably showed that there was blood in the anterior chamber. It's unlikely that blunt trauma में और क्या दिखा सकते हैं? The image may have been a different image, but probably it showed this only. This was not the image. Whole pupil was blurred. That is possible, but blood ही था ना anterior chamber में. It is possible that the whole pupil was not visible. हाँ, ऑप्शन में विट्रस हेमरेज था, बट विट्रस हेमरेज ऐसा नहीं दिखता है ना. यू कैनॉट सी विट्रस हेमरेज. विट्रस हेमरेज यू कैनॉट सी फ्रॉम द फ्रंट. प्यूपल में भी ब्लड, देख ये पूरा ही ऐसे ब्लड हो सकता है. इट कैन बी लाइक दिस, फुल्ली फुल ऑफ ब्लड हो सकता है, बट आई थिंक द आंसर वाज हाइफीमा ओनली. Vitreous hemorrhage, you cannot have an image. You cannot have an image of vitreous hemorrhage. Chalo, and this was a tough question. Isme, this was the image of an instrument that was given, and it was asked that what is this instrument used for? So, what is this? What is this instrument used for? Now, this is a tough question. So, this is a picture of an instrument which is called as the Jackson's cross cylinder. This is called as Jackson's cross cylinder, and Jackson's cross cylinder हम कहाँ पे use करते हैं? This is used to refine the cylindrical power. It is used to refine the cylindrical power. Cylindrical power का axis and cylindrical power and axis, उसको refine करने के लिए ये use किया जाता है. I think this must have been there in the options, but it's a difficult question. So you may have had it. You may have got it right, या फिर तुक्के से किया हो तो ठीक है, बट आई थिंक दैट ये जान के किसी ने किया होगा, ये थोड़ा सा अनलाइकली लगता है मुझे. दिस वाज अ टफ क्वेश्चन. चलो, लेट्स गो टू द नेक्स्ट वन. नेक्स्ट वाज दिस. ये शायद आई थिंक यू कुड हैव प्रोबेबली डन दिस विथ अ लिटिल बिट ऑफ थोड़ा सा as you say, common sense से कर सकते हैं. That this is, they have given this image and they have asked that identify this complication post IOL implantation. Something like this, right? Identify this complication post IOL implantation. That was the question, right? So इसमें देखो, you can see that ये जो lens है ना, you can make out that this is the IOL, and जो IOL है वो अपनी जगह पे नहीं है. It is not in its normal position. वो नीचे की तरफ it is displaced downwards, right? Yeah. So this is subluxation of IOL. हमने subluxation of crystalline lens के images we have seen. We have seen the subluxation of the crystalline lens जो हमने मार्फन में, homocystinuria में हमने देखा है. This is a subluxation of the IOL. So this is something you could have answered a little bit from common sense, because वो जो lens है वो center में नहीं है, वो थोड़ा सा नीचे में है. So that's why this is subluxation of IOL. Okay, now the next question. Now ये वाला क्वेश्चन पता नहीं कि इमेज के साथ आया था या बगैर इमेज के आया था, बट दीज वर्ड्स वर मेंशन्ड इन द क्वेश्चन कि इट इज अ बॉय एंड देयर द पेशेंट प्रेजेंट्स विथ इचिंग एंड ड्यूरिंग द समर मंथ्स, ये सब था. So all this gives us a diagnosis of vernal keratoconjunctivitis. It gives us a diagnosis of VKC. अब ये इमेज के साथ आया था या इमेज के बगैर आया था? Did it come with the image or no? It came with the image. Okay, I think ये HT spots वाला image आया था, not the picture of cobblestone appearance, right? I think this was the image that came. Did it come with the image? But the question was actually simple. What is the treatment? The treatment of this is antihistaminics. I don't know what was there in the options, but I think, yeah, the one option that students told me was the treatment is mast cell stabilizers and steroids. Mast cell stabilizers and steroids. Yes, the question mentioned cobblestone appearance and the HT spots was there in the image. Correct. So cobblestone appearance was mentioned in the question and this HT spots was given in the image. है ना? नहीं, option में VKC नहीं था. Option was treatment. And the treatment is this, mast cell stabilizers and steroids. Mast cell stabilizers and steroids. Now, it is not oral. It is steroids are topical. Steroids are topical. I think options was oral antihistaminics, oral steroids, ऐसे options थे ना. So see, this is the treatment for this is largely topical. So it is topical steroids. So mast cell stabilizers, topical steroids, this is the option that you have to mark because rest of the options में ना oral दिया हुआ था. So the oral is never the first line for this. It is topical. Now this देखो, this is a question from last year's NEET PG. ये हमने recall के time भी discuss किया था. This is a picture of the same image, I believe, came in the NEET PG exam also, and we had discussed this in our recall. So this is a PYQ, recent PYQ जो repeat किया है. This is a simple clinical image, and the question was, what is the diagnosis? The diagnosis is, this is a dermoid. This is a dermoid. हाँ, there was an option of mast cell stabilizers plus steroid ना, वही answer है. That is the answer. हाँ, so this one question, this is a simple PYT from the previous. It's not even PYT, it's PYQ. ये last NEET का ही question है या INI का है, मुझे याद नहीं है, but उसी को the same image was given, I believe, and the diagnosis is dermoid. Now this question, this is the another question on uveitis, जिसके बारे में again I am not sure because lot of students said that इस type के keratic precipitates वाला image आया था. This was an image of keratic. There was an image of keratic precipitates which was suggestive of anterior uveitis, right? Which was suggestive of anterior uveitis. Now, the next question probably was what is the diagnosis, what is the investigation to be done? What is the investigation to be done? Now, I just want to ask you something. Isme, was it mentioned that it is a patient who has history of low back pain or there is history of morning stiffness? ऐसा कुछ mention था क्या इस question में? Was it mentioned? They have given a picture of keratic precipitates. There was no image. These last two questions. Okay, there was no image. There was a picture of anterior uveitis. It was only mentioned that there is anterior uveitis. Did they mention that it is granulomatous or non-granulomatous? Okay, there was no image, but did they mention that it was? Okay, again the same confusion. Both the questions in uveitis, they are having the same. Now see, the question is, it was not this image, it was a different image. Okay, okay. So there was a picture of keratic precipitates. Now see, the picture of keratic precipitates, when the keratic precipitates are so obvious, then it is actually a granulomatous uveitis. Then it is a granulomatous uveitis. Or granulomatous uveitis, every student who recalled this question told me कि HLA-B27 ऑप्शन में था और वही करेक्ट आंसर है. But now I am not sure. If you have this kind of a picture where you have these kind of large keratic precipitates, the uveitis is granulomatous. और अगर uveitis granulomatous है, so then the test is not actually HLA-B27 because HLA-B27 is non-granulomatous uveitis. So अगर granulomatous है ना, then the most common cause of granulomatous uveitis is tuberculosis. So tuberculosis के साथ suggestive अगर कोई investigation option में है तो वो आंसर है actually. But if they have mentioned that it is a non-granulomatous uveitis, if they have mentioned कि uveitis non-granulomatous है, or they have mentioned low back pain or something like that, that it's a male patient with low back pain, then the answer may be HLA-B27. But अगर ऐसा कुछ भी mention नहीं है and they have just given this image, then if the option would have had something on tuberculosis and that should actually be the answer. ये क्वेश्चन भी एक्चुअली क्वेरी ही है, ये भी बच्चों ने ठीक से रिकॉल नहीं किया. वील जस्ट फाइंड इट आउट लेटर एंड वील गेट बैक टू यू. Yeah, it was probably granulomatous is my take, that कि वो non-granulomatous नहीं था, it was granulomatous. चलो, there are like another, these last three questions were, so see, there is this question which says that a child has 6/6 vision in one eye and 6/60 in the other eye. 6/60 in the other eye. And इसके साथ what was given? Was this given that he has got +4 refractive error? ऐसा दिया था? Or did they give this image of a child with squint? Which of these was given? We are again back to that same question. देखो बच्चों, मैक्सिमम बच्चों को लगता है कि HLA-B27 ही आंसर है. HLA-B27 में ग्रैन्युलोमेटस यूवेइटिस नहीं होता है, इट इज नॉन ग्रैन्युलोमेटस. जबकि इस टाइप का अगर पिक्चर है ना तो वो ग्रैन्युलोमेटस है और वो HLA-B27 में नहीं होता है. सो दिस क्वेश्चन वाज नॉट प्रॉपर्ली रिकॉल्ड. लेट अस जस्ट वेट फॉर इट एंड देन we'll get back to the right answer. चलो, let's look at this. हाँ, so look at this one. इसमें क्या दिया था? Did they say that the child is having +4 refractive error? ऐसे कुछ दिया था? Or did they give this image? And they asked that what type of amblyopia? Which type of amblyopia is this? Did they give this image or did they say that the child has a refractive error in one eye? Did they say that the child has a refractive error? Okay, so there was no mention of refractive error, right? Correct. So there was no mention of refractive error and there was this image. And they mentioned that cover test was done. Yes, cover test was done. They mentioned that cover uncover test was done. And the child has 6/6 vision in one eye and 6/60 in the other eye. So the child is amblyopic, lazy eye hai or squint diya hua hai. So obviously this is what kind of amblyopia? It is strabismic amblyopia. It is strabismic amblyopia. There was no mention of any refractive error, I believe. There was only image. Yeah, so the image is there. The child is refractive error. Agar hai, maybe they must have said that it is the same in both eyes. Refractive error of +4 in both eyes or only in one eye. +4 in both eyes, right? So that means that it is +4 in both eyes. Okay, so it's 6/60 vision, but the patient has +4 in both eyes. In both eyes. So if it is +4 in both eyes, then obviously Yeah, if it is +4 in both eye, then it is not anisometropia. Anisometropia will be if there is refractive error in one eye and there is no refractive error in the other eye. अगर उस type का कुछ mention है तो वो anisometropic amblyopia है. इसमें if they say it's +4 in both eyes and they have given this image and they have mentioned cover uncover test, so most probably the answer is strabismic amblyopia. It is strabismic amblyopia. Refractive error was given. Refractive error is the same in both eyes or no? That is the question. It is +4. +4 in one eye or +4 in both eyes? Again, this is also, it was given in both eyes. That is what most students mentioned. That is what most students mentioned कि +4 दिया हुआ था, but it is in both eyes. So if it's in both eyes, then it's not anisometropic amblyopia. It is strabismic amblyopia. And the last question, everybody said that there is a question on glaucoma, but कोई उसको recall नहीं कर पाया कि क्या था question. I believe that there was a question on uveitic glaucoma. I think so. That is what it was. But this is one question which I have not been able to recall. Can any one of you help me with क्या था question? There was a question on glaucoma. I don't know, was it an angle closure glaucoma or was it uveitic glaucoma? This is a question which we have not been able to get through till now. So there are like 15 questions, jisme I would say that like too many images for a subject like ophthalmology. This is this is something which some students mentioned glaucoma wale question mein, that it is a female patient, or if I can modify it, elderly female patient. It's an elderly female patient, presents with pain, multiple episodes, recurrent episodes, something like this. Elderly female patient presents with pain, there are recurrent episodes. And if they mention these two words, that the anterior chamber is shallow, or they have mentioned mid-dilated pupil. ये चीजें mentioned थी क्या? Did they mention something like this? Most students just mentioned elderly female patient, pain है, recurrent episodes है. I think that probably it is, if this is the question, then the answer is acute angle closure glaucoma. Here, previous episodes of pain. There was no mention of shallow anterior chamber. No, there was no mention. Okay. Only pain, nothing else. Recurrent previous episodes. See, female recurrent previous episodes, high IOP. Elderly female pain, recurrent episodes, high IOP should be marked at acute ACG only, acute angle closure glaucoma only. Probably this might be the answer, but of course I don't know. There was another set of students who were saying that the answer was uveitic glaucoma. So difficult to say until and unless we recall the whole question. So we'll just get back to you with these three questions. ये जो last वाले questions हैं, glaucoma वाला question, ये uveitis का investigation वाला question, and this question on amblyopia. So these three questions could not be properly recalled, but rest I think you have been able to tell me. So ophthal was kind of okay. I will not say that it was really easy. There were lots of images. Few questions were easy, few questions were like difficult. So, but I would like to tell you something now. It's like late in the night. Just finish this recall session. There you have two more left, and after that, just let go of it for a while. अब हो गया है exam, अभी बस relax करो and relax till you have the results. I'm sure that it will be good. So thank you everyone. I will hand it over to Vinish sir. He will take it from here.
Thank you, ma'am. Thank you so much, ma'am. Okay, I'll take over. Thank you, ma'am.
Thank you, sir.
If I'm visible and audible, guys, everyone give me a thumbs up. Okay. So let me start with the recall from anesthesia. All right. And the questions from anesthesia were easy. All right. What I could get was five questions from anesthesia, and all of them were simple, pretty simple. Okay. Okay. So let's start with the recall from anesthesia. I'm also sharing my Instagram ID, my WhatsApp. Any questions are there, you can discuss with me directly. All the questions we've even taken care and we've discussed in the FMGE marathon which were there. All the questions from anesthesia. Let me start with the first one. A young woman came with a breast lump and was planned for surgery on an outpatient basis. All right. So they've asked here a patient coming in for surgery on an outpatient basis, which means they are asking about daycare surgery, right? A daycare anesthesia. Which IV anesthetic is going to be preferred? All of you know the answer. The answer here is propofol. Every time we have said when you don't know anything, the answer is propofol, propofol, propofol. It is always the most common used IV anesthetic agent. So here the answer is propofol. All right. So ketamine, thiopentone, etomidate were the other options, but the correct answer is propofol. And this is what we had discussed in our FMGE marathon 9 days back. Okay. 2026, where everywhere else the answer is propofol. In fact, I had a small video also on YouTube. These are all YouTube. Of course, we have covered in our classes, but I'm discussing about the YouTube. Even on YouTube, a 30-minute rapid revision, which I took for this FMGE student itself. Even here, can you see this? Daycare. What drug are supposed to be used? Propofol. All right. So all of you are already aware. Simple question. Daycare surgery, outpatient basis. What are you going to use? Propofol. Next question. Now here, I don't know exactly what image was asked, but everyone said Malampatti question was there. And Malampatti, the students that they said was uvula was seen completely. So if the uvula is seen completely, guys, in that case, it becomes Malampatti 1. This is what students said. Okay. So if this becomes Malampatti grade 1. All right. So they had said that identify the Malampatti grading and its significance for intubation. The options given were grade 1 normal, grade 3 normal, grade 3 difficult, and the fourth one they could not relate. Get it. I could not get it. So anyone who can help me out with the fourth option, please let me know. So I'll add that. Okay, so here what they said was you complete uvula was visible. So if the complete uvula is visible, the answer becomes 1, which is grade 1, and it is normal and it is easy intubation, which all of you are aware. Malampatti class 1 and normal intubation. So again, the same thing. All of this has been discussed even in the marathon session that we took. Can you see this? Malampatti 1, easy. Malampatti 3 and 4, difficult. All of them have been covered. Forget about the videos. They are there on YouTube also. Right? The same thing, the 30-minute rapid revision, it's there here also. This was Malampatti class 1. I think all of you agree with me. If you can help me with the fourth option, then we can have this complete question also, right? But that's too much to ask. But grade 1 difficult was the fourth option. Very good. Thank you, Doctor. Grade 1 difficult, right? All of you could recall that. So fourth one becomes grade 1 and difficult, right? Grade 1 and difficult. Thank you, guys. Thank you. So we've completed this question. Second question also done correctly. Okay, got the fourth one. Thank you, all of you. The next one. A patient is undergoing surgery and sudden drop of CO2. Exactly same words. If you look at this, see this. The same words is there on our FMGE marathon. Sudden drop of CO2, and the answer is embolism. We have already have it covered on the YouTube marathon. Okay, you have this, right? So a patient is undergoing surgery. There is sudden drop of CO2. Capnography question. I think two options were hyperthermia, hypothermia, embolism. The correct answer here is embolism. Right, guys? Anyone with the fourth option? If anyone can recollect, I know you're all tired, but if you can just help me out with the fourth option, right? But answer if it is that if a patient is undergoing surgery and sudden drop of CO2 means the capnography, the graph has come down to 0, which we call as sudden drop. And this sudden drop of CO2 means it is signifying embolism from the options which were given. Okay, guys, thumbs up if this is the right thing. If there's a mistake in the question, do let me know. Or mistake in the options. So I was very happy this question came because we have discussed it since so much time. You know that embolism is very important. And hopefully this was something that we've discussed for quite some time that should have been there. कोई करेक्शन तो नहीं है? No one is answering anything, guys. So may I go forward? ठीक है. So here we'll just stick to it. And anyone if you can help me out with the fourth option. Suddenly your messages are not seen. Okay. All right. So let me go forward to the next one. Okay. And question number 4. Simple question. Okay. Someone said hypotension. Okay. Great. Dr. Sharat Shine said hypotension. Very nice. So we finished off this question also. I understand. Dr. Fuzel, I understand. Not very easy. But यहाँ पे देखो डॉक्टर शरत ने बोला तो हमको चौथा ऑप्शन भी मिल गया. We got the fourth option also. Right? So we got a good recall actually. All the students have had a great recall from anesthesia. Hypotension. हाँ मुझे पता याद नहीं रहेगा. I totally understand यार. Sorry, it's asking too much from all of you, especially sitting through the recall also and through the exam. Sorry guys, but yes. So hypotension, and let's go forward. I will not waste any more time. The two more questions from anesthesia. Sir, I think one option is anesthetic faulty. Anesthesia faulty. अच्छा, तो instead of hypothermia दूसरा ये होगा anesthesia faulty. मतलब something wrong in the anesthesia machine. Anesthesia machine fault, something like that. Okay, ये भी हो सकता है. Very nice. Instead of hypothermia, it can be anesthesia machine faulty. Very nice. Dr. Sovereign. अरे अपना नाम लिखोगे तो हमको पता तो चलेगा कौन बोल रहा है. Very nice. So this is question number 3 done. Question number 4. Again, every time we've discussed this, identify the instrument shown in the image. Once they are asked for Verey's needle, isko change karke they asked you 2E needle, right? And which is the epidural needle. And again, all covered in our FMGE marathon. As you can see, epidural needle is thick. It has got 1 centimeter markings. All covered here this time in FMGE YouTube marathon. Same thing. Again, covered in the 30-minute rapid revision that I have taken. All these points are covered there also, right? So correct answer is the 2E needle or the epidural needle. Fourth option, epidural. अरे नहीं, 2E needle को तो epidural बोलते हैं. This only becomes the epidural. So what is the fourth option? Okay, so the point is they didn't ask you 2E, they asked you epidural needle. तो ये हो गया अपना epidural needle. तो fourth option क्या हुआ? Verey's needle, spinal needle. Fourth नहीं पता. चलो, I'll not waste any more time of yours. If you can recollect, let me know on my. I've given you my number, my Instagram ID. There was no option of 2E. अच्छा हाँ 2E नहीं था, epidural था. ठीक है, my mistake. Done. So epidural needle को correct कर दिया मैंने. Okay. D option मुझे अगर कोई बता सकता है कि what was the fourth one then? Spinal. हाँ epidural था बस. They don't ask the name of the needle. They just show the needle to ask whether it was okay. Okay, the question is different. Okay. All right. They show you the needle and they ask you it is used for what? तो ठीक है यार, मेरे को स्टूडेंट्स ने शायद जैसे बोला वैसे. So this is used for what? It is used for epidural, it is used for subdural, it is used for spinal and the fourth one. Right? ये हो गया fourth question हमारा anesthesia से. Right? Epidural was the option. Now okay guys. ठीक है, तो ये ऑप्शंस नहीं थे. इंस्ट्रूमेंट दिया था and they asked you where it is used. It is used for epidural, subdural, spinal or for what? Right? तो फोर्थ नहीं था, तो यहाँ पे the correct answer is epidural. The correct answer is epidural. So this is the fourth one and all of you are correct. It is just that you are trying to remember the points. If anyone remembers the fourth option, let me know. Third or fourth option. Done? Not wasting any more time. This is the epidural needle, all covered on our YouTube. Epidural था और fourth option कुछ था. छोड़ दो. Fourth option. अच्छा. तुम लोग ने भूल भी तो नहीं रहे हो, याद भी कर रहे हो. मैं तो सोचा आगे जा रहा हूँ, फिर तुम मुझे वापस लेके आ रहे हो. आई एम ट्राइंग टू गो फॉरवर्ड and then you people nicely are recollecting. Great यार, great recall. Biopsy, right? Biopsy था. Dr. Parvind says, अच्छा बस हो गया. Let's not discuss more. It's fine. You guys are tired, but it's fine. Epidural, subdural, spinal, biopsy. 4 हो गया. This needle is used for epidural. All right. Identify the use of the instrument. Tissue biopsy needle was the fourth option. Are very nice. Very nice, guys. Perfect. So epidural, subdural, spinal, and tissue biopsy was the fourth option. Dr. Shankar Gowda and everyone is saying, सब लोग ने आंसर दे दिया. Correct. All of you have given the answers. Answer is epidural. You are all right. You don't even have to remember the other options. This is for our sake. But all of you have answered this answer correctly. ठीक है? So this again we have covered. The last one again simple. A COPD patient is planned for an abdominal surgery. What will you do to reduce the risk of post-operative pulmonary complications? 3 options what students shared with me was give antibiotics, wait for 3 months, and stopping of smoking or smoking cessation. The point is, COPD patient who's a smoker, you would ask the patient to stop smoking for at least 4 to 6 weeks prior to surgery. Okay. So fourth option, again, students could not recollect, which I understand. But out of these three options, the correct answer would be stopping the smoking. Again, all of these points have been discussed. So management of the pre-existing drug therapy, and we already discussed, again, as I said, on the YouTube, and this is smoking is stopped 4 to 6 weeks prior. All right. So I think all of you might have marked correct answers from anesthesia. If there are some difficult subjects, I think anesthesia would have covered for that. All the 5 questions from anesthesia were simple, they were easy, and you would not have taken time to answer them. All of you are correct, right? So this is C. Any other answer that anyone can recall? Any other question? So these were the 5 questions from anesthesia, guys. इसका fourth point मुझे नहीं मिला from whatever students could recall. Bechare, you guys have recalled so much. All right. So I think I'm done. These are the 5 questions from anesthesia, and they were all very simple. I am sharing my Instagram ID, my WhatsApp number with you in the PDF. If there are any more questions, you can ask me directly. कोई और question होगा तो मुझे अभी पूछ सकते हो. Otherwise, you can text me on Instagram or on my number. All right. So let Dr. Sandeep take over, and thank you so much. Thank you. All the best, sir. Bye bye.
Hi, sir.
And bye, students. Let us know when you got the marks. Bye.
All right, guys. Right. So let's quickly run through the surgery recall. Most of the questions were discussed. Nothing new or surprises were there. I'll try to roll it across or in a quick succession. I'll not take much of our time. In the question number 1, you have a patient with stab injury to the neck that is going to extend from the cricoid to the angle of the mandible. When you say this is the suprasternal notch you have, this is the cricoid, and this is the angle of mandible and the base of the skull. So between the cricoid and the angle of the mandible, it is going to be zone 2 injury. So answer here is going to be zone 2 injury. If they ask you the management of zone 2 injury, if the patient is stable, then it is only going to be observation. You're only going to observe. But if the patient is unstable, then you will take the patient for exploration. So recall whether it was stable or unstable. Right. So based upon this will be the answer that is going to be there. Right. Now, next question, the most common type of congenital hernias. Again, congenital inguinal hernias or the congenital hernias or inguinal region is basically because of patent processus vaginalis, right? And that is going to be arising from the deep ring into the superficial inguinal ring. Anything that goes from deep ring superficial is going to be your indirect inguinal hernia. A tumor measuring of 4.5 centimeters when you talk about the breast cancer staging. We know that T1 is going to be less than 2 centimeters, so it is going to be a T2 disease, which is going to be between 2 to 5 centimeters, right? Axillary lymph node was present, which was mobile. So when I say mobile node is going to be N1, which is an ipsilateral axillary group of lymph node. Ipsilateral axillary group of lymph node, but remains mobile. Right. So when you talk about stage 1, it is going to be T1 N0 M0. 2A is going to be an upgrade from here. That's going to be T2 N0 M0 or T1 N1 M0. Right. Then you have 2B. 2B is going to be T3 N0 M0 or T2 N1 M0. Now we are having T2 N1. T2 N1 is going to be 2B disease. So answer here is going to be 2B. Answer here is going to be 2B disease. This we have already seen in our previous exams also. I've discussed it in a very almost every session that we have. Cobra head appearance is seen in uretrocele. This is the image based question. You have seen the same image. The varicose vein, what is the most common vein involved? It is the great saphenous vein. We have dealt with that also. Telangiectasia of the lower limb corresponds to which classification on the SEEP classification? I've been telling you again and again. Telangiectasia as well as reticular veins is going to be your C1. Varicose vein is going to be C2. A patient presented with lacerated wound but no active bleeding. What is the triage? If there is a lacerated wound without any bleed that is present, it is going to be green, and then you can take it as delayed presentation. But if it has an avulsed injury, then it will directly become into, see, all avulsed injuries which are going to be present. See, red is going to be absolutely important. Then comes yellow. So if it is avulsion or degloving injury, or the degloving injury, then it is going to be yellow. But if it is only laceration, then it is going to be simple green in color. This CBD injury has been dealt before. We already covered in FMG Marathon 2026. We have shown you before also. if there is less than 1/3 of the circumference, as you can see, less than half the circumference, right? More than half or less than half. So 1/3 is always less than half. So here you have to convert, then put that into T-tube placement, right? इसमें कोबरा हेड ऑप्शन में था बेटा कोबरा हेड और एडर हेड अपीयरेंस इज द सेम थिंग एज यूरेट्रोसील नो laceration with bleeding. See, if it is associated with fracture, then it is red. If it is not, then it is going to be yellow only. Sure. Meshing is done in which type of skin grafting? It is going to be in partial or split thickness skin grafting. That is going to be a Thierch graft. Right? A patient with duodenal ulcer, which is the most common artery, we've already discussed it, is going to be gastroduodenal artery, is the most common source of bleeding here. On an X-ray, if you see a coin in the esophagus, what is the orientation of the coin? The orientation of the coin will be flat and coronal surface. That is on the coronal cut, it will be flat. So in an AP or a PA view, you will get N face in esophagus. That is complete face in esophagus. Whereas trachea, you will see the lateral face. Trachea, it is going to be lateral. ठीक है. This Sudhama was also discussed that we have discussed in previous exam also. If there is presence of a swelling at the at the bridge, I mean right across the edge, it is going to be your angular dermoid. Then your patient with chronic pancreatitis is normal amylase and lipase. Now, if there is no symptomatic component and it is a normal amylase and lipase, what is the most appropriate management? You will not do any surgery here. There is no role of any chemotherapy. It is only going to be pancreatic enzyme supplementation. But a left gastric artery will not be the source of bleeding in the duodenal ulcers. Duodenal ulcers अगर specifically पूछा है तो gastroduodenal artery ही answer होगा. A patient with ductal carcinoma in situ undergone breast conservative surgery with clear margins. If the margins are clear, you don't need to do anything further. So there is observation only. Paget's disease, we already told you the underlying malignancy is going to be an invasive ductal cancer. Repeat exam question, nothing spectacular about it. During nasogastric tube insertion, the obstruction encountered at a 40 centimeter mark. What does it correspond to? 40 centimeter corresponds to diaphragm, right? 15 centimeter is the cricopharynx. Your 25 centimeters is going to be the arch of aorta. So arch of aorta will be seen at a 25 centimeter mark, right? It is going to be 25 centimeter. Diaphragm is at a 40 centimeter. You have the left main bronchus also at a 25 centimeter. But a sausage-shaped pancreas with malnutrition indicates autoimmune pancreatitis. If they have asked you the sausage-shaped pancreas, if they have given you a sausage-shaped pancreas, if it is a sausage-shaped pancreas, then it is an autoimmune pancreatitis. It is an autoimmune pancreatitis with malnutrition. The answer will still remain the same. It is going to be pancreatic enzyme supplementations. Now, a 2-year-old child with rectal prolapse, what is the management? Remember, for the child, initial, it is going to be digital rectal repositioning or digital repositioning. If it fails, then you can go ahead with Thierch wiring. If there's a question on Zenker's diverticulum, kindly recall it. If this was the image given, if they've asked you what type of it, it's a false diverticulum, pulsion, it is cervical diverticulum, it is seen from the Killian's triangle, it is left-sided. Barium swallow is the investigation of choice, and management is going to be less than 3 centimeters diverticulectomy. And if it is more than 3 centimeters, then you do an endoscopic Dolman surgery. The same thing has been discussed in our sessions also. Another question, what investigation is performed to identify extrathyroid spread for thyroid neoplasm? Extrathyroid spread, we always do a radioactive iodine scan with iodine 123, which is also called as the whole body iodine scan. It is also called as the whole body iodine scan, right? Pages is okay. Question number 20. Post-thyroid surgery, women is unable to sing in the temple. What is the likely injury? If they're not having if there's a loss of pitch, the loss of pitch is because of damage to the external branch of the superior laryngeal nerve. If unilateral recurrent laryngeal nerve, then there is hoarseness of voice. Then there'll be hoarseness of voice. Bilateral recurrent laryngeal nerve will result in voice distress, right? So here the answer is going to be external branch of the superior laryngeal nerve. Manish says there was edema mentioned in the SEEP classification. But agar edema around the ankle is going to be present, then the scenario changes, right? If there is edema around the ankle, then it will become a C3 class, right? So C, tell me whether the edema was present or not. ठीक है? See, the objective of the recall is not to teach you right now. It is to give you a possible question that has been recalled by the students and the possible answer. Now, you are a better judge of what question you saw and what answer that relates. I just want you to understand there were 20 to 25 questions in surgery. There's a lot of overlap, so I just took only purely surgical questions. But otherwise, there are approximately 32 to 33 questions which comprised of all allied surgery topics. Your job is to look through this question, see if it is relating. We've already discussed it, you know the answer, right? My job was to give you a quick recap. You know, I don't want to hold you for a very long time. You have done enough, you have done good. So don't worry, sit back, relax, enjoy. This was the last session in the entire recall. I mean, surgery guys are the backbone, so hence we are standing at the end. And I thought I will conclude this session. I wish every single person of you a very, 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 very all the best for the results. Now, until the result comes, the world is yours. You have worked really hard. You have put every single day for the last few months or years together. So hence, it's your time to enjoy. कल सुबह से सब कुछ भूल जाने का, आराम से उठने का, खाना खाने का, पीने का, मूवी देखने का, सोने का और चिल करने का, ठीक है? उसके बियॉन्ड कोई जरूरत नहीं है. सिस्टिक हाइग्रोमा पे क्वेश्चन था. यस आई नो, इफ सिस्टिक हाइग्रोमा का मैनेजमेंट ना, इफ देयर इज अ स्वेलिंग इन द पोस्टीरियर ट्रायंगल ऑफ द नेक, इट इज गोइंग टू बी स्क्लेरोथेरेपी. जस्ट रिमेंबर दैट, ठीक है? चलो, सो विदाउट वेस्टिंग एनी फर्दर टाइम, अब घर जाओ, सो जाओ, चिल करो, कोई दिक्कत नहीं है. टू ब्रिंग ऑल दिस रिकॉल इनटू सच अ पैकेज्ड वे where organizing all 19 faculties and putting together, I mean, hats off to our backhand team, the entire team at MedEd, starting from all the way from our technical support to academic support. Everybody was amazing. I would like to give a special shout out to Dr. Hara Prasad and Dr. Anto, who has been looking through the entire process. They've been helping out every single student who contributed to recall. Thank you so much. I know it was not easy. Last but not the least, our hero who is behind every single thing that goes smooth is Aditya. I mean, without Aditya, it was not possible. Thank you so much. I mean, that guy's been staying, all up. Uski tabiyat bhi kharab hai, but he has stayed across, did everything that is required, and it was smooth and amazing. So shout out to Aditya as well, and all 19 faculties who have put forward such a beautiful effort. I hope you use this recall as only, a way to understand and analyze your paper, but not a final component. कोई ये मत सोचना कि रिकॉल में देख के उसके इतने नंबर आ रहे हैं, उतने नंबर आ रहे हैं. रिकॉल इज जस्ट अ वे फॉर यू टू कॉम्प्रहेंड. विद दैट, थैंक यू सो मच. गुड नाइट and have fun, right? If anything is there, we at MedEd are available all the time. You can connect to us on the Instagram, Telegram, as well as on our personal DMs as well. With that, signing off. Good night. Take care. Bye.